Just want to say thanks so much for being here with us on News Now. As you can see, we do have some media ready to go as President Donald Trump and his team are supposed to be stepping out in about 10 more minutes here. If we do hear of the time getting pushed back once again or any updates on how soon the president and his team will come out, of course, we'll update you right here on News Now. Until then, what I'm going to do is, instead of looking at that interactive map, I'm going to play another update. Since we do have so many coming in from across our country, I'm going to take us out to Connecticut, play their latest update on COVID-19 right here in the U.S.
All right, good afternoon, everybody. I'm here with Paul Mounds and Josh Jabal, and a couple of guests I'll introduce to you in a few minutes. Quick daily summary on COVID-19. These numbers are bouncing around a little bit, and I just ought to tell you, when you see 1,853 positive cases, you go, my God, that's an awful lot, or 204 fatalities, that's an awful lot. What's going on? In this case, the CDC changed their definition in the last few days of both a positive case and somebody who dies of complications related to COVID, or if somebody had COVID-like symptoms and passed away. So we're just truing this up so we keep with the CDC and federal definitions so you know where we are on a nationwide basis. You know me, the other interesting number in terms of direction is hospitalization. Over the weekend we went down, and that hasn't happened 2 days in a row since the start of the crisis. This time we went up a little bit, but you'll see as we go forward, the trend line is still down. Hartford, the top line is Fairfield. You can see there we definitely have bent the curve on the way down, hit the apex. I think we feel fairly confident about that. We're maybe 10 days behind New York City, a week behind New York City. Next line there is New Haven. They're maybe 10 days or so behind Fairfield County. That line is flattening out. You see, we have good capacity in those hospitals, and they're able to help out Hartford a little bit. The blue line at the bottom, Hartford is still picking up, and that created small increase overall in our hospitalizations. This chart again, hospitalizations is the lead metric we can tell for how we're doing, but I'm going to give you some new metrics in a few minutes. But the 3-day moving average is down. That is good news. That says that we have good capacity in our hospitals, and the degree to which hospitalization tells us something about the overall infection rate. That's a good trend line. But we're not out of the woods. And I just wanted to put this chart on here to remind you that these countries were all 2 weeks, 4 weeks, 8 weeks in front of the United States in terms of getting hit with this pandemic. We could learn a lot from their responses, and we can also learn a lot from what they didn't do right. Each and every one of them thought that they had this crisis under control. They loosened up on their social distancing, and each and every one of them now has seen an increase in COVID-related infections yet again. So we're going to monitor this very carefully. What I really would like to do, if I could, is give you an idea of what more we can do as we prepare for our May 20th date. You know, every week now, every Thursday, you're going to hear from our Reopen Connecticut team. And what happens between now and May 20th that gives us more information that allows us to make the right decisions so we can slowly, on a phased basis, reopen our state and do that very safely. And hospitalizations is one way to tell how we're doing, but it's sort of a blunt instrument. And I'll tell you a few other things we're doing, including testing or over and above testing, to give us a better idea of how the state is doing, how we're bending the curve, and where we can start up. First of all, I'd just like to tell you about howwefeel.org. How We Feel is created by an amazing MIT neuroscience engineer and a number of people in epidemiology and infectious diseases. And we're going to you'll be able to meet him in just a few minutes. But right now with How We Feel, it's spread virally around the country in a computer science way, not an epidemic way. And what they've done is they're able to test different symptoms. You self-report on a voluntary basis symptoms, everything from cough, fever, and the such. You get that posted. We have thousands of people here in the state of Connecticut using the howwefeel.org app right now. And I'd like to say that we are the first state to officially sanction How We Feel as an official partnership. How We Feel is going to take information from all over the state. If more and more of you sign up for this app, it takes just a few minutes to put in your basic symptoms. And in turn, the leaders there, epidemiological, at How We Feel, will report back to the Department of Public Health here in our state and give us the best information they have in terms of what they see from these early symptoms going forward. More on that in a minute. Next, after the How We Feel app, we're doing a lot with thermometers. We've just got our first 3,500 smart thermometers. They're Bluetooth enabled. You take the temperature of yourself and your family in the morning and in the evening. That in turn connects to your phone. That goes up to the cloud. So along with How We Feel, we're going to have a temperature map of what's going on in the state of Connecticut. We'll see where those symptoms maybe are moving a little bit. Maybe they're followed by fevers in a more official way. Tells us where the next potential hotspot should be or can be. I mean, right now we know that just through infections and hospitalizations, New York is down and Fairfield County is down. Hartford is up. We know that Boston is up right now, so we worry about what's coming in from the east at this point. And we look around the rest of the country, that Louisiana is down, or more particularly New Orleans, but Chicago is up. But within our state, there are respective hotspots, and How We Feel and our thermometers will allow us to test that. In addition, Josh has ordered tens of thousands of fever meters, a fever thermometer. And those are going to be incredibly helpful for us just to make sure that when you go into a manufacturing site, a Pratt & Whitney or Electric Boat or Sikorsky or any of the smaller manufacturing, anybody with a temperature more than 100.4, not allowed in. Doing this what we can in order to better protect you. And over time, we may find that we can open up our stores and retail and big box retailers a lot faster and sooner and more safely if we have that fever meter, just to test people on their way in and make sure you're not likely to be contagious. We had a good phone call today with Vice President Pence's task force. A lot of conversation about testing as well. You can imagine, you know, some frustration from the governors that there's not more of the testing ingredients out there that you need. You know, the White House is saying you got a lot of capacity there, but we've got the razors, but we don't have the razor blades, if you can follow my analogy. And there, we're working hard to make sure that we're able to do more of, in particular, the PCR testing that tells you whether you're infected or not. And one good thing is the federal government is getting out of the way, and they're loosening the regulations for us, allowing the states to do be a little more entrepreneurial when it comes up to getting the swabs and it comes up with getting the reagents. And they've now said you can come up with your own swab and you can use cotton, American cotton if you want to, just like you have on a Q-tip. And opposed to some of the other liquids they use to transport, you can now use saline solution. Test that with Yale New Haven. Test that with UConn. Make sure it meets your protocols, but they're giving us a little more flexibility to be able to take the lead there. A final thought on testing. Well, I'll tell you, I thought I finally was able to figure out healthcare when the vice president was talking about, so this is going to be based upon IRR. And I said, as a business guy, great, an internal rate of return. No, IRR stands for the International Reagent Resources. They're the ones that's setting the standards by which a state like Connecticut with great healthcare labs and resources will be able to figure out how we can accelerate testing by coming up with our own reagents and transportation media. Abbott Labs, I was down there on Friday for the first day, and they are now doing hundreds, ramping up to 1,000 tests a day. This is going to be a big part of our testing future. I thanked, first of all, the head of CVS, because CVS is sponsoring this, saying, it's amazing what you're doing in New Haven. I'd like you to be able to provide a lot of this drive-through testing in other communities, starting in Hartford as soon as you can, since that's where the surge is. And I'll tell you, President Merlot gave you a real compliment. He said, we've set up a few of these around the country, and thanks to the Connecticut Guard, thanks to the Connecticut State Police, this went very smoothly. It was up within 72 hours. We're now doing the testing, and you're going to be a priority to expand. Of those tests, I was a little sad to see that Caucasians tested positive about 8%. African Americans tested positive about 35%. And we're going to do a much better job as we can to make sure that we have testing available for all of our people, especially those in the most diverse communities in our cities, and get them prompt attention to medical care. Make sure that nobody is left behind there. Finally, with Vice President Pence, we also said, what are you going to do with all this testing? It's going to be followed by contact tracing, and make sure that once we find out somebody maybe is infected or liable to be infected, we can make sure we figure out who else they may be met with over a period of time. The CDC is sending thousands of contact tracers out right now. You know, to me, there may be some civil liberties issues there, and it seems very manually intensive for a state like Connecticut with 3.5 million people, not to mention New York. So we're also looking at other ways that we can do this, as well as people power. One, as you know, is that Apple and Google are coming out with their app. I think it's going to be within 3 to 4 weeks. So the president mentioned it a month or so ago. And this will say for anybody who opts in, anybody who wants to be notified that they recently came into contact with somebody who was later found to be a COVID carrier, you'll be notified. And you'll know that you should at least self-quarantine going forward. Finally, in the Vice President's call, we talked a lot about the business side of what's going on here and how we can provide support for people going forward. As you know, the Paycheck Protection Program, that was tapped out last week. And there's a real urgency to get another $250 billion. That's the money you need to help our small businesses power through for the next couple of months. David Lehman gave us some relatively good news that while by no means did all of the companies that need it get it, we did have over 18,000 Connecticut small businesses get access to that money. That's about $4.2 billion in aggregate. So we did relatively well compared to some of our peer states out there. The supplemental, which is the next bill that will be coming out of the Senate, obviously the governors were pushing hard for $500 billion to help pay for state and local governments in terms of lost revenue. And I had an occasion to mention to the Vice President the two other things of importance to our state and all the other states. One is the unemployment compensation funds. Fortunately, we had put another $150 million into it over the last year and a half. So we are relatively well-funded, but by no means well-funded, by no means not enough to deal with this, the level of unemployment claims that is hitting us. And said if you make that a loan to the states, which is what you traditionally do to true up that'll be a loan that's paid back by small business over the next years. and that's no way to dig out from under a recession. Make that a grant. And secondly, we're talking about a long-term loan to our state pension funds in general, those that are, now underfunded in part thanks to, the downturn in the stock market. And those are two things that the Vice President is going to be looking at as potentially part of our next supplemental. But let me take you back to howwefeel.org, because this is an amazing app that's going to put Connecticut at the very forefront in anticipation of more testing, being able to tell how people are doing, how they're feeling, and that's an early indicator of where our hotspots are. And first, I'd like to ask Feng Zheng to speak. He's a professor of neuroscience at MIT. He's been a leader here. We're so proud to be able to call you a partner and take the lead in making sure that How We Feel is spread to, maybe hundreds of thousands of Connecticut residents taking the lead. Professor?
Hi, Governor, thank you very much for having me be a part of your press briefing. I'm from a project called How We Feel, and my day job is a professor at MIT. But since the beginning of the pandemic, my colleagues and I became very concerned about the virus and how quickly it is spreading through the community. We also recognized that there was a lack in testing capabilities. So we thought, can we come up with a different way to be able to track the spread of viruses? By talking with a number of colleagues and a number of concerned colleagues who want to volunteer to put together a new solution, we formed a nonprofit organization called the How We Feel Project. And through this project, we developed a mobile application called How We Feel, which is available through the Apple iOS store, the Android App Store, as well as via the web, so that people can download this app, whether they're healthy or they are affected by COVID-like symptoms. They can provide information to help researchers and also policymakers better understand what is happening with the virus in their local community. Through this app and also through the web app, we ask individuals to contribute information, not their personal information, but only their zip code, as well as the symptoms.
Thank you very much, everyone. Thank you. Following the release of our reopening guidelines, governors across the country are looking forward to phase one and announcing plans for an economic resurgence. We're going to have a resurgence, too. At a time when millions of American workers and families are struggling with the financial consequences of the virus, it's critical to continue the medical war while reopening the economy in a safe and responsible fashion. During this time, Americans must maintain strict vigilance and continue to practice careful hygiene, social distancing, and the other protective measures that we have outlined and that everybody's become very familiar with. We continue to be encouraged that many of the areas hardest hit by the virus appear to have turned the corner. For example, recent deaths are down very, very substantially. You can compare that with their peak not so long ago, and you have numbers of 30%, 25%. In Detroit, as an example, it's down by over 50%. Congratulations. And in New Orleans, where they've done a terrific job, they're down 65%. 30 states have just one case or less per 1,000 people, far fewer cases per capita, as an example, than Germany, the United Kingdom, France, Italy, Ireland, Switzerland, Singapore, Belgium, Spain, Norway, the Netherlands, Austria, Sweden. My administration continues to press Congress to replenish the enormously successful Paycheck Protection Program, which has impacted 30 million American jobs. We hope to have an agreement very soon, and hopefully tomorrow the Senate's going to be able to vote. A lot of progress has been made on that, tremendous progress. It's a great plan. It's a great plan. It's helped a lot of people. So we hope to have a vote maybe tomorrow in the Senate. And based on the record low price of oil that you've been seeing, it's at a level that's very interesting to a lot of people. We're filling up our national petroleum reserves, the strategic reserves, and we're looking to put as much as 75 million barrels into the reserves themselves. That would top it out That would be first time in a long time it's been topped out. We'd get it for the right price. We're also pushing for the deal to include an additional $75 billion, our deal that we're talking about, $75 billion for hospitals and other healthcare providers. Many providers and their employees have taken a huge financial hit in recent weeks, and visits, elective procedures, surgeries, et cetera, were canceled. We think that they can all get back online. They'll get it done. The hospitals have really been fantastic. The hospitals, they've stepped up to the plate. They really done a great job. We appreciate it so much. For areas less affected by the virus, we've issued new recommendations about how to safely resume elective treatments. HHS has also distributed the first $30 billion in direct payments to 1 million healthcare providers across the country. We've also invested $1.4 billion in community health centers to ensure our most vulnerable communities, including many African American and Hispanic American communities, have access to the services and testing that they need. Earlier today, Vice President Pence spoke with governors from all 50 states about our unified effort to defeat the virus. He had a great call. It was a great call, very positive in, I'd say, every way. Prior to the call, we provided each governor with a list of the names, addresses, and phone numbers of the labs where they can find additional testing capacity within their states. Many, many labs. We're providing you with a list. We'll show it to you now. If you need it, we'll give you the details. But hundreds and hundreds of labs are ready, willing, and able. Some of the governors, like, as an example, the governor from Maryland didn't really understand the list. He didn't understand too much about what was going on. So now I think he'll be able to do that. It's pretty simple. But they have tremendous capacity, and we hope to be able to help him out. We'll work with them and work with all of the governors. Similar to the situation with ventilators, states need to assess their complete inventory of available capacity. Some states have far more capacity than they actually understand, and it is a complex subject, but some of the governors didn't understand it. The governor, as an example, Pritzker from Illinois, did not understand his capacity. Not simply ask the federal government to provide unlimited support. I mean, you have to take the support where you have it, but we are there to stand with the governors and to help the governors, and that's what we're doing. And they have a tremendous capacity that we've already built up, and you'll be seeing that. We're going to be introducing a couple of the folks in a little while to talk about it. I want to draw your attention to Governor Cuomo's remarks during his press conference today. He said the president is right. The state's testing is up to the states to do, which will implement the tests and logistically coordinate the tests. We have about 300 labs in New York, and they're great labs, actually. And it's my job to coordinate those 300 labs. I think the president's right when he says that the states should lead, and the governors they're really getting it together in New York. A lot of good things are happening in New York, and I think the governor's going to come in to see us tomorrow. He's coming to the Oval Office tomorrow afternoon. Andrew is going to be coming in with some of his people, so we look forward to that. Some of the articles that just recently came about, if you remember, and I put out a statement today, for a month it was all ventilator. That's all people could talk about was ventilators. And we did a great job with that. We built a lot of ventilators, to put it mildly. We have so many now that at some point soon we're going to be helping Mexico and Italy and other countries. We'll be sending them ventilators, which they desperately need. They were not in a position to build them themselves. But we have thousands being built. Every state they have the ventilators. If they don't, we have almost 10,000 in our Federal Reserve, our stockpile, as they call it. And we did a great job with the ventilators. Unfortunately, the press doesn't cover it other than the fair press. But so then you say, gee, they need ventilators. We don't need ventilators. And that's under pressure we did that. Nobody that needed a ventilator in this country didn't get one. And a story that just came out, how the media completely blew the Trump ventilator story. I'm sure you'd love to see that. That's by Rich Lowry, respected journalist and person, how the media completely blew the Trump ventilator story, which unfortunately it did. And here's another one that just came out. Kyle Smith, the ventilator shortage that wasn't. The ventilator shortage that wasn't, because we got it fixed. And we're also going to help the states, by the way, stockpile ventilators, so if a thing like this should happen again, they've got them. The stories on testing are all over the place, that we're actually in good shape. I'm going to have the Vice President and others speak to you about that, but we're in very good shape on testing, and we're getting better all the time. You're going to see some interesting things. I thought before I went any further, though, I'd like to have General Semonite, who's done an incredible job, tell you where we are. You know, we're still building beds in hospitals for people that need them. I guess the hospital business, General, is getting pretty much closed out now, but we're creating a lot of space for people just in case, and in some cases they probably will be using them. But I thought the General, he's been so impressive and done such a great job. I thought on behalf of the services and on behalf of the federal government, he'd say a few words about what we're doing right now. Thank you very much, General.
Well, thank you, Mr. President. Just want you to know that on behalf of all of us in the Department of Defense, our thoughts and prayers go out to all of those patients and all those victims that have been affected by this terrible virus. And the President and the Vice President talk all the time about the heroes, but I've been out there. I've seen the doctors, I've seen the nurses, and all those that have worked very, very hard. And we're just so proud to be part of this noble calling. For my team, I really made it very, very simple. I said there's 3 legs of this stool, and they all have S's. There's sites, in other words, hospitals. We've got to worry about supplies, and we've got to worry about staff. And so right when Governor Cuomo called the president about almost 30 days ago, he said, I need some help worrying about what could be tens of thousands of hospital room shortages. So the president and Secretary of Defense asked us to fly to Albany with a team, and on the way up, we understood how complex of a challenge this was. And we knew there's no way you can solve a complex catastrophe with a complicated solution. We needed a very, very simple solution to be able to then work with HHS, to be able to work with FEMA, to be able to work with the Vice President's task force, and then to be able to power this down all the way down to the local level. Some of the governors asked us to try to build a hospital in a parking lot or a field in 2 or 3 weeks. You can't physically do that. So what we said was, let's go to where there's an existing facility. And I'm going to kind of make this in 2 big pots. Those that are either hotel rooms or college dormitories, smaller rooms, or those that are in real large areas like field houses or convention centers. And we designed those standard facilities that could be either non-COVID or COVID, and then we got that approved here at the federal government to be able to then power that back down. So we went to Governor Cuomo, and he said right up front, I love the concept. I need you in the Javits Center. I'm ready to start having you work tomorrow afternoon. So when we flew back that afternoon, the next day, we basically built this standard design and then continued to be able to power it down all the way down through the rest of the team. So I just want to show you a couple slides here, and we'll kind of let you know where we're at right now, Mr. President. We had to do a bunch of assessments. So somewhere in the order of over 1,100 different locations we went to, and we worked for FEMA, we worked for the president, and we worked for governors and mayors. And we said, what do you think your demand is going to be? And based on a lot of the modeling that's been in this room here, we were able to understand when the peak curve was, but we also were able to understand where's the bed shortage. So then these 1,100 facilities, right now today, sir, we're actually executing 32 different facilities. That's on the order of merit of about 16,000 beds. 8 of those are all done. We've still got a lot more to complete. And in the next week and a half, we're going to complete about 15 more facilities. We've got some pending. Some mayors and governors are still wondering, do they have enough bed space? And what's important here is we need a very agile plan. You can't do something 3 weeks ago and think that this is going to continue to stay, because this virus gets a vote. And this entire team, the federal government's trying to be as agile as they can, supporting those states and those governors. The beauty of the plan, though, is it doesn't have to be built by the United States Army Corps of Engineers. So we designed about an extra 52 facilities. We gave those to the governors, and I've got to be very, very laudatory to the governors. They then imposed and put a lot of those on the ground and did those themselves. So let's go to, I'm just going to show you some real simple pictures here. Go to the next slide if you don't mind. So this is an example of the Javits Center, and you've heard the president talk about it quite a few times. This one, about 2,100 bed spaces. What you get is about a 11 or 12-foot square cubicle. There is lights in there. There's a nurse call, so if you need to be able to call the nurse station. There are nurse stations throughout. There's pharmacies throughout. This one started as non-COVID, but then we came back in and put in central oxygen. So everybody has oxygen right behind their bed to be able to take care of those patients. And again, built this one, about 1,000 patients treated. Let's go to the next one. I was up in Detroit with Governor Whitmer, and she walked us through and told us her intent. Here's where she needed to do this in the TCF Center. You'll see all the cubicles that are laid out. This is right in the middle of a convention floor where there might be like a boat show or a car show, and then went in and built 970 different capabilities there. And again, a lot of great work by my guys in the Corps of Engineers and the rest of the mayors and the city's team all pulling together. Let's go to the next one. This is called the McCormick Place. Governor Pritzker sat us down. He said, here's kind of our intent of what you want to do. Mayor Lightfoot walked us through, and we went into another large convention center. This is actually 3,000 bed spaces, a very, very large build, and got this one done in a relatively short time. And then here's another one that kind of helps you understand the dynamic here. Go to the next one, please. This is in Miami Beach, and I flew in to see Governor DeSantis. And my guys had kind of scoped out about 450 beds, and he said, Todd, how long is it going to take to build this? And we kind of said probably till the 27th of April. And he went to his health people and he said, how long do you need? And they said, the day we need this is the 21st of April. And I told my guys, you don't have till the 27th. Figure out how to get it done by the 20th. This is where you don't get to build to be able to have the perfect solution. You got to be able to get the mission essential done. Lives are on the line here, and we've got to be able to get everything done to be able to save those lives. And let's go to the last one here. This is one we're doing right now, Colorado. This is in Denver, another gigantic convention center. You'll see all the different cubicles here to be able to just bring in that oxygen, 6-inch copper pipe that comes in, and it's all piped throughout the entire convention center, 6 miles of pipe that's able to go in to be able to make that happen. And in closing, I just want to be able to say that we are very, very focused in the Corps of Engineers getting this done. But this is all about the team, the federal team, the state team, the local team, the vice president's task force, and a lot of the people sitting here have informed us of how fast we need to go. And it goes back to, again, all the governors and the mayors to make this happen. But I want to reiterate, President Trump has called me 3 times, and Secretary Esper has been on the phone at least one of those times and said, what else do we need to do to set you up for success? Is there any other knobs we can turn to be able to help you go? And you think about that equation of those 3 S's, I think that with the federal government and the mayors and the cities here, we've effectively taken that first S out of the equation. And so I can't tell you, of all the things I've done in my career, this is a noble calling to be able to step up and save American lives. So with that, sir, I thank you very much.
Fantastic, Jeff. Thank you very much. Anybody have a question for the general while he's here? Anybody? Because I think it's very self-explanatory. He's done an incredible job. Jeff, do you have a question?
Are there more projects, sir, beyond the ones that you've just identified that you'll be working on?
So about a week ago, we thought we were about capped at 26. What we're seeing is, and I said the virus gets a vote, we're seeing some of these curves are stretching out where we might have thought we only had 5 or 6 days. We actually have a couple weeks now. Other ones we're seeing exactly the opposite. So where we didn't think there was some, and I'm not going to go into locations here, but we are definitely getting requests in. We've got 6 more requests in just in the last 4 or 5 days. They're a little bit smaller facilities and more remote areas, but our job, if we have enough time to go build, we want to get in there, do the assessment. We work for the mayor and the city and the governor here, and we can still get them done if the mayors and those elected officials make a fast enough decision.
You might say while you're here, we're building, the general's in charge of the wall on the southern border, and we want to build 450 miles of wall, and it's very much under construction. You might give them a little bit of an update. How are we doing with the wall?
So, sir, I think the most important thing, and you stressed this, and Secretary Esper stressed this, there's really several different priorities here. Our number one priority in Department of Defense and the Corps of Engineers is to protect the team, protect the force. No matter what we do, we've got to continue to take care of our civilians and our service members out there. And so every single thing we're doing, whether we're building for the VA or we're building for civil works projects or for the Department of Defense or building on the southwest border, we are going out of our way. I talked to my commanders this morning. We've got over 4,000 contractors contractors that are on the ground out there, and we've had no positives as of this morning, knock on wood. Same thing with my 400 employees. We're testing them, not necessarily with a more stringent test, but with temperatures to be able to make sure that everybody's safe and everybody goes out of their way to do things the right way. Construction is going very, very smooth. What we're seeing is our contractors are extremely focused. Now that we've got a good, clear path, both on the CBP program as well as some of the DoD program, we, I think, very well postured. It's a very, very aggressive build, but we're well postured to be able to meet your expectations, sir, of 450 by the end of December 2020.
And we're over 160 miles.
164 as of today, sir.
164 miles, and we'll have it done sometime pretty early next year. Very exciting.
Yes, sir.
And you might just say one thing, the quality of that wall in terms of its power for stopping people that shouldn't be coming into our country.
So same thing. If you have a standard design that you trust in and it works very well, I've got a pat on the back, Commissioner Morgan. He was very adamant to continue to be able to make sure that it supports his agents. And so we've got a design now that certainly does that. And then we've got a phenomenal contractor workforce that's in there, my Corps of Engineer employees, and it's going in well. We don't see any significant problems. And I think it's also important to point out that we want to do this the right way. So we try to balance this with environmental considerations are out there. We're trying to do due diligence when it comes to anything to do with any of the citizens who are affected. We're trying to make sure that we're protecting all of the things that we need to protect and try to find that balance where we can both meet the administration's directive while at the same time making sure we're doing this so that everybody gets a vote and everybody has a fair shake.
Okay. Yeah, please.
May I ask what you're doing regarding the availability of at the recreation sites that the Army Corps of Engineers operates, how the access is going there and whether or not there are restrictions?
So I'm an engineer. I take my guidance from some of these experts sitting on the bench over here. And when the president says, turn on America, what we initially did, like many, many other governors, they, shut down beaches, shut down cities. I had a meeting with my commanders this morning, and as soon as we think it's safe, turn them back on. I mean, parking out there at a rec area where you're 500 feet away from everybody in a camper is probably low threat. I will continue to take guidance from the administration, but where we get green lights to continue to put our rec areas full up and let everybody go back out there and do things the safe way. I mean, we work for the administration, so I want to do it safe, but I don't want to be the last guy that turns things on. Not at all. Yes, ma'am.
Hi, thanks for walking through some of the efforts. Can you say anything about whether or not there are any specific efforts in communities that are hardest hit, like Black communities or Latino communities, communities of color? Are the Army Corps of Engineers doing anything that would be building any sort of temporary facilities for those communities?
So we basically key off what the city asked for, the city and the governor. There are a couple specific areas that certain city mayors have asked us for. Again, I'm not going to go into details, but we basically, if they go in and say, I'm very worried about a hot spot on this side of town or a specific community here, we will do, and that's what the administration is charged to do, is whatever we can do to be most responsive. We just don't want ever to have an ambulance pull up to the back of a hospital and somebody says, we're out of room, go to the next hospital down. So that's where we're trying to make sure that that bed space is available. And so far, everything we built has been ahead of need. In other words, we're able to finish the building 2 or 3 days before it's needed. Thank you, ma'am.
Okay. So you have a choice. You can stay and watch these wonderful people ask us really nice questions, or you can go back to building beds.
Sir, I got a lot of building to do. I'm going to leave if you don't mind.
I had a feeling you were going to say
Thanks,
that.
sir.
Very impressive. That's an impressive job, isn't it? Seriously? That's really great. Thank you very much. He's a terrific gentleman. We have a lot of great people doing that kind of thing that they really have to get recognition for the incredible job they're doing, because I don't think anybody else could do it. Nothing like that. And that's on top of thousands and thousands of hospitals. And, he built, just in New York alone, 4 hospitals and 2,900 beds, and got them done so quickly nobody saw anything like it. Fortunately, we haven't had to use too many of them, and that's okay. That's probably better news than having to use them all, right? Because a lot of good things are happening in New York and elsewhere. So through the public-private partnerships and deregulation, the federal government has already made immense testing capabilities available, but some states need to take action to fully utilize it. To date, the United States has conducted millions more tests than any other country. you can add them all up, and they don't catch us. And our numbers are doubling almost on a, certainly on a monthly basis, but almost on a weekly basis. We're moving very rapidly, far at a number nobody thought possible. And we'll be doubling our number of daily tests if the governors bring their states fully online through the capability that they have. We have tremendous capability out there already existing. And we explained that to the governor today. Mike and all of the people explained it very strongly to the governors. They really get it now, I think. As the experts have explained, this capacity is sufficient to allow states to conduct diagnostic testing to treat patients, as well as contact tracing to contain outbreaks and monitoring to pinpoint potential hotspots during phase 1. And there are some hotspots, and we have them pinpointed, and they can really cover it very, very nicely when they know exactly where to go, and they're being told where to go. And also these locations where they're going, and some of them are federal. Some of the governors didn't realize they were allowed to use federal locations. They are. And we have a booklet of the federal locations. We can hold it up. I think you'll show that. Maybe we'll hold it up now. Yeah, okay, fine. But you see the number things. Thanks. These are all locations where they can go, which is really pretty amazing. This is just one page out of many.
Over 5,000.
Look at this. These are all locations.
5,000 labs.
That's a lot of locations. And they can all, what is it, 5,000?
5,000 pieces of equipment.
So that's, thank you very much. That's more than anybody thought. And it's already there. They have to use it. That's all. They have to use it. Some weren't aware. Some were very much aware. Some weren't aware. My administration also continues to support states with our massive operation to deliver masks, gowns, gloves, and other vital supplies. Admiral Polachek and his team at FIFA are really, what a job they've done. And Pete, what a job he's done. They're calling on Easter Sunday to make sure everyone's okay. But they're using detailed data about supply chains to track the deployment of 1 billion pieces of protective equipment through private distributors every 2 weeks. So what we're doing is we're delivering a number that nobody anywhere in the world is delivering. FEMA is working closely with Dr. Birx and the distributors to prioritize supply of resources where they are most needed. We're finding the location that they have to get to that location. We have locations that are very important to get to and get to them fast, and that's where they're going. So we have a very strong priority. This pandemic has reaffirmed the importance of keeping vital supply chains at home. We cannot outsource our independence. We cannot be reliant on foreign nations. I've been saying this for a long time. If we've learned one thing, it's let's do it here, let's build it here, let's make it here. We've got the greatest country in the world. We've got to start bringing our supply chains back. Somebody years ago got this crazy idea, let's build all over the place, and let's have parts, let's have a screw for a car delivered and made in a country that's far away. And let's have a fender made someplace else, and let's do this, and let's do that, and let's put it all together. And I like making it right here in the USA. And I think we've learned a lot about that, and especially maybe when it comes to pharmaceutical products. We've also conducted major military operations providing cities and states with additional medical capacity, and the incredible 1,800 men and women from the Army Corps of Engineers. You just met with Todd. The job they've done is incredible. But we have nurses, doctors. We have experts in every field all over. Spoke with Governor Cuomo, spoke with Mayor de Blasio, spoke with many of the other governors that I'm both friendly, and I think I'm friendly with just about all of them, if you can believe it. But I've gotten friendly with a lot of them. I've gained a lot of respect for a lot of the governors, both Republican and Democrat, during this process. Some really good people, some really good talent. But we're sending a lot of our medical people, not only our construction people like Todd Semonite, but a lot of our medical people are being sent all over the country to different locations. New York City, New York State, New Jersey. I spoke with Phil today. He's doing a terrific job in New Jersey, but New Jersey got hit very, very hard. Phil Murphy, governor. From the day this crisis began, America launched a scientific mobilization of colossal size and scale. Someday they'll be able to write the true story because nobody's seen anything like it. The fake news just refuses to cover it correctly, but that's okay. The people are understanding, and that's what matters to me. There are now 72 active trials underway across the United States, researching dozens of therapies and treatments, and another 211 are in the planning stages. They're literally mobilizing on therapeutics and also on vaccines. A tremendous progress is being made on vaccines, and I must say on therapeutics. I mean, frankly, if I had my choice, give me the therapeutics right now, because that would help people right now. And we have some things that I think are working, not only working, but we have some incredible things that look like they could be an answer, but we'll know soon. Being tested, working out right now. This includes their therapies designed to attack the virus, as well as others that would hinder its replication, reduce the rate of infection, control the immune response, or transfer life-saving antibodies from the blood of recovered patients. And one of the incredible things that we've seen, and Mike and I were talking about it before, is the fact oftentimes somebody gets very ill from the plague, okay, from this horrible scourge, and they get better and they recover. And the first thing they say is, I want to give my blood. That's happened. The doctors have told me it's happened so much. I want to give my blood. I want to give my blood. And they're doing that. But tremendous things are happening. You'll be seeing that over the weeks. I think we'll be talking about it in the not too distant future. Johnson & Johnson's very well along on vaccines. Again, the vaccines have to be tested. The therapeutics are for now. But a lot of good things are happening on both. But ultimately, we also hope to prevent infection through a very safe vaccine. And that'll be a great thing when we have that. And we will have that. So with that, I'd like to introduce Admiral Guar and Brad Smith to discuss some of the incredible things that have been done. And they really are what they've been able to do in a very, very short period of time. With and equipment. You're going to see equipment that you haven't seen before. And if you just come up, Brad, if you guys would come up, you could give us a little display of some of the equipment that we have and some of the things that are happening having to do with testing, because testing is a big word. Remember, it was all ventilators. And the reason it was all ventilators, they said, there's no way he'll ever be able to catch this one. And not only did we catch it, we are now the king of ventilators all over the world. We can send them anywhere, thousands being made a week, and they're very high quality. And that wasn't playing well, so then they said, testing, oh, we'll get them on testing. Well, testing is much easier than ventilators. Ventilators are big machines that are very complex, that are very expensive. You need you need a group of people that really know what they're doing. We took auto lines, we took a lot of different people, and now we've done that. But it used to be ventilators. Now it's testing. And I think the Admiral, and I think that Brad will show you some things that you haven't seen that are really very spectacular, having to do with testing. We're way advanced. The list I showed you, these are places you can go if you're in the States. 5,000 different machines. 5,000. They're all over the country. We have international also, but these are all over the country. But you'll see something now that's really eye-popping in terms of what they've done. And they've done this under great pressure. They've come up with things under great pressure that are absolutely amazing. So please, if you would. Thank you, fellas.
Well, thank you, Mr. President. I want to talk about a couple things today, a little bit different than I've spoken about before. Since early March, we've really been focusing on two key concepts for testing. Number one, to assure and expand supplies in the U.S. market. This is really critical because we were talking about really a cottage industry with very minimal suppliers that we were asking to supply over a 2-week period of time the normal production that would be for at least a year. And as simple as a swab is not a swab is not a swab. And we need to be very careful that when we put something in a person and tell them a test result, that it's really correct. The second component is to secure sufficient supplies at FEMA during this time of peak disease, where we could alleviate any maldistributions within the state. This is the FEMA process of requesting and sending things out, and also supporting outbreaks. So starting many weeks ago, starting in my office many weeks ago, we assembled a multidisciplinary team of really incredible people. The medical side of the equation, which I represent, the laboratory side of the equation, high-tech side of the equation, logistics and operation. And Brad Smith is his day job as director of the Center for Medicare and Medicaid Services, an incredibly important component of our country's CMS system, building the future healthcare system, but has done a really incredible job operationally and logistically in bringing everyone together. We have focused on every piece of the supply chain that relates to testing, down to the most minute detail, and he's going to talk to you about some of that. But that started in the second week of March with starting an airlift, because the only supplier, the main supplier of swabs at that time, was a place in Italy that was completely shut off because of the outbreak in Italy. So Admiral Polubchak arranged Greytail Air Force planes to go to Italy to bring millions of swabs back to secure. That's just how it started, and it's expanded since then. The second part is we've been really marrying, and this has been the beauty, the logistics and supplies to the overall strategy. Two pieces of strategy. Number one, what is the overall testing strategy? And Dr. Birx has had just an elegant strategy in the past, but even more important in the future, when we make sure we take care of indigent populations and those most vulnerable. So the clinical, the contact tracing, and the monitoring of those who are at most risk. We've also married it to the strategy, and you've heard more than you wanted to know about it, that a small machine that's point of care is good for certain things, but it's not going to test 5,000 people over a short period of time. So the small machines, the medium machines, and the large machines, and how to contextualize them. And the third thing, before I give it to Brad, which is very important, and it's really critical, is coordinating the research, the epidemiology, and the FDA regulatory process. And why is that so important? When we started 5 weeks ago, if we wanted to test this many people with the technology we had, we would have used about 80% of the strategic national stockpile in PPE just to do testing. We needed an innovation. That innovation was to be able to test out of the anterior nose with a completely different kind of swab. It sounds very mundane, but if you don't do that, you can't get the testing to scale. That allowed us to really go to widespread testing. Last week, moving to polyester swabs, which is going to open up millions of new swabs onto the market. But that's a regulatory science and innovation step that had to co-occur with this. And with that, I'm going to let Brad talk about some of the details that he has really shepherded over the past weeks in ways that have truly been amazing and incredibly impressive to me.
Well, thank you, Mr. President. It's an honor of a lifetime to be here and serving in this way. I've been working under Dr. Birx's and Admiral Girard's leadership over the past several weeks to help increase the supply of testing across the United States. As you all know, there's really three parts that you need to make the test work. First, you need the machine, which, as Dr. Birx will share more and the President spoke to, we have a very, very large number of those across the United States. It's about making sure that we're taking advantage of them. The second part of the testing is making sure that we have the collection supplies to actually be able to collect the specimen, and I'll talk a little bit more about that. And then the third part is making sure that you have the materials you need to support the machine to ensure that you can actually process the test once it gets to the lab. I'll let Dr. Birx talk more about the machines here in a second, but as you'll see, across the United States, we have a tremendous number. They range in variety. So we have some very small machines that do point-of-care testing. They may do, say, 50 to 100 tests a day. We also have other very large machines that can do several thousand, process several thousand tests a day. On the collection supply piece, I'll talk through a couple different kinds of collection that can be done. So for the nucleic acid test, which are the tests that are currently being done today, you generally need a swab of the nose. To do that, you need the swab, you need the collection tube, and you also need the transport media that it can be transported in. We have a very large number of swabs already in the country, but we have secured an additional 30 million in production that will be ramping up over the next several weeks. One company located in the Northeast, we're going to be using Title III of the DPA to help them build 4 new production lines. They are currently the largest swab producer in the country, and this will help them ramp up their production tremendously to over 20 million additional additional swabs a month. A second company located in Ohio is currently the largest Q-tip maker in the country. We're helping them convert their line from making Q-tips into making swabs. They are actually ramping up production starting this week of swabs, and will be ramping up to over 10 million per month. So in total, that's over 30 million new swabs that will be coming just over the next handful of weeks. The second piece is on the collection tubes. The collection tubes, we've been partnering with Oak Ridge National Lab, a Department of Energy lab based in Tennessee. They have very unique and sophisticated injection molding manufacturing capability, and they are in the process of ramping that up to create collection tubes, and they will be ramping up to over 40 million collection tubes a month here over the next several weeks. In addition to the swabs, we believe that as testing progresses, there'll be other types of testing like serological testing that will occur. And those samples have to be collected in different ways. So many times, some of those tests will require a finger prick. So in addition, we've secured over 17 million lancets, which is what you use for the finger prick, so that we have those available, as well as 17 million alcohol swabs, which is what you need to clean the finger before you do the finger prick. In addition, although folks are not talking about this much yet, we also believe that businesses across the country may want thermometers to test folks as they come into the office. And so we've secured over 650,000 infrared thermometers that states and businesses will be able to access to be able to test folks as they come into work. So I think we've made tremendous progress on the collection side. In addition to the collection side, we've been very focused on ensuring that the labs have what they need. To process a specimen in a lab, you really need two things. You need something called an extraction kit, and you need something called a PCR test. In order to be able to fully process a test, you need both of these things. Sometimes these things come together, and sometimes they come separate. For some of our point-of-care tests, including the Abbott and Cepheid tests, they come together. They are ramping up production rapidly to over 3 million of those tests per month, and these are tests that did not exist even a month ago. The second piece is on some of these large machines. They also sell complex cartridges that come together. One of the big manufacturers is that has already ramped up production from about 1.6 million a month to more than twice that already, and that's already occurred. In addition to when they come together, they also sometimes come separate, and we see significant ramping up of production there from our manufacturers through our public-private partnerships. And we're seeing both several million more over the next few weeks of both the RNA extraction kit as well as the PCR test kit. So with that, thank you.
Mike, please. Thank you, Brad.
Thank you, Mr. President, and I share your admiration for this remarkable team, from the Army Corps of Engineers to Brad, to Admiral Giroir. They're doing a remarkable job every day. As President mentioned, today we had our weekly conference call with governors across the country, states and territories, and I was able to convey to them our appreciation for the leadership that every governor of every state and territory has provided. Thanks to their leadership, thanks to the extraordinary cooperation of the American people, despite the fact that more than 770,000 Americans have contracted the coronavirus, and our hearts grieve for the more than 41,000 Americans who've lost their life. The truth is that as we stand here today, we are slowing the spread. And as the President reflected, we continue to see steady progress in less cases, lower hospitalizations, even in hotspots around the country. And we commended America's governors for their efforts in that regard. We are preserving our healthcare capacity, as the General with the Army Corps of Engineers reflected. The President's direction, we've built a great number of hospitals around the country, but the utilization rate has been fairly low because of the mitigation efforts, the cooperation of the American people. We have not had to use them. And that, as the President said, is very good news. In a word, we thank governors across the country for taking actions, decisive action, to save lives and to make a difference. I reminded them that we're all in this together. We have one mission, we're one team. We spoke on the conference call about last week's guidelines to open up America again. And we heard from governors across the country about the progress that they are making. We spoke to governors from New Jersey, Connecticut, Florida, Louisiana, Texas, and Michigan about their ongoing efforts at social distancing, and addressed questions that they had about needs that have been spoken of already in this presentation today. In addition, as we promised last week when we spoke to governors on Thursday about the guidelines to open up America, our team presented every governor in the country, states and territories, with a memorandum detailing laboratory capacity in all locations of laboratory equipment for diagnostic tests that can perform the coronavirus test. We also provided, as Dr. Birx will elaborate in just a few moments, literally a map about where these testing devices are located. And I must tell you, Mr. President, I was very impressed at the way governors, as we speak, are scaling testing in their own states using these resources. Our hope is that by providing this information, and by our team that we've enlisted out of Walter Reed, that's contacting every one of the laboratories in the country to find out what their needs are and to encourage them to activate those testing machines to do coronavirus testing, that will continue to be able to support a state-managed effort to increase testing even more. But a few highlights. Governor Doug Ducey announced antibody testing for 250,000 health professionals this week and first responders, a partnership between the state and the University of Arizona. We spoke today about Governor Gavin Newsom's announcement that he set up a task force for testing, 5 to 7 high-capacity testing hubs in partnership with UC San Diego and UC Davis to increase testing in high-capacity labs around the state of California. We heard from Governor Ron DeSantis, Mr. President, about the efforts of the state of Florida. I believe he said that at this time Florida had conducted 275,000 coronavirus tests, and they're in the process of a major expansion of statewide testing with the goal of opening up additional sites and using the Florida National Guard to test residents at nursing homes and long-term care facilities in Florida. We also recommended today to every governor's attention the public health website that the state of Florida established, which has useful information on a county-by-county level about where testing is happening. Mr. President, as you said, governors are utilizing testing assets. They're managing and deploying these resources as they see fit. And at your direction, we're going to continue to work very closely with them. Other governors that we spoke with included Governor Gretchen Whitmer of Michigan. There are 13 new or expanded coronavirus drive-through testing sites in Michigan that her team has stood up with Michigan Primary Care Association, and we assured her that we would continue to work as Brad and Admiral Giroir are literally working around the clock to make sure that they have the supplies to support all of that testing. As the President said, Governor Hogan, who always begins our conference calls as he's chairman of the National Governors Association, expressed appreciation for last week's guidelines to open America up again, and his appreciation on behalf of all the governors for the list of laboratories in each individual state. He did raise the issue that we had included on the list Department of Defense facilities that have laboratories and machines, and also other federal facilities, many of which are in Maryland. And I was able to assure Governor Hogan and every governor on the call that we will make all of those laboratories available across the country to every state as the need for testing capacity continues to scale. And so this is one more step where you see the Army Corps of Engineers, where you literally see thousands of military doctors and nurses on the streets of New York and other cities around the country. This is one more step where we're literally, as the President said from early on, are leaving no stone unturned, and we are delivering a whole-of-government approach for our states as they deal with the coronavirus outbreak. Governors are continuing to expand testing, and we assured them that we're going to continue to work in every way to support their efforts to do just that. I will say again, as we've said before, as Dr. Birx comes up to explain to you what we delivered to the governors today, we told the governors once again today that by our best estimates, we have enough testing capacity today for every state in America to go to phase 1 if they meet the other criteria of 14 days of reduced cases and sufficient hospital capacity to prepare for any eventuality that may occur. Once again, we have enough testing capacity for every state in America to go to phase one. But we assured the governors today that we're going to continue to work around the clock to expand the testing capacity, support supplies, and to support their efforts to encourage social distancing and the very mitigation efforts that the American people have been doing that have brought us the progress that we see all across the country today. With that, Mr. President, I'll just let Dr. Birx describe what we distributed today.
Thank you, Mike. Deborah?
Thank you, Mr. Vice President, Mr. President. We just want to show you a couple of additional slides, but also to remind all of Americans that we still have a significant number of cases, both in the Boston area and across Massachusetts and Chicago, to really that our hearts go out to those cities as they continue to struggle with coronavirus and the consequences at the hospitalization, to all the healthcare providers that are on the front lines. We wanted, so these are just an illustration of the different types of equipment that are out there, describing them both as low speed, but quick turnaround time, to high speed and taking 3 to 4 hours to actually run 100 or more tests. And so the equipment ranged from all those different, and that's why there's 5,000 of them as noted by the president in this list. We wanted every governor and every state and health laboratory director to have a clear understanding of the full capacity within the state, both for the capacity, but also where technical assistance and additional supplies may be available. And we were proud to put the federal labs on that list because the military and the VA have stepped up every step of the way to provide support both in testing and care. And we have many military members on the front lines, and I'm sure the military would offer their facilities to the governor of Maryland or any governor who wanted to utilize those to expand testing. So the next slide, I'm just going to run through them very quickly. So every governor not only received the Excel spreadsheet with the complete list of the equipment and the zip code of the location and the laboratory to really be able to create a mosaic of laboratories of the high speed and low speed equipment together to meet the needs of their clients, depending if they're drive-through or hospital needs. So this is what Florida looks like. Next slide. This is what Louisiana looks like. Next slide. Maryland with significant capacity. Next slide. Virginia with significant capacity throughout the state. Next slide. New York, obviously a lot of capacity in New York City with overlapping capacity. It's important to know where this is because then hospitals and labs can support each other when they need surge capacity. Next slide. This is New Jersey. Next slide. Pennsylvania. Next slide. Massachusetts. Next slide. Ohio. Next slide. Oklahoma. Next slide. Washington. Next slide. I think that's Wyoming. So we wanted to show both in states that have large populations and in states that have lower populations. You can see that in general, the number of machines match their population. And we're working with the Walter Reed Group and the American Society of Microbiologists and all the lab directors to really create a web of understanding of what the capacity is currently, what the capacity can be, and how the federal government can support them in developing their strategies linked to the overarching federal strategy of testing as outlined in our guidelines. Thank you, Mr. President.
Question for Dr. Birx?
Yeah.
Dr. Birx, University of Southern California and the LA County Public Health put out a report today that suggests that the penetrance of the virus is as much as almost 40 times what it was believed to be, that as many as 442,000 people in LA County may have been infected, which suggests two things. It suggests that you have a lot more people out there who could be spreading the virus, but it also suggests that the case fatality rate is more in line with the 2017-2018 flu than what we've seen in some other areas of the world. But I'm wondering if you've seen that, what your thoughts were.
So we're looking at all those studies very carefully, and I think you will remember over the last 3 weeks I've been talking about the level of asymptomatic spread and my concern about asymptomatic spread because with flu and other diseases, when people are sick, it's easy to contact trace. When people are not sick and shedding virus, you have to have a very different approach, a very different sentinel surveillance approach, a sentinel monitoring approach, which we outlined in the guidelines. And it's why the guidelines took that very seriously. We knew that was unique for respiratory diseases, but it was because we were very concerned about the level of asymptomatic. And if you remember, we talked about younger age groups may have more asymptomatic disease, and your asymptomatic disease may decrease with your older age groups, and that your symptomatic disease might increase with age groups. This is still our working hypothesis. We have no data right now still to support that, but it's these kinds of studies that help that. We know that New York and Detroit and other cities are very interested, which we want to also support them in testing for frontline responders, first responders, and healthcare workers, because we think their exposure may have been the greatest. What we don't want to do, and I'm just going to do another 30 seconds on testing. These tests are not 100% sensitive or specific. And I'm going to go over this over and over again. So if you have 1% of your population infected, and you have a test that's only 99% specific, that means that when you find a positive, 50% of the time it will be a real positive, and 50% of the time it won't be. And that's why we're really asking people to start testing in among the first responders and the healthcare workers that may have had the greatest exposure, because that's where the test will be most reliable. And then when we have the luxury, we can go out to broader and broader communities. But this has been the fundamental question to begin with and has been persistent. And we will emphasize to the American people again, this is a highly contagious virus. And we don't know by looking at someone whether they have pre-existing conditions or not. And so all of us, as far as protecting others, must continue to do all of the recommendations to ensure that when we are in an asymptomatic state, we're not passing the virus to others.
Question for you as well. The governor of South Carolina announced today they're going to open some stores with restrictions, but they just told my colleague Natasha Chen that they have not achieved that criteria in the White House guidelines about the downward trajectory for 14 days. So shouldn't they not be reopening stores today?
We have asked every governor to follow the guidelines, just as we've asked every American to follow the guidelines put out by the president. But each of the governors can decide for themselves whether they've reached specific guidelines in specific areas. I had a question, I think, on Saturday about Jacksonville and their beaches. So I did spend about 5 hours going to every state website, and I will tell you that the Florida Department of Health website is extraordinary, and this is what every Department of Health should have, because when you go to that website, you can see that most of the cases are in southern Florida, in the Miami, Fort Lauderdale, Broward County area. And if you look in Jacksonville, they had less than 20 cases per day and less than 800 in 4 weeks. And so these are the kinds, when you inform the public and give them the information that they need, then they can make decisions along with the local government and governors. So I'm not going to say specifically with South Carolina, because I don't know their specific website right now, and I don't talk about data unless I've seen it myself. But I know from Jacksonville that they had less than 20 cases a day. And so this is how we need to start informing the community. These websites are critical. It's by zip code and it's by county. They can see cases, they can see cumulative cases, they can see new cases, they can see hospitalizations, they can see mortality, they can see age groups of mortality, and they can see where every testing piece is. This is how we have to inform the American public, and this is where the American public will develop confidence in each of their counties and local governments.
I was hoping you could comment. The Vice President mentioned that there's enough testing capacity right now to proceed to phase 1. But what about phase 2 or phase 3? Are there enough machines, or enough cartridges, are there enough reagents right now for the sort of reopening that the administration is envisioning taking place over the next month or two?
So you can see the current machine outline, and you can see that both of these gentlemen have prepared to have everything ready for phase 2 and preparing it now for what we will need in the future. And I think that's what you saw with the ventilators. That's what you're seeing with PPE. It's not just for today, it's for tomorrow. And it's our federal planning is not just for this instant. It's making sure that we meet the needs of this instance, but we're planning for 30 and 60 and 90 days ahead.
I would just agree with Dr. Birx completely. We are ready right now to enter phase 1. and we are ramping up all our capabilities across the board, not just to achieve what's necessary for phase 2, but 2x, 3x, 4x, so that we will be absolutely over-prepared when the nation is ready to go into those phases.
President Trump.
And by the way, not everybody agrees that we have to do that much testing. We're going maximum. You understand, there are some people who don't want to do that much testing, but we're going maximum. We're going to the outer limits, and I think that's the way probably it should be. Jeff, go ahead.
Mr. President, to return to a topic that you opened the press conference with on oil, U.S. crude futures today went below zero, went into negative territory.
Went negative.
Yeah.
Like interest rates, they go negative.
Does that make you want to see Saudi Arabia and Russia and OPEC Plus do more
Well,
to
it's for
reduce
short
supply?
term. Much of it has to do with short sellers. Much of it has to do, if you look a month into the future, I think it's at $25 or $28 a barrel. So a lot of people got caught. They got caught, and there are a lot of people that are not too happy because they got caught. So if you take a look at it, you'll see it's more of a financial thing than an oil situation. But because you take, I believe, in a month or so, in other words, go a little bit out, it's at $25 and $28 a barrel. So it's largely a financial squeeze, and they did get squeezed.
So would you like to see, however, Saudi Arabia and other countries make more
Well,
cuts?
we've already done that, where Saudi Arabia is cutting back, Russia's cutting back, Mexico's cutting back, and the OPEC plus, they call it OPEC, plus additional states are cutting back. And, you know, the problem is nobody's driving a car anywhere in the world, essentially, 184 nations. Factories are closed and businesses are closed. And so all of a sudden, we had really a lot of energy to start off with, oil in particular. We had a lot. And then all of a sudden, they lost 40, 50% of their market. So it just stopped. So it's going to be picking up, and the energy business will be strong. But they cut back. It could be 20 million barrels, but it's, let's say, 15. And that was between Russia and Saudi Arabia. But this had to do with the squeeze, and it was a very tough squeeze. A lot of people got...
You don't think they need to do more right now?
Well, they're going to do more by the market, to be honest. Look, same thing over here. If the market is the way it is, people are going to slow it down or they're going to stop. That's going to be automatic, and that's happening. Yeah?
Mr. President, on criminal justice reform and these SBA loans, I got an email earlier this morning from a fella in the Northwest who owns a supply business, and he has a felony on his record, nonviolent felony, in the past 5 years, which under SBA guidelines makes him ineligible for one of these PPP loans. So he has now had to let go 50 employees, many of whom are criminals trying to get back into society. I don't believe there's anything in the CARES Act that would restrict.
If you give me the name of the company and his name, I'll have that checked out, John. I'll do that. It's a friend of yours?
No, not a friend of mine. No, it's just somebody who contacted me out of the blue.
He called you to say he's a criminal, and why did he get a loan? Or what's...
Because he wanted to apply for an SBA loan and couldn't, and wondered how that squared
Okay,
with
if you
your...
give me the name, I'll look into it. I'd like to look into that, okay? Caitlin, go ahead.
If these companies that open and they have employees come back to work and they get sick, will these companies be liable?
Which companies are you talking about? Under
Any
what?
companies that open, manufacturing, any kind of company that opens,
So
employees go back to work, they get sick, will the
I'll give
company
you
be
an
liable?
answer to that. I'll give you a legal answer to that when we look it up. But we are trying to take liability away from these companies. We just don't want that because we want the companies to open and to open strong. But I'll get you a legal opinion on that. I'll get you, well, that's what I'm saying. I'll get you a legal opinion on
You
that.
guys haven't discussed that yet?
Nobody's discussed it, no, but we will now.
Have any business executives have voiced concern to you about being liable
Not one.
potentially?
Not one.
They didn't say
Not
that
at
on the
this
call
point,
last week?
but we're going to look because they have talked about general liability. So I'll get you a specific answer from the lawyers, okay? Go ahead, please.
Thanks, Mr. President. I wanted to follow on oil. When you were talking earlier, you were talking about the PPP deal and then mentioned the SPR. Right. In the first stimulus package, even though you had announced
well,
that
but you know the price of oil right now, don't you?
I do. Do you know the price of oil?
I actually do.
It's negative $37.
Of course, yeah. Nobody's ever heard of negative oil before, but it's for a short term.
In your opening remarks, you were talking about the PPP deal, and then you mentioned the 75 million barrels of oil that you previously had said you wanted to purchase. Yes. You weren't able to get funding for that in the first deal. So I'm wondering, are you...
Well, at the price you're talking about, you don't need funding. They pay you, see? You know?
If you can go get it
right now, if you can get it. That's true, if you can get it.
So my first question is, are you asking for that funding
at a
as part of
minimum,
the PPP
we'll let people
deal?
store. So we'll store it. We'll use it as storage and charge for it. But people need storage desperately, and we have massive storage under the petroleum.
So you're not going to make it a requirement of the PPP interim funding deal?
It's not a question of requirement. If we could buy it for nothing, we're going to take everything we can get. The only thing I like better than that is where they pay you to take the oil. But that's a short-term squeeze. You understand that. So I don't think you're going to see that. But no, we'd like to have Congress, this is a great time to buy oil. And we'd like to have Congress approve it so that we could, instead of just storing it for usually the big companies, because I think we have 75 million gallons right now capacity. That's a lot. We've been building it up over a period of time, but that's a lot, 75 million barrels. So we're going to either ask for permission to buy it or we'll store it. One way or the other, it will be full. Okay, please.
Mr. President.
Go ahead. You finish up. We'll go right to you.
Yeah. Some senators, including Senator Kramer, have called on you to stop Saudi oil shipments that are on the way right now. Is that you can do that under Section 232? Is that something that you would consider?
Well, we'll look at it. I heard just as I'm walking into the room, we certainly have plenty of oil. So I'll take a look at that, okay? Yes, please.
Questions. First on testing, the second on the SBA loan program. When will you in fact invoke the DPA to force that company you mentioned to ramp up production of
Well, we really don't need it. We use it, we go up, and I've used it a lot. But we use it, and then sometimes all they have to do is see it coming. Do you want to talk about that, Admiral, please?
I think this is, I don't think any of us knew very much about the DPA. But there's sort of a force side of the DPA where you force a company to do something. But there's a second side of it, which is really a hand up. The company we're talking about has done everything to support this effort and have ramped up production. I'm on the phone with them multiple times a day. This is the hand up. This is the government coming in and saying, how can we help you expand your lines? There's no asynchrony here at all. So this is the hand-up side of the DPA, which is exactly what these small American heroic companies need. They don't need to be forced. They're all in. Their employees are all in.
So point of clarity.
And we don't want to embarrass people either. Please, Brett, go ahead.
So today, we were on site, or there were folks on site with that company, finishing out what their capital projections will be in order to be able to ramp up these additional 4 lines that I spoke about. The company will then turn in a white paper to the DoD that will then help move the process forward, but it's actively in process.
And I fully understand that the need is enormous, but on March 21st, the administration promised 27 million tests by the end of March. So far, roughly 4 million people have been tested. So where are the other 23 million or so tests? Did they not materialize? Are they in the pipeline? Help us understand that discrepancy.
So since I was the one who said that, let me explain where we were. So I was getting my information, it was correct information about the actual tests that are in the marketplace. So if you want to use those metrics, there's been over 40 million, quote, in the marketplace. But we have an end-to-end issue that we needed to deal with, and that's what we've been dealing with. The swabs, the transport media. If we don't have people utilizing the machines the way Dr. Birx is talking about, we have some of our main platforms that are only 10% being utilized. You could have a lot of tests in the market, and those are correct numbers. But if the machines aren't utilizing them and they're not organized at that level, then they're not being utilized to its fullest.
So you meant if the machines were utilized, that would be the
you would have a lot of those millions of tests already being done. I think Ambassador Birx has estimated that we have another 1 million tests a week just on one platform that could be done if the machines were utilized more fully.
Question for Admiral Guerrero.
Well, yes.
Admiral Guerrero, you say that there, and the Vice President has said this, Mr. Smith said it, that there will be enough tests in place for phase 1. There are. The question is, what's the standard of testing that you now have the capability for? Is it test people who are only very ill? Is it test people who have the sniffles? Is it test people who come in just because they want to get a test? I mean, what is the standard here?
It is the guidelines, but I tried to be a little specific about this on Friday, and we all tried to. Number one is you need to test everyone who's symptomatic, right? And you need to over-test them because
How symptomatic?
we're talking any symptoms that would be consistent with COVID, right? So, and there's a wide range of symptoms. You want to test them, and you want to over-test. And we talked about the approximate metric with Ambassador Birx fully supports, because this is a good metric that you want to get about 1 positive for every 10 tests. Then you know you oversample. Second, and this is a really important part of the strategy, is because so many people are asymptomatic, there's no way that you can test enough people to pull one asymptomatic out of 300 people in the population. So the strategy with Ambassador Birx offered, and I talked to epidemiologists around the country, and they go, wow, I wish I would have thought of that, is to really focus on the vulnerable population where we know that the asymptomatic rate could be much higher than the rest of the population. And we are going to be focused, and this is what my office does, and during normal times, focusing on the underserved populations, particularly in inner cities and urban areas. They have a higher rate because overcrowding, they can't telework, they're subject to a lot of comorbid conditions. Nursing homes, we all know about nursing homes, and there's both symptomatic and asymptomatic spread. And finally, some of our indigenous populations in the Indian Health Service. So this is a very, very important layer that most of the models and people don't talk about, because that's where we're going to pick up the asymptomatic carriage. And when you do that, that's when you focus on track and trace.
So just a quick follow-up on that. If we have enough tests right now for everyone to go into phase 1, why is the governor of Maryland having to get 500,000 tests from South Korea?
I don't know what the governor of Maryland is doing in South Korea, but there is excess capacity every day. If he wanted to send 30 or 40,000 tests to LabCorp and Quest, that could be done. That could be done tomorrow.
Enough that they needed to start to up their testing capacity and make it adequate. So
I think we're seeing all across the country that in the states that have been hardest hit, their capacity, not only their capacity, their testing far exceeds South Korea, and they've been able to do that on a relatively straightforward basis. I don't know what the governor of Maryland, we talked to him today, he didn't bring that up today. We were on the governor's call today.
But you haven't spoken to him personally on this?
We spoke to Governor Hogan today. I'll follow up because I heard there was an announcement today about that he had acquired some tests from overseas. Maybe we could put the slide back up that showed the number of facilities just in the state of Maryland. And part of our process, and I don't know when the governor placed the order from South Korea, wouldn't begrudge him or his health officials for ordering tests, but the capacity of all the different laboratories and the number of machines that are across Maryland is part of what we were communicating today, including federal facilities. NIH is in Maryland, there's Department of Defense facilities, and what we assured the governor then, and we assured all the governors, is that we'll open up all of those facilities. But John, back to your point, there was one other element of that, that's the phase 1 testing, and I can't really describe it as well as the doctors here, but it's the contact tracing piece. We really believe that states that meet the criteria of 14 days of cases going down and proper hospital capacity, if they test people that have symptoms, and if they deploy resources to vulnerable populations, nursing homes and other designated vulnerable populations where we believe the threat of serious outcomes from the coronavirus is real, then we also today inform the governors that we will be deploying CDC teams to every state and every territory in the country to assist them in contact tracing. Governor Jared Polis raised a very good point about the legislation the president is currently negotiating on Capitol Hill. He recommended that we make sure that the new bill that has some $25 billion in testing resources also cover contact tracing expenses by states. We assured him our administration strongly supports that. We communicated that to the Secretary of the Treasury and the rest of our negotiation team, and we'll be pursuing that. But we were able to tell every one of the governors that we will be deploying teams. We think of 10 or 12 for a start, from CDC to reside in all of our states and territories to supervise and work with contractors and others to do the kind of contact tracing. So it's test people that don't feel well and may have the coronavirus, keep a careful eye and monitor your vulnerable populations. And when you come across a case, have a team on the ground that can do the immediate contact tracing and testing, and that's how we restrain and contain the spread of the coronavirus during phase one. And frankly, it's the beginning of the structure for how we contain the coronavirus going forward.
And take a look at that map. The governor of Maryland could have called Mike Pence, could have saved a lot of money. Look at these different places. That's Maryland right there. So could have saved a lot of money, but that's okay.
To go to South Korea for
No,
this
I don't think he needed to
testing
go to
kits?
South Korea. I think he needed to get a little knowledge would have been helpful.
On the SBA loans, do you think it's right that major corporations, major institutions like the Ruth's Chris restaurant chain like Harvard University apparently got a lot of money under the CARES Act, money that was supposed to be earmarked for small business owners? Do you think that's fair?
Well, I know one thing, I didn't get any. That's for sure. I didn't get any. We'll look at individual things, and some people will have to return it if we think it's inappropriate.
But should the criteria be changed that that money goes to people who need it?
Well, it's being done by great professionals. It's being done by banks, and as you know, community banks all over the country. That's what they do. They loan money, and they're supposed to do it according to not only criteria, but according to what we think is right. But if somebody got something that we think is inappropriate, we'll get it back. Okay? Good point. Please, go ahead.
Yes, a different question about South Korea. There are reports that you are personally negotiating with President Moon the terms of reduction of U.S. forces on the Korean Peninsula, and that there are 4 scenarios involved. Can you confirm that? And if so, what is your desired outcome?
Well, I think that South Korea had a great talk with President Moon. He's a friend of mine. I congratulate a wonderful election victory. I was very happy about that. He was, as you know, just recently. We are negotiating for President Moon and for South Korea to help us monetarily, because we, as you know, we have 32,000 soldiers there. That varies from 28 to 32,000 in South Korea. And we think that before I came aboard, they paid very little, if anything. So we're defending a wonderful nation, a nation that we have great relationships, but we're asking them to pay for a big percentage of what we're doing. It's not fair. So it's not a question of reduction. It's a question of will they contribute toward the defense of their own nation. We're defending nations that are very wealthy. South Korea is a very wealthy nation. They make our television sets, they make ships, they make everything. And I give them great credit. We've been defending them for many, many decades, as you know, over 8 decades. And I've gone to them in the past. Last year I went to them, and now they're paying $1 billion a year. And I went to them again. I said, look, I'll be back, because that's just a fraction. And again, the relationship is great, but it's just not a fair relationship. We renegotiated the trade deal and made it a much more equitable deal than it was in the past. It was a terrible deal. It was done by Hillary Clinton. It was a terrible deal. The new deal is a much more equitable deal. That's on trade. But on the military, I mean, we're paying for the military to defend another nation that's 8,500 miles away. And they're not the only one I'm talking to, by the way, as you know. I won't go into names, but I've done this. Nobody talks about it, but I think it's appropriate. I think the taxpayer of our country, taxpayers want to hear these things. And so now they've offered us a certain amount of money, and I've rejected it. I just said, it's just, look, we're doing a tremendous service. We have a wonderful feeling and a wonderful relationship with each other, but we have to be treated equitably and fairly. And so that's where it is right now. And what's going to happen, I can't tell you, but we'll find out fairly soon. But I congratulate the president, who's a friend of mine. I congratulate President Moon on having a terrific victory. Please, yeah.
Thanks, sir. A question for you about Governor Cuomo's visit, and then also a question for Dr. Birx, if you'll let me. The New York governor, along with the National Governors Association, in the past have called for aid to be unrestricted, as a lot of state and local governments see their revenues drop. Are you open to the idea of unrestricted aid, or do you want it to be pandemic specific?
Well, we're going to be talking about that in phase 4, as you know, which will start very shortly. And that has to do with infrastructure, hopefully infrastructure, because this country needs infrastructure. We spend all this money in the Middle East, $8 trillion. $8 trillion with a T dollars in the Middle East. But if you have a pothole in a highway someplace, they don't want you to spend the money to fix it. How stupid have we been in this country? How stupid have we been? And that's changing rapidly. You know that. You've seen that, including things like negotiating with friends. But when we are helping friends, friends should reimburse us for the cost. I mean, why should we be defending nations for free? We're defending a nation for free. Now I'm getting $1 billion a year, and we were offered much more than that, but I turned it down. So that's where we are with that. As far as the other is concerned, look, we have to be smart in this country. We've been taken to the cleaner by and I mean with allies, not just with the enemies, with allies. Frankly, the allies have taken us much more so than the enemies. The enemies we don't do business with, right? The allies we do business with. And whoever made these deals, whoever made these contracts, in many cases we didn't have a contract. Like, we didn't have a contract, we didn't have a trade deal with China. They came in and they took $500 billion a year for many years, but anywhere from $200 to $550 billion a year out of our hides. Now we made this great trade deal. Unfortunately, that was a number of months ago, and it's a great deal. They're paying 25% on $250 billion. A lot of things are happening. They're going to have to purchase $250 billion worth of goods, including farm product, up to $50 billion. So a lot of good things are happening. But then what happened with China was the plague hit us, right? The plague. That was after. This was long after we signed the deal. The plague hit us. So I'm not happy about that. Okay. John, please.
A question for Dr. Birx, if I could. Dr. Birx, a question on the virus itself. As it passes from patient to patient and mutates, over time, have you picked up any indication that it has become less virulent? Have you picked up any indication it has become more virulent?
You know, that is an excellent question, because we watch that all the time, particularly with RNA viruses, to really track its adaptation to humans. I mean, you're really asking, has this virus become more adapted to humans and more able to spread, or is it becoming less adapted to humans and less able to spread? We don't have any indication that it's less able to spread, and we'll have good analyses that will come from, obviously, the Roosevelt had its incident with a virus outside of the United States, and we'll be able to look at those parameters. And the DOD and the military have done a great job in really ensuring the health of the sailors, but also ensuring that these questions can really be asked and answered. We have extraordinary evolutionary molecular biologists in this country, all around the United States, and they're looking at this very question. And a lot of the work that we've been doing, and you'll see a lot of work happening with testing in New Mexico and testing in other states. They have extraordinary molecular biologists that are evolutionary biologists, and they'll be able to look at that both in New Mexico, that may have lower transmission rates, and compare that to New York, that has maybe 10x the transmission. But it's an excellent question, and it's something that will be able to be answered by what we see in the United States.
John, what a good question that was. Where did that come from?
Once in a while, I pull one out of my hat.
No, that's very impressive. You know, when Senator Schumer wrote a letter a couple of months ago, and he said, you should use admirals and generals. I said, well, that's what first of all, we have, our vice president has been incredible, but we have the admirals, we have the generals. And I was just talking to the admiral inside just before we came out. I said, did you go to Annapolis? He said, no, sir. I said, oh, that's too bad. That's too bad. Where did you go? He said, I went to Harvard. Oh, that's okay, too, I guess, right? So you went to Harvard, and he was a great student at Harvard, and he's doing a fantastic job. And this young gentleman was very, very successful. But he wanted to help the country. He wanted to come into the country, and we appreciate it very much. It was a big success, big success. Let's do here and there next, okay? We're all set. Good.
Thanks, Mr. President. That's something you talked about your meeting tomorrow with Governor Cuomo that you mentioned. Is there a reason he's coming all the way down here?
I don't know. He wanted to, and
is that sort of travel?
We, believe it or not, we get along. Okay? He was very generous yesterday in particular. Said we did a, quote, phenomenal deal. I don't know if anybody wrote that, but he said that, and I appreciated it, because it's not about me. It's about these people and thousands behind Mike and the Admiral and all of the other people that are working with us. I mean, and you see, look, I don't understand when I see polling and approval ratings for the job. I mean, this group should get a 95. It really should. And we're really helping the governors a lot. And the governors call me, the ones I know, or the Republicans, but the ones I know, and they say it's incredible the job you're doing. Again, not me, the job this group is doing. And you sit here, and I'm watching from the corner, and I'm just saying, boy, it's incredible stuff. When you watch the general get up, General Semonite, and talk about boom, 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 you don't see that. You don't see that when you hear the Admiral speak about the testing, how good it is, and yet people don't like to say it. But remember, it was all about ventilators a month ago. Ventilators. Then we fixed it. You don't hear about ventilators. Where is the ventilator? Jeff, you haven't asked about ventilators recently. What's going on? What about ventilators? We're helping other countries now because they can't have. They're very hard to come by, and they take a long time to make, like years. It's incredible the job they've done, that our people have done, and also private companies have done. You talk about the act. We don't like to use it unless we have to, but a lot of times just the fact that you have it gets you everything you need. So, we don't want to embarrass any of the companies, but we have used it on a number of occasions, and it worked, but it works just as well before you have to use it because they don't want to be embarrassed, and I don't want to embarrass them because they've done a great job. But please, go ahead.
Mr. President.
No, I think right behind you. I promised. I cannot tell a lie. So we'll get you next, okay? We'll get you next.
Talking to her or me?
No, you.
Me, okay. Well, thank you so much, Mr. President. My question, I have two questions. The first one is on testing. You talked about the idea that first it was ventilators, now it's testing. You seem to maybe possibly be implying that talking about testing is a personal attack on you. Can you explain why you think talking about testing is a personal attack, given that the access to testing has been an issue for a long time? There's bipartisan outcry still today that there's not enough testing. Why do you think it's a personal attack on you?
Well, it's not bipartisan. It's mostly partisan. But more importantly than mostly partisan, it's incorrect. You have the experts. Look at these maps. I mean, you have the maps with so many different locations. In the case of, as an example, Governor Hogan, he didn't really know. It was very obvious to any of those listening on the call today, even though you weren't supposed to be on it. I'm sure that some of you were, or representatives were. He really didn't know about the federal laboratories. Would you say that's correct, Mike? He didn't know. He didn't know. And Mike doesn't like to get into this stuff. He's less controversial than I am, but he didn't know about it. And if he did know about it, he would have been happy. No, we've done a really good job in testing. Now, with that being said, we have tests coming out perhaps over the next 2 weeks that will blow the whole industry away. Now, a lot of people love the Abbott test. So do I. The Abbott test is great because it's boom, they touch, they put it in 5 minutes you have. The problem is that doesn't do massive numbers like the big machine. But the big machine takes a day and a half, with delivery and everything else. But we have tremendous testing capability. Remember this, we've tested more than any country in the world by far. In fact, I think I read where if you add up every other country in the world, we've tested more. But remember this, we're dealing in politics. We're dealing with a thing called November 3rd of this year. Do you know what November 3rd represents, right? You know better than anybody in the room. November 3rd of this year, it's called the presidential election. No matter what I do, no matter where we go, no matter how well we do, no matter what, if I came up with a tablet, you take it and this plague is gone. They'll say, Trump did a terrible job, terrible, because that's their soundbite. That's the political soundbite. They know the great job we've done. But with all of that being said, and also there is a thing that somebody could talk to if they want, but I don't want to bore you with it. Not everybody believes we should do so much testing. You don't need so much. We're talking about maximum. The reason that the Democrats and some others, maybe because they don't know, they want maximum because they want to be able to criticize. Because it's almost impossible to get to the maximum number, and yet we've been able to do it already. But with that, and you'll be seeing this over the next couple of weeks or sooner, we have a test. If it comes out, it'll revolutionize the whole world of testing. It'll be something really special. So I don't view it as personal at all. What I do say is, it's something that's not fair to thousands of people that have done such a good job.
The second question I have about your language and how you approached the coronavirus at the beginning. I interviewed someone who said that his family got sick. They went to a funeral in mid-March. And they said mainly because the president wasn't taking it seriously. He said, if the president had had a mask on, if he was saying we should stay home, then I would have stayed home.
Well,
Instead, I have family members. He said his family members were sick and because they were listening to you. Do you feel like, or are you concerned that downplaying the virus maybe got some people sick?
And a lot of people love Trump, right? A lot of people love him. You see him all the time, right? I guess I'm here for a reason, you know? To the best of my knowledge, I won. And I think we're going to win again. I think we're going to win in a landslide. But just so you understand, you're talking about March, right?
Yeah.
And yet, excuse me, I know, I understand. And yet in January, a certain date, you know the date better than I do, we put on a ban of China where China can't come in. And before March, we put on a ban on Europe where Europe can't come in. So how could you say I wasn't taking it seriously? Do you know, I put on a ban on China before anybody in this country died. I put on a ban. And so you tell me, Nancy Pelosi was she wanted to have a street party in Chinatown in San Francisco at the end of February. That's a month later. And then they tell me it's only a political talking point, but you feed into it because you're too good a reporter to let that happen. Really, you are a good reporter. You're too good a reporter to let that happen. Remember this. So at the end of January, I put on a ban. People that were in that room will tell you, I think there were 21 people. I was the only one in the whole room that wanted to do it. Fortunately, I was the one that counted for that purpose. We put on a ban because I was reading bad things about China. World Health Organization should have told us. But I was reading it with or without them. They should have known. All they had to do was read it. They didn't have to even be there. But they tried to cover up for China. World Health covered up for China. But no, wait, but you can't say this. Look, I put on a ban. In other words, I stopped China from coming to the United States. I stopped Europe from coming into the United States long before the March date that you're talking about. So people should say I acted very early. That was a very hard thing to do. Doing that was a very hard thing. I didn't want to do that, but I did it because I thought, and Dr. Fauci said that by doing it, President Trump saved tens of thousands of lives. So I did take it very seriously.
You held rallies in February and in March, and there are some Americans.
Oh, I don't know about rallies. I really don't know about rallies. I know one thing. I haven't left the White House in months, except for a brief moment to give a wonderful ship the comfort.
You held a rally in March.
I don't know. Did I hold a rally? I'm sorry, I hold a rally. Did I hold a rally? Let me tell you, in January, when I did this, you had virtually no cases and no deaths, and yet I put it on. So how could I not? Why was Nancy Pelosi, right? Nancy Pelosi is holding a street fair. She wants a street fair in San Francisco in Chinatown to prove, you know what the purpose of it was, to prove that there's no problem. Many other politicians did the same thing and wanted to prove. While I was, no, of course not. No. I've been, people are amazed at how early I acted, and I did act early. With that being said, it's very hard to say, let's close down the greatest economy in the history of the world. I had to close down. I and everybody else that works with me and close to 350 million people built the greatest economy in the history of the world. Best employment numbers, best stock market numbers, best numbers in virtually every category, even good manufacturing numbers. The previous administration said manufacturing was dead for our country. Even great manufacturing numbers. And you know what? I did that, and somebody walked into my office and said, sir, you're going to have to close down the economy. You're going to have to close the country. But you know what I say to you? We're going to rebuild it, and we're going to rebuild it better, and it's going to go faster than people think. I built it once. I'll build it a second time. Please.
Mr. President, thank you. Michelle Rihanna from America.
Please. Go ahead.
We have, going back to the topic of friendship and bipartisanship, Americans, with the exception of Pelosi, Schumer, and even Romney, Americans have seen an unprecedented chapter of bipartisanship and cooperation on the political landscape. On a personal note, what has been the most significant signal that your relationship with Democrats below the leadership level have changed for the good of America?
I think it's a great question because there is bipartisanship. Look, we're getting the paycheck plan It's already $350 billion was approved, essentially unanimously, and we have another 250, which I think you're going to find out is going to be a higher number than that. Okay, I won't say it now because I don't know if they've released it or not, but it's going to end up being more than $250 billion. And this is going to small businesses and it's going to workers. And these are really bipartisan plans. It's a great thing that's happening. So I think the fact that we're able to do all of this in a bipartisan way is great. Now, the tax cuts that the Republicans did, we had no help from the Democrats, so you can't say that's bipartisan. But this whole thing, getting our country back, and, you know, Nancy Pelosi's been, she's very nasty. She, you know, wasted a lot of time on an impeachment hoax. It was a total hoax, went nowhere, and that was not good. And Schumer, I guess it's the same thing, but he sort of accepted it. He just did what he was supposed to do, and he didn't do very well with it. But, you know, that was not appropriate. That was a bad thing for our country, but it was fine. I mean, I understand the game. They have a little bit of a majority, so they say, let's do something and let's try and stir it up. But they wasted a year. They wasted tremendous. We could have been doing things that would have been great for our country. They could have been looking into China. They should have been looking into China as an example. A lot of people are blaming the Democrats for wasting all that time because it was during that period of time, as you know, that it was fomenting. But I think we've had a great spirit of bipartisanship in a certain way. It's not, I wouldn't say we're going to set records throughout the world, but things are happening that are very good. The country is coming together. And I'll tell you what, the people are coming together. The people are really coming together. I think you're going to find that our country is much more unified. I do think that the press, the media, foments a lot of this, a lot of anger. I really believe it foments tremendous anger. For instance, I'll be asked a tremendously hostile question from somebody, and then I'll answer it in a hostile way, which is appropriate. Otherwise, you look foolish. Otherwise, it looks like just walk off the stage and bow your head. I can't do that. You know, I just can't do that. But a lot of these questions that are asked from certain networks are so hostile, and there's no reason for it. There's no reason for it. We are in a war. This is a World War II. This is a World War I, where, by the way, the war essentially ended because of a plague. That was one of the worst ever. They lost almost 100 million people. But we're in a big war. And I'll say one thing about, because I think it's important. The last person, I did it early, but I was the last person that wanted to close down one of the great economic, you can't call it an experiment, but everything, I guess, in life is an experiment. So I'd say experiments, but one of the great economic stories in history. I'm the last person that wanted to do it, but we did the right thing. Because if we didn't do it, you would have had 1 million people, 1.5 million people, maybe 2 million people dead. Now we're going toward 50, I'm hearing, or 60,000 people. One is too many. I always say it. One is too many. But we're going toward 50 or 60,000 people. That's at the lower, as you know, the low number was supposed to be 100,000 people. We could end up at 50 to 60. Okay, it's horrible. If we didn't do what we did, we would have had, I think, 1 million people, maybe 2 million people, maybe more than that. And you look at, there's one country in particular that decided, let's wing it, let's just keep going. They are being inundated with death. Now, if you take a look at some of the hospitals where, one of them I knew growing up in Queens, and I'm looking at the bodies laying in hallways, being brought into refrigerated trucks, the trucks, these massive trucks, bodies going in. Multiply that times 10. It's not sustainable. And many of the people that have this theory, oh, let's, you know, maybe we could have just gone right through it. I was somebody that would have loved to have done that, but it wouldn't have been sustainable. You can't lose 1 million people. That's that's almost double what we lost in the Civil War. I use that as a guide. Civil War, 600,000 people died. So it's not sustainable, but it could have been much more than 1 million people. I mean, if you took a number and cut it in half and half and in half again, you'd end up at 500,000 people, okay? If you want to make a very conservative guesstimate. 500,000 people is not acceptable. Is that a correct sort of an analogy? So, I mean, I see it all the time by friends of mine, by people that I have great respect for. Well, we could have done this, we could have done. And remember this, when we say 50 and they compare 50 to the 35 of the flu, because it averaged 35, 36,000 over a 10-year period, it's a lot. Who would think that? But we're not talking about, with the flu, it just goes. We're not locking ourselves in our units. We're not locking ourselves in our apartments and not moving and not touching anybody and just saying, you know, the world. In this case, we are. And we're still going to lose between 50 and 60. But if we just kept it going on a normal basis, which is really the only standard that you can compare it to with the flu, because that was a normal basis. You get into an airplane, you travel to Florida, you go to Texas, you go wherever you're going. But in this case, if we didn't do anything, the number wouldn't be 50 to 60,000. The number would be 1 million people dead. It would be 1.5 million, 1.2 million, maybe 700,000. It would have been a number in like that because, and it's so important because I see so much. Oh well, you know, you can't compare it, because I'll tell you what, the people of this country, what they've done, they've gone out of what they had, the way they've lived. It's not great. It's terrible. Maybe the first 3 days, and then all of a sudden, you see what's going on. They want to get going. And I get that fully. But I just say this. If we would have done that, we would have lost anywhere from 1 million to more than 2 million people. Now, with all of the death that we've seen at 50 or 60,000 people heading toward, right now it's at 40, but 50 or 60,000 people, probably over 50 for what I see. But that's with our guard up. If we took our guard down and just said, okay, we're just going to keep this open, we would have lost millions of people. Can you imagine? Look how bad it looks now when you look at the bodies, when you look at Hart Island in New York where they have the mass grave and all of the things that you see. Can you imagine if we had the guard down, if we didn't do anything and we just said, let's ride it out? It would not have been sustainable in any way. It would have been an atrocity. So we've done the right thing. We've really done the right thing. And the people that have worked so hard and dangerously, I'll tell you, again, I say it, but I watch those doctors and nurses and medical people running into those hospitals, and they don't even have their gear on. Forget about gear, whether it's great gear or not, and we're bringing in the best gear in the world. But they're running in with open everything, and they're I mean, the job. They're like warriors, the job they're doing. But if we didn't do the moves that we made, you would have had 1 million, 1.5 million, 2 million people dead. So multiply that times 50. You're talking about you would have had 10 to 20 to 25 times more people dead than all of the people that we've been watching. That's not acceptable. The 50,000 is not acceptable. It's so horrible. But can you imagine multiplying that out by 20 or more? It's not acceptable. So it's a very good question. I appreciate it. We'll see you tomorrow. We'll see you tomorrow.
Can I ask you about Larry Hogan's response to what you just told me, Mr. President?
Mr. President, a question about children.
Thanks, everybody.
All right, everybody, that's the latest out of the White House, the daily coronavirus task force briefing. I'm going to bring you outside of the White House now. Okay, so a little bit of background here, a little bit of story. YouTube has been changing things. They've been trying to upgrade things. So today they launched a new YouTube Studio. And so that kind of changes the way that we do YouTube clips. It kind of changes the way that we operate our live streams and the like and everything. So for those of you watching on YouTube, for those of you looking for those YouTube clips, for those of you looking for the entire news conference, things are a little bit different. So me and Christy are trying to work things as best we can to make sure that we can still get the videos out to you. But please be patient with us because, again, things are different and we're working things out. And even when we do think that we're YouTube clipping right now, they're not processing very quickly. So we're not sure exactly what's going on. But we are definitely working on it. And I wanted you to know that we are on top of things. And when and if we can figure things out, hopefully things will be going a lot smoothly. But it's a learning curve. Like I said, YouTube just put out this new studio today. So we are working on it, and they're probably having some back-end issues as well. So hopefully things will be completely back to normal there as soon as possible. So, okay, I was showing you Mayor Lori Lightfoot in Chicago, Illinois earlier. We had to stop playing it due to some live briefings that were happening. So I'm going to take you back out to Chicago, Illinois. We also have an update from St. Paul, Minnesota, and then we also have that continued update from Connecticut that Christy Larson was showing you earlier. So plenty of things to watch, but for now we're going to head back to Chicago, Illinois. Again, thank you so much for watching News Now, whether it's on YouTube or on coronavirusnow.com.
Building a model that allows us to create adaptive solutions in areas where our overall strategies must go further and deeper. Throughout this effort, we will continue to let the data guide us. The map that has been highlighted has changed since we first began and will continue to change as COVID-19 continues to move across our city. Other patterns will emerge and make evident the need for targeted adaptive action. Patterns, as Dr. Arwady pointed to, such as the rising number of cases that we see in our Latino communities, and the problems we have seen with reporting. Reporting is an issue that our health department has already worked to address, and we have been working alongside them and with a number of other partners that have reached out to us about specific strategies and ideas that we should be taking in order to better reach and serve our Latino communities. This is alongside of all of the amazing work that is happening every day with our Chicago Department of Public Health and every day along all of the services that our entire city government is enacting to support our communities through this crisis. We are fortunate to also have some amazing partnerships that have formed to take our work farther than the city could do alone. Specifically, we are working with AARP to launch a racial equity COVID-19 communication strategy targeting 50-plus year old Black and Latino individuals and their families. This campaign leverages the broad reach and base of the AARP to deliver messages and information on key resources in modes that are easily accessible, bilingual, and contextually relevant to the communities of focus. We are also partnering with a group of Black-owned Chicago-based advertising and entertainment firms in a targeted outreach campaign. The social media campaign conceived by Contender Labs in partnership with Spin Artist and Content Farm leverages the #ButSeriously in an insightful and creative campaign that will be launched this week to provide critical information through the comedic genius of some of Chicago's funniest comedians. Additionally, we are collaborating with different organizations, hosting virtual town halls and discussions, including the 100 Black Men of Chicago and the Urban League, who are working to create forums, virtual forums in which we can continue having conversations and gathering people together to talk more about what the needs are and what needs to be done. We continue to invite these kinds of critical partnerships to help us both identify need and deliver targeted resources. I am now pleased to pass it on to one of our key partners in the Racial Equity Rapid Response Team, Aisha Jaco, Executive Director of Westside United.
Good afternoon. Good afternoon. Over the past 2 weeks, Westside United has worked with the City of Chicago to convene the Racial Equity Rapid Response Team. The work of the newly formed Racial Equity Rapid Response Team is central to Westside United's mission, which identifies structural racism and historical disinvestment in Black and Brown communities as pillars of disparity and inequities. The immediate investments needed to address the COVID mortality and infection rates in high-risk communities also warrants a long-term commitment that this initiative can deliver by building the capacity of communities and residents to arm themselves with the tools and resources to stay healthy and informed. Westside United is committed to working together to decrease the current COVID mortality and infection disparity gaps in Black and Brown communities by ensuring that targeted West and South Side communities have structures in place that allow them to sustain a long-term preparedness plan that provides screening, testing, education, and communications. Westside United is leveraging the work of our anchor institutions who are currently employing strategies like the Rush University Medical Center Command Center, which deploys information, volunteers, social isolation screenings, and other resources for housing insecure populations and high-risk senior communities. Lurie Children's Hospital has a COVID testing partnership with PCC Wellness in Austin and the Lawndale Christian Health Center in North Lawndale, and will be providing testing for communities soon. Amita Health has housing for COVID-positive patients. Cook County Health is providing wellness checks and food insecurity screenings. The distribution of 1 million masks to safety net hospitals and Black and brown communities distributed by Sinai Health in partnership with community leaders like Willie Wilson are all things that we are bringing from our network to enhance the capacity of our communities. We are working to continue to combine these capacities to customize a citywide community-based command center approach in each of our racial equity rapid response target communities to empower our community leaders to have the resources they need to act urgently to support Chicago's most resilient communities. We know that it takes a village to raise a child, and it takes a village to heal our city. And we cannot do this without the leadership of our mayor, without the leadership of our hospitals, but most importantly, without the leadership of our community leaders who are on the ground, fighting the battle, in the trenches, helping the people. At this time, I'd like to turn it over to one of our leaders, Darnell Shields, Executive Director of Austin Coming Together. Thank you.
Greetings. First and foremost, I'd like to thank Mayor Lightfoot and her administration for mobilizing this effort. At Austin Coming Together, our primary goal is to increase the collective impact of our members, community partners, improving the education and economic development outcomes in the Austin community. With the reports of how the COVID-19 is taking the greatest toll on the Black community, the importance of addressing the disparities that exist in Chicago is paramount to us. Austin and most of the West Side is highly populated by African Americans. And it is also a well-known fact that the social determinants of good health are not in our favor. The number of pre-existing health conditions that plague the Black community as a result of extreme poverty, systemic racism, make us more susceptible to the dangers of COVID-19. It is for this reason Austin Coming Together is proud to serve as a community lead in Austin for the newly formed Racial Equity Rapid Response Team, and I'm honored to serve as a steering committee member on this collective effort to address the racial disparities in COVID-19 mortality outcomes. Given our role as a community quarterback in Austin, I believe our direct involvement can help increase the rapid response team's ability to develop and implement strategies that specifically meet the needs of Austin residents. Having said that, one of our first orders of business is to work with the mayor's office to organize a virtual town hall this Saturday and other activities leading up to that to help inform our residents and further come alongside. To learn more about our organization and the information that we will be sharing, please visit our website at austincomingtogether.org or visit us on our social media platforms via Facebook and Twitter. And at this time, I'd like to call up the CEO of the Greater Auburn Gresham Development Corporation, Mr. Carlos Nelson.
Good afternoon, all.
Good afternoon.
My name is Carlos Nelson. I'm the CEO of the Greater Auburn Gresham Development Corporation and the lead agency for the Auburn Gresham Neighborhood Network. The Auburn Gresham Neighborhood Network is poised and organized to continue bringing racial equity rapid response to the residents in our community. I want to thank the mayor and the city of Chicago for her steadfast focus on the disinvested communities on the south and west sides of Chicago. To date, in addition to ongoing wellness checks and door-to-door deliveries of food and essentials to seniors and other vulnerable populations, the Auburn Gresham Neighborhood Network has provided $75,000 in emergency rental and mortgage assistance to families and individuals suffering wage loss due to COVID-19. That is thanks to the city's Department of Housing. Our data shows, though, that there is a demand for nearly $300,000 more in financial assistance to our families. Additionally, we have launched the GAGDC Community Conference Line. It's a service called the Rapid Resource Information Line. It's a very low barrier way to stay connected to the residents, to the families, to the small business owners, to the students, to the other stakeholders in the greater Auburn Gresham community. All you have to do every day at 2 p.m. is call a number to get downloaded with information, 7 to 10 minutes of burst of information about ways to exist in today's difficult environment. We've shared information about managing stress in your lives, being counted census 2020, social emotional learning, and other virtual instructions. You can get more about the topics at 2 p.m. on the gagdc.org website. I am really excited to share the street activations that our Auburn Gresham partners implemented last week. Our partners have decided to descend upon hotspots in our communities, to pass out masks, brochures and information, words of encouragement, prayers, and the message of going home to residents in our community. You might have seen our kickoff last week. You may have seen Reverend Wayne Smith of New Pisgah Missionary Baptist Church or Father Michael Flager of St. Sabina, along with GAGDC's social enterprise, our Urban Green Team, and countless other volunteers passing out 5,000 masks in less than 28 minutes. Upcoming this week, Target Area Development will join, as well as Alderman Howard Brookins, whose ward makes up the largest percentage of the Auburn Gresham 60620 community. Also, Alderman David Moore, Alderman Derek Curtis, Alderman Rod Sawyer, Leo High School, and others will be mobilizing in separate locations to distribute masks, to distribute information to the Southside residents. This crisis has brought community leaders and partners together in a cohesive and unified voice. One message: to save and sustain lives in Auburn Gresham and our Southside community. Lastly, and I know I've run out of time here, lastly, I'd like to mention that for the last 3.5 years, the Auburn Gresham community has planned, has researched, has commissioned market analyses, has designed a regional health and wellness center anchored by a full-service health center to be placed right at 79th and Halsted, a 60,000 square foot facility. We've purchased the building. We've had difficulty in finding the last of the funds to get this project done, but it's frustrating and it's sobering to think how many families would have been supported or possibly lives saved if we'd been able to stand up this Auburn Gresham Health and Wellness Center. When this pandemic is over, it is imperative that we as a greater community continue to fight continue to fight other long-standing epidemics like poverty, like food instability, like little access to health care, and other social determinants of health with the same vigor that we're fighting right now. And thanks to the leadership of Mayor Lightfoot, I know as a community we will continue to do so. Thank you. I'd like to now bring up another community development partner, lead steward, Anton Sills of South Shore Works.
The new normal, I gotta make sure I take everything off. Good afternoon. Thank you, Mayor Lightfoot, for having us here today. My name is Anton Sills Jr. Just want to kind of report a little bit about what we've been participating in the rapid response in the racial equity task force. And I'm going to keep mine shorter because I got a minute left on my phone. But one is, of course, has been echoed here. We've been advocating that, of course, that the expansion of testing happens. We hear this all the time from our community residents across our community. They want to be able to know and have the right kind of information so that they can inform each other around what's happening with the virus. The second thing that we want to make sure that, in particular, PPE, so they talked about the mask and the gloves. We have been partnering. South Shore Works is a partner organization made up of several different organizations within South Shore. We have been able to distribute both PPE masks and gloves on 75th Street at the Quarry, courtesy of Real Men Charities, and notarized and increased the peace. Several micro-local organizations that are doing work that is very important. So increasing the amount of PPE, making sure that people understand how to use them, how to clean them, definitely the instructions on how that happens. So that's so important. The third thing that we are at this table advocating is the expansion of this racial equity team, because Chicago is made up of 77 communities, but oftentimes it is not just across the street. You can live in a different neighborhood. So the opportunity for us to further dive into what has been a long-standing, the huge racial and social disconnection, and you talked a little bit about it earlier around the systematic kind of approaches. So what we are thinking is that there needs to be an expansion there of other community members, and we are sure that that will come. And so this will be able to tap into the assets that are currently in our community, the black psychologists, the black sociologists that exist in our community that have years of resources and access. And critically to this, in terms of the work that we've been doing, not only in South Shore, but the work I do in Inglewood, is around making sure that we have access to super nutritious foods in our community as one of the combative things that we can do to make sure, regardless of the virus or not, that we are protected and then our immunities are high, that we have access to more places for green space so that we can have more physical activity in our community. These are all pieces of combating chronic health diseases that are making this feasting of this virus on diabetes and hypertension so much more critical in our communities. We also want to bring and raise awareness to those who are returning citizens. South Shore has one of the highest numbers of people who are living with government subsidy in terms of housing. So housing is a critical issue that we need to make sure that we're taking a look at. And as people are coming, returning citizens are coming out of the system, we want to make sure that this body is also working with the county in order to deploy ways that we could be working together to make sure that they're tested, they're often coming back and not having a space to live, so their homelessness, so that cycle. And then I think ultimately we want to also uplift and talk about the youth homelessness issue. That's a big issue. They are the ones who are usually not participating in wearing PPEs and masks. It's also because they're not also stabilized in that way. So we have to be really inventive, not necessarily browbeating them, but also, having both ends so that we can make sure that we're supporting everyone in our community so that we can remain healthy. Lastly, I'll just end in saying, at South Shore Works, we say working together for a change. This provides our city an opportunity to really dig into decades long, if not generational long. I was watching The Last Dance last night. Like the things that we're dealing with in our particular communities have been going on for so long. And the death that we're experiencing in our communities needs to make sure that we are able to address them long term. So we think this is another opportunity to make sure that we're marshaling all those resources in our community. And again, thank you, Mayor Lightfoot, Candace, and your team for making sure that we came out together. Thank you, Mayor Lightfoot.
So before we open it up for questions, I just want to kind of emphasize and summarize what we just heard. We stand here with a real opportunity, an opportunity to really move our city in a fundamentally different direction. And I meant what I said before. We have to be intentional about all the work that we're doing in response to this virus to make sure that we are building the foundation that it will last and endure so that this work continues after we're on the other side of the pandemic. And I also have to say that in this otherwise often dark cloud. I see these community leaders, I hear their voices, and I'm proud. I'm proud and I'm hopeful because I know that we have the tools and the talent at our disposal to really address some and solve some very, very tough problems. So I just want to say to all of you, thank you again so much for your partnership, for your hard work, and we are in this with you together, shoulder to shoulder. So with that, I'm happy to entertain your questions. Go ahead.
Mayor, thanks very much. Some incredibly important things that you're talking about here. Broadly speaking, you said that this COVID-19 emergency really illuminates the broken and racist system that we are in. However, we've known about that broken and racist system for generations. Dr. King talked about it in 1966. We have blacks dying at nearly 4 times the rate of whites here. We knew about this in January. What more could have been done to stanch the flow of this development?
Well, look, I think a lot has been done for years. I mean, all these community leaders, our Department of Public Health, a lot of city departments have been working in neighborhoods to try to address some of these big issues. There's a reason why we had a poverty summit in late February, to really shine a spotlight on the generations of disinvestment and inequity that has led to the disparities that we're talking about now. So I can't account for what happened before, but what I know is that in this moment, we are going to do everything we can to right the wrongs of the past. And it's not going to happen overnight, but as I said right before we started taking questions, I feel a power in all of our hands because of this concentrated focus that this moment has given us. So we're building connections across the city in neighborhoods. We're breaking down silos, and we're starting to see the results of that work and real tangible efforts to solve problems. So I feel very hopeful and optimistic in this moment, and we are looking forward, not in the rearview mirror. We're not ignoring the past because we can't. It is our present. But I feel very optimistic about the possibilities for us as a result of the work that has really been accelerated as a result of this virus.
So going forward then, where the areas that you can control, you're laying this foundation. Let's say something like this happens, say 5-7 years from now. What would you like the community response to be? What are some of the silos that would be far more robust, that would help you to take a much more aggressive and more effective approach at the beginning of something like this in the future?
Well, what I hope between now and, God forbid, another crisis like this, we do a number of different things. Number one, we've known for a long time that there are significant life expectancy gaps all across our city, and particularly in black and brown neighborhoods. This work is about getting at that problem. So that's number one. I'd like to see a shrinking of those life expectancy gaps. We've known for a long time that there are issues around food insecurity. I want us to use the work that we've been doing from day one of this pandemic, building systems around food delivery. I want that work to transform itself post-COVID into a lasting infrastructure to address that kind of insecurity. Housing insecurity, that you heard that from a number of different speakers. This is a huge problem. I've been talking about this going back to the campaign days. I think that we have to now use this as an opportunity to really move forward in a much more aggressive and rapid way to address housing insecurity. My friend here brought up the fact that we have so many returning citizens coming back into Chicago literally every month. We have to work with our state partners and make sure, for example, that no one comes out of IDOC unless they're set up for success, meaning they got to have an ID, number one. They should be connected up with a range of different resources. Just for starters, Medicaid. So there's a lot of things that we are seeing as a result of our focus on this virus that weren't in the dark before, but now we know with a true sense of urgency that we've got to address a lot of different things, stitch together the safety net that frankly was shredded, particularly during the years of the budget impasse, and move forward much more quickly to really solve problems in a hyper-local but also at a macro level, because that is really what racial equity and inclusion has to look like now and in the future.
Mayor, let's talk about testing. Everyone is saying, a lot of people are saying, you're saying that we're really never going to get out of this until we get a really strong testing regime. And we're seeing elements of that all around the city and around the region. We heard a number of things at the state and the federal level over the weekend, specifically at the federal level, that the movement is going to be moving towards testing, tracking, and supported isolation, this new acronym TTSI. How do you feel testing is going in Chicago right now? And how much better does it have to be so that we can start to move towards semi-normalcy?
Well, I'll start and then I'll invite Dr. Harvey. We are definitely better than we were before, but we're nowhere near where we need to be. I mean, again, you've heard from all of these leaders, and others would tell you, we really need to have widespread testing in every neighborhood. We're going to need a significant increase in our testing capacity before we can even think about reopening up our city, not just our economy, but our city. So imagine going into one of these office towers down here in Chicago. Without widespread testing, are people going to feel comfortable getting on public transportation, coming downtown, being in congregate work settings? What about going to houses of worship? Are people really going to feel comfortable without widespread testing going back into churches and mosques and synagogues without widespread testing? You get the point. We could go on, but we have to have a much deeper testing capacity linked up to the public health system, and I emphasize that. We've seen some testing go up around the city, and they're doing these drive-bys, but they're not keeping great records, and that information is not being fed up into the public health system so that we know real time what the impact is. That's absolutely critical, and we're going to put some controls around that. But the testing is the future. It has to be part of our present until there is a vaccine, which we have no idea what the timeline on that is, or if we'll get to a vaccine. I shudder to think about that possibility, but we know it's not until deep 2021. Dr. Harvey?
Yeah, I would add that obviously testing is a huge priority for us, and we use this same data that you see on our website to really prioritize where we need to get testing. So I've got a whole team of folks at the Chicago Department of Public Health who are looking at this data and then matching it up against where are outpatient settings, where are inpatient settings, where can we help encourage partnerships between some of our, for example, larger hospital labs and some of our smaller outpatient facilities. How can we think beyond health facilities to other settings where people may need testing? We're at a point now where we're doing about 1,600 tests a day here across Chicago, and if you look back just a week or two ago, that's what we were doing over a week. So we really are every day seeing significant improvement, and what's good is that we're seeing that improvement in particular both in our clinical setting, meaning when you go to see a doctor, when you go to the hospital, but also in our commercial setting. And in the commercial setting is where you think about the traditional way that you go to the doctor and you have to get some blood work or you have to get a test and your doctor is able to order that. We're starting to see that capability really grow, and that's where we'd love to see that very robustly, because then you have quicker turnaround times, then you have all of the data being appropriately reported to public health like the mayor was referencing. And so we have some pretty good plans. I think the other thing though is that the testing at this point that we're seeing is the part that's been fully FDA approved is all diagnostic testing. It's the testing that looks for the presence of virus right now. Is somebody sick right now? And what's coming is the serology testing, the antibody testing, and that's the blood test, the blood finger prick that lets you know whether somebody has been exposed to and their immune system has fought off the virus. So where we think, really in a few weeks, the first few have just gotten the emergency use authorization from the FDA. They're on the path to being more widespread and available. And it's that kind of testing, I think, that we'll really be able to use to have some understanding kind of across populations. And we think about bringing tests to people, not waiting for them to be sick to come in. So we're sort of at a moment of transition where testing is absolutely on the top of our list, and we've got people pushing for it every day in all kinds of ways. But we're also looking ahead to probably just a few weeks from now where we'll start to have more of that validated testing available to really understand what we've seen. Even in our homeless shelters, for example, we're now doing hundreds and hundreds of tests a week. We're identifying people who are asymptomatic, who don't have symptoms or have been very mildly ill, helping to have the testing available to see what that looks like across the whole population will be really important, not just for people now, but as we look ahead. About how big which number is?
That number of people around who are totally asymptomatic. May have already.
Yeah, so that is one of the biggest questions. You talk to different epidemiologists, some will say 20%, some will say 5%, some will say 1%, some will say 30%. If I had to take a guess, it's probably less than 10% here in Chicago, but I don't know that for sure. We'll only know that once we start to actually have some of this testing done.
Sorry to jump in, Dr. Arway. There is a follow-up question for you on testing from Mark Conkle. Can you please share any data on how much testing is being done in African American neighborhoods hit hardest by coronavirus? And if that data isn't available, when will it be available?
Yeah, that data is available. So we continue to see the majority of our testing in African Americans. 44% of it, of the testing that is done broadly, is done in African Americans, again in comparison to 30% of the population. So we are pushing testing where it is most needed. We track that very closely, of course, as we think about increasing access even further.
And where is it available?
Oh, the data is available on the website, chicago.gov/coronavirus, right up at the top of latest data. And we are actually, I failed to mention this earlier, but as of today, we are also posting more detailed geographic data related to deaths, including deaths by race, ethnicity online as well.
Thanks very much. Mayor, the protests that are happening in various places around these stay-at-home orders, we're seeing them pop up here, there, and everywhere. It may be political, it may be not. What's your take on those protests? What kind of patience do people have to have when they start to see those things?
Well, I guess the question that you have to ask yourself is what kind of patience do you have to save your own life, save the life of somebody in your family, save the life of someone in your network that you know? That's really what this is about. It is a very stark choice. I recognize it is difficult for people. It's difficult for everyone. But the data's really clear. We are making progress in the city of Chicago because we're seeing greater compliance with the stay-at-home order, pure and simple. So the question is, do you want to be temporarily inconvenienced, or do you want to lose your life, or have somebody that you love or care about lose their lives? I've said this many, many times from the very beginning of this pandemic. This virus is the kind of thing where the actions of one have consequences on the actions and the life of many. So we have to all be in this together. We can't have a patchwork of different standards in the same region, let alone in the same state. It's bad enough that we have a patchwork across the country. I watched the governor of Florida, I think, fumble once again. His leadership has been wholly lacking in this pandemic. And then he reopened the beaches. God help us all.
Keeping with that idea, you've got just a gorgeous day outside, and we've got a weekend coming, and people are in their gardens, they're planting. Again, just a quick little opportunity to talk about how important it is to follow these guidelines, and what are the police going to be doing about that in terms of enforcing them?
Well, the police department's been very rock solid on this. We're trying to educate people into compliance. The last thing that we want to do is go to the extreme measure of having to arrest everyone, and luckily that's been very, very infrequent. But yes, it is nice. I absolutely understand that people want to get out. There's nothing that precludes you from going outside, getting some fresh air, walking a dog, going for a walk. The point of this from the very beginning, and remains the same, is you must avoid congregate settings. You must avoid circumstances where you are congregating in a park or any other place, a grocery store. You've got to spread out. You've got to give yourself social distancing and really take that seriously. And if we do that, of course people can go outside, but you got to be smart about it.
Would you have any comments on the situation with United Airlines? They announced a $2.1 billion loss in their first quarter. Huge Chicago company, national, international. What's your take on that?
Well, unfortunately, the circumstances of United, I think we're going to see play out across the airlines. We've been in conversation with them from the very beginning of this pandemic when people stopped taking airline flights, really following the guidance that was given at various levels of the public health departments, city, county, state, and nationally. Airline traffic plummeted. That's why we were supporters of the $60 billion ask from the airlines to the federal government. But I think more is going to need to be done. Air travel obviously is critically important, not just for passengers in business and leisure, but also freight. So making sure that we've got an airline industry that is vibrant and strong, I think is critically important across the country, but is vitally important to the city of Chicago. So we continue to work with and support our airline partners, as well as the airports and the various businesses inside and outside of the airport that rely upon air transportation for their livelihoods.
Were you surprised, though, by that number?
I hadn't focused on the number. It's a big number. There's no question about it. But I'll be interested to see what we hear from some of the other major carriers, because they're having the same kind of B-type problems.
So it's Monday morning, and I had to wrestle my kids out of bed, and the sunshine wasn't helping them to get up, but they had e-learning waiting for them.
Yes.
As the children across Chicago and the region are. How satisfied are you with CPS e-learning as we approach a new week here?
Well, I think under the circumstances, and given that CPS wasn't set up for an e-learning platform, the remote learning that they're doing, I think has been solid. The plans are solid. I think it's a little too soon, since it really began in earnest last week, for us to be able to assess it. But I know that Dr. Jackson and Dr. McDade and their teams are working really hard to make sure that our CPS students get a real education from now through June 18, which is the end of our school year. We can't afford to mail it in. We can't afford not to have accountability. And so we're going to continue to push creative opportunities for our students to continue to learn. I worry a lot about the summer slump, which is a phenomenon, but particularly this year, given the year that we've had, where they missed 2 weeks of school in the fall because of the teacher strike, and now in this adapting to this new reality, and given the challenges that some of our families face in terms of being connected up to digital opportunities for the kids to learn. I think we're learning a lot through this, but I know that it's not the same as being in your classroom, being with your teacher. I mean, I think about the elementary school children in particular. You know, I have very fond memories of my elementary school years. It wasn't a fantastic school, but, you know, we had a class size of 30-ish with one teacher, and those teachers meant the world to us. We looked up to them. We spent as much time with them as we did in many instances with our parents. So not having that physical connection, I think, is a hardship, particularly on our younger children. I've seen some very interesting and creative things that teachers all across the country are doing. I saw one that really stuck in my mind, and I talked to Dr. Jackson about it over the weekend, where an elementary school teacher literally went to the driveway of one of her students and, with appropriate social distancing, was reading a story. Now, I mean, that's unbelievable dedication. And we've got teachers here in our system that every bit is dedicated, and they really need to be now, because we got to think about creative ways so that we still remain connected up with our teachers. My daughter virtually every morning wakes up in similar circumstances yours, wakes up to a video email from her teacher, and they're having classes on Zoom. Those kind of creative ways to stay connected are really important.
We're taking a live look at Times Square in New York City. Hardly anybody out there, but I will tell you there are some days where you see more people than others. But yeah, still a lot different of a picture for Monday night than we are used to seeing, even though it is 5 o'clock on the dot here in Phoenix, Arizona. 8 p.m. there on the East Coast. If you're watching us on YouTube, please like, share, subscribe. Don't just let your friends, your family, your coworkers, and your neighbors know all about us, but also please click subscribe, then sign up for notifications, and you could be alerted anytime we go live. Normally, the News Now experience involves stories from across the country. Lately, we have been in coronavirus mode, and we will continue to do so until stay-at-home orders are lifted and we get back to what we are all referring to now as the new normal, because so many people say that we are just not going to come out of this pandemic the same way that we were before it happened. So I'm going to take you out to Harris County in Texas now. Yes, it is the county that houses Houston, Texas. They provided their response update to the COVID-19 crisis earlier today. Again, thank you so much for watching Fox News Now, whether you're watching on YouTube or on coronavirusnow.com.
As of yesterday, Sunday, we have, or since then, we have 47 new cases to report in areas of Harris County outside of the city of Houston. And unfortunately, 3 people have lost their lives, 3 additional people in our parts of town due to coronavirus. In total, then, we have at least 4,800 cases, at least 79 deaths. We'll see what the city of Houston reports today, but that's the latest information on our end. Last week, we started seeing encouraging signs, and I shared them with you guys. The fact that we've been seeing a rise in hospital intakes, and then it looks like the curve has flattened. That's because of the progress we've all made together. But the difference between surviving as a community and setting ourselves up for a devastating second curve is on you. It is on each of us. We've been able right now to mitigate the possibility of a higher curve, but we're not out of the woods. And so we'll continue to go through this information together. But essentially, you can see the intakes flat, and if we all do our parts, eventually that will fall down and we'll be in a place to begin lifting our restrictions. But how quickly we do that will depend on each of you to continue to stay home so that that curve actually hits its peak and lower. If we work together now, the sum of each of our parts, it's what's going to get the economy back on track and get that peak to hit and the curve to come down. To help our community, we've expanded testing criteria in Harris County. So I want to remind folks, if you are asymptomatic, but you feel you've come into contact with somebody who has the virus, if you think you may have it, you can get tested. Visit readyharris.org. If you are a first responder of any kind, you take priority if you don't have symptoms. And so reach out, go to Ready Harris, and we will be there for you to make sure you get tested. we're still very much in the thick of this fight. From the moment I wake up every morning to the second I close my eyes at night, I'm thinking about saving lives, and I'm thinking about how quickly we can get through this to get the economy back on track. And every time I hear of a new death, every time somebody loses their lives, gets sick, loses a loved one, I think about how all of this, each of those deaths can be prevented to the extent that we stay home and stop spreading the virus to other people. My only priority is preventing those deaths. But of course, getting the economy back on track is another one. So this is a top one, but building a strong economy, building a resilient community has always been a priority. I ran for office to protect the American dream, to make sure that everybody had an opportunity at that dream, that we were breaking down barriers to the American dream. And so we were working on early childhood education and transportation. We were working on equitable flood protection. And all of these issues have come to the forefront. We've got folks who can't access test site because of the lack of transportation. We've got workers who can't work, and we had to step up there and make childcare more available because they were having to stay home with their kids. And so I don't want these issues to be exacerbated on my watch. I want to do everything I can to ensure that at minimum we were where we were before this crisis in terms of all of these different issue areas and obstacles that stand in the way of people's full potential. And at best, we do a little bit better. And so, as we lead the response to this crisis, and I continue to focus on protecting lives, we need someone who will be laser focused on helping families right now and combating the long-term economic effects and the long-term human impacts of this crisis. Now, the mayor and I have been working on that, and our teams have been working on that since the beginning. That's why we established a system for people living in homelessness who were COVID positive, for them to be able to isolate. That's why we established childcare for essential workers and financial support. That's why at the county we invested $10 million for small businesses, why we've worked with the judges on evictions, why we've taken so many of these steps. But we want to do it in a way that is more coordinated, and we want to make sure that there's somebody that wakes up every day thinking exclusively of this. That's why Mayor Turner and I are establishing 2 relief and recovery czars to lead our relief and recovery with a range of stakeholders. We've been in close touch about this over the last few weeks, and we have each selected one person. We'll both be announcing our czar today. I will announce the county's czar right now, and the mayor will announce his later this afternoon. And the goal of this is to make sure that our relief and our recovery is inclusive, that it's fast, and that it is coordinated. Just with any natural disaster we've dealt with, it will take years to fully recover from this. It will take talent, it will take creative thinking, but thankfully we have that in Harris County. And so we need to make sure that our recovery, that our relief is more than about getting our economy back and running. Yes, we need to do that, absolutely, but we need to make sure folks don't fall through the cracks. So we'll be focusing on coming back throughout all sectors of our economy, including small businesses, minority-owned businesses, women-owned businesses, those underserved areas. And inclusive recovery means recovery for businesses themselves, but also for the workers. That includes everyone, including the undocumented community, including every worker in this county. This is about ensuring that we have the conditions to thrive, that food distribution is adequate, and we continue to work on that, that there be adequate access to education, to the internet, for example, for children who need to continue learning online, because we know that even when we lift the order, social distancing will have to continue for quite a while. So our recovery has to be inclusive. Our recovery needs to be fast. We won't recover overnight. And we won't see relief overnight. But the reason we want to start now in the thick of this crisis and why we've already started with so many of these measures is because people can't wait. Every day that passes, folks struggle. It's another day of misery and stress. The impacts to the community are huge, and we're lucky there are resources available now, like our $10 million small businesses program from Harris County, like the millions of dollars that have been available through the generosity of this community from the COVID-19 Recovery Fund that's being run through the Greater Houston Community Foundation and the United Way. But we need to prepare for the onslaught of new initiatives and make sure that this is done quickly. And finally, our relief, our recovery efforts need to be coordinated. We have to look holistically, breaking down silos, making the most of every single dollar, whether it comes from the federal government, from the state government, or locally. We know just as with every disaster, there are many programs and funds flowing down, and we need to ensure that we're laser focused and ready to get the most funds into this community as quickly as possible. And that takes navigating of bureaucracy, of coordination, communication, and that's what we're going to focus on. Now, let me stress that this is about relief and recovery. The fact that we're naming a czar does not mean the crisis is over. We're still responding to this. We still have not hit the peak. We've been working on feeding, on childcare, on homelessness, on economic resilience. But the truth is, saving lives has been my #1 priority, and I want to make sure that none of these issues fall to the background, even as we respond to the crux of the crisis, which is why my representative and the mayor's representative will ensure that they don't. And so today, I am pleased to announce Texas State Representative Armando Wally as our selection for Harris County's Relief and Recovery Czar. Representative Wally was elected state representative in 2008. He represents the Aldine area and knows the struggles that families in unincorporated Harris County face every day. He is a leader in our legislative delegation. He's a member of the House Committee on Appropriations. He's the vice chair of the key appropriations subcommittee on Article 3, which is public and higher education. He's a member of the Appropriations Subcommittee on State Infrastructure, Resiliency, and Investment. He serves as a member of the House Committees on Higher Education, Redistricting, Local and Consent Calendars. He served on several committees, including Energy Resources, Human Services, Business and Industry, and others. Most importantly, he is no stranger to working on these kinds of issues. Even throughout this crisis, he's been leading when it comes to protecting our families. He has led at the legislature in issues of health, safety, and economic well-being of families. He was raised by a single mother, the oldest of 5 children, and was the first in his family to graduate college. Armed with all of that experience and life experience, he's become a champion for the important priorities that we want to make sure are in the forefront of this relief and of this recovery. Mayor Turner and I have been in close communication, and as I mentioned, he will announce his counterpart later today. And so I'm so pleased, Representative Wally, that you have stepped up to lead this. You have my full support and my full confidence to lead our community into an adequate relief, adequate recovery, and make sure that you and the mayor's nominee and appointee are bringing together leaders throughout our community to ensure that we are responsible and aggressive and smart in our recovery. I'll repeat my remarks in Spanish, and then we'll hear from Representative Wally. We'll take some questions afterwards. Dr. Shaw is here to respond to questions, of course, the representative and myself. Repito brevemente en español. Desde el día de ayer hemos
will be the county's czar to coordinate all of the relief and recovery efforts taking place. Now, Armando Wally is a member of several state committees and is aware that the community. He says that for someone who could deal with not just the immediate impact of what's taking place, but also someone still responding to a lot of different situations. She does have, she does not want to open.
All right, everybody, as you can tell, when they were giving remarks during Spanish earlier today in Harris County, Texas, they actually had somebody translating over her voice. So again, you're hearing somebody else's voice, not the woman at the podium providing the update, and that's because she is providing remarks in Spanish.
All by the wayside while we're dealing with a crisis. There are other responsibilities that the county will not hit that history, be in charge of relief and it is the same priority.
Together, and we always emerge stronger than before. This crisis is dire and it's serious, but we have an opportunity here to show the country how to move forward. I look forward to working with our partners at the City of Houston and leading this effort to work together in bringing needed resources to the area and put the region back on the road to recovery. I want to thank my wife and my kids. I've been homeschooling my boys the last couple of weeks. They're probably sick and tired of me, actually, but I do want to thank my wife, who's also a healthcare professional, works in a hospital setting. But I want to thank the people of this region, the people of Houston, Harris County, for giving me this opportunity to give back in a much different role than I have in the past, and that is as a member of the Texas legislature. And so with that, I'll take any questions, but at this point, I understand that Dr. Shaw may have some comments as well. But I just want to thank you, Judge Hidalgo, for the opportunity to serve this great region. And God bless you, and continue to follow the guidelines of distancing, 6 feet away from folks. And when you're actually using masks, don't touch the middle part, as my wife says. Make sure you adjust them correctly, but make sure you practice social distancing. Make sure you follow the rules of our healthcare experts, because anything that we do in the recovery is predicated on the advice and consultation of our healthcare experts. Thank you, and God bless you.
Thank you so much. Thank you so much, Representative Wally, for your leadership. We'll now take questions for the representative, myself, or Dr. Shaw as well.
Okay. This one, if you can also please answer it in Spanish. This is for KTMD. And do you agree with relaxing social distancing and some restrictions in the coming days, as the governor plans to do?
So we've been in close communication with the governor as to the plans for our community. I think that we'll continue to need his support. We're grateful for the partnership on opening up our rapid testing sites through Walgreens. We're continuing to work with him and now a member of the state legislature on this issue. I know that the governor has moved forward on relaxing rules for elective surgeries or procedures in some hospitals. I've been in communication with the hospital leaders about that, and they feel that they have enough space of yet. My caution would be we have to continue watching those trends. You know, if the intake at hospitals, which right now is flat, it doesn't mean it's peaked, it hasn't come back down, but it's not rising. If that begins rising again, I think we have to take a very close look at that, because we have to ensure that those hospital beds can be available for people who most need them. But right now, the conversations with them is that is adequate. Now, in terms of other measures, we're working to see, maintain social distancing, whatever we do. So if the governor has instituted some options for retail pickup, we want to ensure, and I believe he's got those guidelines, ensure that folks aren't coming into contact as they're picking up their materials. Now, of course, we have to abide by the recommendations the governor issues, but we have to make sure that we're keeping people as safe as possible in those recommendations. For now, it means, limiting that contact. Obviously, people I see more and more wearing masks, and we're definitely headed in that direction. And look, it's just sheer math. The more people come into contact with one another, the higher the risk that those case counts are going to go up. We've not reached the peak yet. We haven't. It may still climb back up, but most importantly, it may come down. And we have the power for that curve to reach its peak and come down, at which point we will be in a position to begin lifting orders as long as we have the testing and we have the epidemiological capacity, which we're building. And so I would urge people to not relax their efforts, because if you do, this will only extend itself longer. Voy a repetir en español. El gobernador ha dado ciertas guías. Él y yo hemos venido trabajando en temas de más pruebas. Por eso establecimos las sedes de pruebas en Walgreens. Ahora tenemos, está bien hacer.
¿Qué ayuda existe? ¿Cuáles
fondos que vienen de? As I said, the work was going on. We knew we were going to name somebody at some point, and so now we've come to that point, and they will work very closely together. They will work to invite other leaders who formally need to be part of a group, of a council, and they will also be overseeing the efforts. This is not an honorary position. It is not a symbolic one. This is a position that will get things done. And so that's why I've named Representative Wally, who has a track record of getting things done for this community. And I know that the mayor's representative also has that track record. They very much complement one another. So we are putting together a stellar combination to drive our region forward.
Okay, KTMD, Telemundo also. A medida que todo regresa a la normalidad, el usar mascarillas continuará siendo opcional o obligatorio como en los
y eficientes so that everybody can go back to work. And so we're working on that, Dr. Shah's team, round the clock, with my team, with the healthcare leaders, on ensuring that we have enough epidemiologists and systems to be able to identify folks who are sick and isolate them. But we can't do that if the new cases every day are so high and if we haven't hit the peak. And we just haven't hit it right now. So when it will be sooner if you stay home. If you stay home, the new case count, the new admissions at the hospitals will continue to decrease and decrease until it's clear we've hit the peak and we're at a point where we begin opening things up. In terms of what we will open, those are the discussions that are going on right now. And one thing I can say with certainty, we won't be able to reopen mass gatherings, right, at once. It's going to have to be a phased approach. And so those are the conversations we're having. It will have to be tiered. We will have to be watching the data. And this will be a conversation that will probably continue going on for long after we begin lifting the restrictions, because we will always run the risk of that virus coming back. And so that's why when we reopen, and regardless of what we reopen, we're going to have to keep that social distancing. We're not going to go back to life as we know it, not for a while, probably months, maybe even longer, because the virus is still there. We've not developed immunity. We've not developed a cure or a vaccine. All we've done, and this is powerful, and it was your work, is we've stayed away from one another so that the contagion doesn't happen. But the minute we come back together, it will rise inevitably. And so we have to have a low enough rate that we're able to isolate. We have to have enough testing. We have to have enough epidemiologists. And we have to hit the peak, which we haven't hit yet.
KTRK, will Representative Wally be paid? Will he quit his law firm job, or will he assure that his law firm will not seek contracts in relation to any recovery dollars?
Yeah, Representative.
Sure, it's a great question. Will not be paid. This is an unpaid position. My law practice has nothing to do with, I do a lot of family work, so there's no conflict between my law firm and the work that I will do on behalf of the citizens of this great city and this great town. So, follow-up question, I'm sorry, what's the second?
It was regarding your law firm. If you will quit your law firm job and will assure that your law firm will not seek contracts in relation to any recovery dollars.
No, I don't. That's not the role. That's not my practice anyway. So we'll be okay. Well, there won't be conflicts of interest in that component.
Thank you so much, Representative. And yes, we've gone through and worked with the county attorney on any possible conflicts. I take transparency and ethics very seriously, to the extent, as folks know, I don't even take campaign contributions from anybody who does any sort of business with the county since the minute I was elected. So there is no shadow of a conflict of interest in the work that I do, and we've worked with Representative Wally to ensure that this position is solely about making sure that the community sees that relief and that recovery in the best way possible.
From KPRC, Mario Diaz, there's a report out this morning with regards to the rodeo and its closure. How much communication was there between the county and the city's health department in shutting the rodeo down? Officials were discussing how the virus can spread easily and its impact on the rodeo was expected. In hindsight, do you feel your office handled the situation properly?
Yeah, the rodeo feels like many weeks away at this point and many tough decisions away. Because of the decisions we made, we saw a report about a week ago from Rice University that we saved already 4,500 lives. It's probably more at this point. And they were decisions that were unpopular. But as always, and I mentioned it right now, I don't make decisions based on politics. I make decisions based on science, based on data, and that means sometimes taking positions that are unpopular or that people misconstrue, and I'm okay with that as long as we are doing things right, doing right by the community. And so when the virus started, when we found out there was a case, and we were being told, let's wait until there's evidence of community transmission before we close the rodeo. And my sense was, guys, we're not testing enough. And so obviously there's probably community transmission, we're just not catching it. So I'd already made the decision, okay, today, I remember it was a Monday or a Tuesday, so today, if not tomorrow, we've got to shut this down, even if there's no evidence of community transmission. And coincidentally, the gentleman who ended up being diagnosed that had been to the rodeo cook-off and it was community transmission, that happened the same day. And so I feel that, as far as I'm concerned and my folks are concerned, that we were ready and making the decision regardless, just trying to be smart about the fact, look, if you're not testing, you can't just say, I'm going to wait for something to crop up. That's probably not going to. And the fact that we made the decision and we've had such a positive outcome compared to similarly situated communities, just shows that it was the right one. Now, I don't think it's the time, and there will probably be tomes written about whether what we did was right or wrong. And so that's why I tell the story of how everything came about. But really, I don't think we will know for quite a long time. We're very much still in the thick of it. It may be that we still end up using the NRG shelter, for example, if the curve comes back up. We're not at a point right now of assessing whether what was done was right or wrong. We're at a point of digging in even deeper to continue with our efforts, because we are not through, not by a mile. We don't even know if our curve has peaked yet.
And just in that same matter, what, if anything, should have been differently?
What should have been done differently? At this point, I wish that from early on we'd had testing, but I've said that from the start. I mean, I'll always give it to folks straight. And that was, I'm just trying to remember, that was around the time when folks said, well, are we going to have testing tomorrow? How about the day after? How about the day after? I said, look, we won't, because the supply chains aren't there. There aren't enough reagents. There aren't enough test kits. There aren't enough cotton swabs. There just isn't enough of this in the country right now that we need to be able to do the number of tests we have to do. And I said that from the very start. And if we'd had the tests that we needed, we wouldn't have had to shut down. We would have been able to do what South Korea did and simply identify people who were sick and isolate those people. And I don't want that to happen again, and that is why I'm asking for folks to help us out until we hit that peak. And in the meantime, we've done everything we can. We went from 2 test sites to 6 that Harris County helped bring together. The city of Houston, of course, doing theirs as well. We are working to ensure that those materials that we have in our fixed sites can be transported. That's really the obstacle we're facing right now, is we're not able to take the test kits, the materials, to the places where some folks need testing. And then we're working with our epidemiological teams to be ready so that the second time around, once we lift the order, so that then we can isolate and put ourselves in the best position to be able to identify cases, isolate them, and everybody else can still work. And so I don't want to have to use that big hammer again. We had to the first time because there simply weren't supplies available. The county was ready to open up 10 sites, and we had a system and we had a website that's worked fabulously, but we didn't have the materials because they just hadn't been available in this country until recently. So that will always weigh heavily. That's the reason our economy had to shut down. But right now we're still there. We still haven't hit that peak. We still haven't figured out how to match the testing exactly with the needs. And so help us out, stay home, help us hit that peak sooner. We will do it. If you stay home, we'll hit it quicker. We'll be able to begin lifting the order quicker. And we're working on our end to leverage the resources we do have so that we can identify and isolate folks as they get sick. But we can't do that if we have too many cases, if we haven't hit the peak. Yes, Dr. Shah.
So, Dr. Amir Shah, Executive Director, Harris County Public Health Authority for Harris County. I just want to echo what the judge just said, that there are two bits of information that, in general, in terms of buckets that we're following. One is related to case counts in the community, which gives us really a breadth, if you will, of what the transmission looks like across the community. And the second piece of it is what's happening in the hospital system, which gives us really severity of who of the community who has been infected requires going to a hospital, and certainly from a hospitalization standpoint, if that means that they need to get to ICU care or be on a ventilator, that's when you start to have really the issues. These are the two buckets of information that we're following, and the judge is absolutely right. Early on, and even now, we still have one arm tied behind our back in terms of getting all the testing constraints out of the way so that we can have a better understanding of that first bucket, which tells us the breadth of what's happening, where it's happening, the transmission in our community. That remains a countrywide, a nationwide issue. That's not just for Harris County, it's not just for our region, it's not just for Texas, it's across the country. And what I wanted to emphasize, and this is what I really wanted to say, was that we have these sites that are available, and we have not hit that capacity over the last few days. Yesterday, we've had really bad storms. We couldn't even keep, we had to close the sites down because of the storms and the rain and the weather. So we're asking people to go to readyharris.org, readyharris.org, to go on the online screening tool. We want people to sign up to get tested. Again, we're prioritizing those with symptoms, but we recognize that there are people who have been exposed who likely do not have symptoms who can still be tested, and we're able to test them because we have capacity in our system. But the other piece is that we've also been hearing that some people are saying, well, I can't get on the internet, I can't go online. So I want to also share the phone number 832-927-7575, 832-927-7575. We will walk you through the registration piece to get to those testing sites. Again, this is critical for us. We need to make sure that people are getting tested in our community so we can get an idea about the amount of transmission, which then drives so many of our decisions. And I want to just echo that, because that is such a critical piece, not just early in the process, which is what the judge spoke about, but even today, we need to have that testing, that capacity to help us be able to really understand what's happening in our community.
Thank you. Jueza, ya por último, la
You have been listening to a news conference that is still ongoing with County Judge Lena Hidalgo and Dr. Amir Shah. There is an individual who is not on camera right now, and that is State Representative Armando Wally, who represents the Aldine area. He has been selected as the county's relief and recovery czar. So he will be taking many of the responsibilities at the county.
All right, everyone. So again, that was the coverage from our sister station earlier today, Fox 26 in Houston, as you just saw. And there are a lot of Spanish-speaking families out in that portion of Texas, so they had to make sure that they got the the coverage out in Spanish as well. All right, so we've got Los Angeles Mayor Eric Garcetti providing his daily update. He's been talking for about the last 20 minutes. I have been recording since the beginning, so you haven't missed a thing, and I'm going to show it to you right here on News Now, also on coronavirusnow.com. Again, regardless of where you are, thank you so much for watching. Really appreciate it. Mayor Eric Garcetti from the city of Los Angeles is coming up in just seconds.
Los Angeles. For more than a month now, you've had me inside your homes, as each night I've updated you on the work that we are doing to fight for the soul of this city. The collective march forward that each one of us and our neighborhoods and our families and our communities are undertaking to save lives, to not only have this moment of retrenching so that we can be safe, but looking forward to how we will reopen and one day reimagine this city. I want to thank you for all that you are doing as always. The lifeblood of this city doesn't flow through places like City Hall or a Hall of Administration. It flows through our neighborhoods and through our people. And by that measure, Los Angeles is an incredibly strong city. I shared last night the state of our city. And while I did say that we are strong and remain ready to fight this crisis, I said we're also at home. And we're bent, we're grieving, but we are not broken. That we have the ability to reimagine a moment in which we will once again rise and fly in this city of angels. We will get through this together, my friends, and we will get through it because of our spirit. So let me turn to today's data and update you on the information you need to know today. Today, the county reported 1,491 new cases in Los Angeles County. That brings the total confirmed COVID-19 positive cases to 13,816, a 12% increase since yesterday. But that is by far the largest number we've seen, more than double our previous peak of 711 new cases on April 4th. But it's important to note that that was probably because a backlog of cases, a new laboratory that came online, and a lot of results that came in one day. Not necessarily a single day surge, but just a reporting surge of today. For comparison, the past 7 days, we've seen an average daily increase of 654 new cases. Still a large number, and one that we should expect to keep seeing in the days ahead. In the city of Los Angeles, those cases were 716 new cases today, bringing the total to 6,224, a nearly 13% increase since yesterday. And today, many of you followed the antibody test conducted by USC and LA County that we've been involved with. I brought the doctors last week to this briefing, Dr. Simon and Sood. They shared the first results of the first wave of antibody studies to see what the prevalence of COVID-19 in the general population was by testing for the antibodies that we generate in reaction to COVID-19. And it showed that the rate of COVID-19 infections far exceeds the number of confirmed cases, something that we knew, but now we're starting to get data for. It also points towards that only a small percentage of adults in the county have antibodies to COVID-19. The number they came up with in the initial study was that 4.1% of the adult population in LA County from this sample, but it was a representative sample, are COVID-19 positive or have been COVID-19 positive. That would mean that our mortality rate, which we've been measuring at about 4.5%, would be much lower. It would mean many more people have been exposed to the COVID-19 virus. But it would also mean that still more than 95% of us, if this study is representative, still do not have that, do not have any potential immunity, and are still vulnerable to being able to catch this disease and die from it. Today we learned of 17 new deaths countywide. This brings our total to 617 deaths. And each night, it's simple to just say numbers and to forget with a steady drumbeat that these are human lives of our loved ones. But we must never know those connections and how important these people have been to us, no matter who they are, whether it's a friend or a family member, a colleague, or somebody who lives in our neighborhood. We mourn with you, all families who tonight have lost a loved one. This was a 3% increase in deaths since yesterday. And for comparison, the past 7 days, we're seeing an average daily increase of 43 new deaths. So deaths are doubling every 7 days. This weekend, we learned that in America, COVID-19 is now the leading cause of death in the United States. The virus has killed more than 1,800 Americans almost every day since April 7th. That's ahead of heart disease, that's ahead of cancer, and we all know people who have died of heart disease and of cancer. So let's do everything that we can to stop COVID-19 in its tracks before we see even more loved ones taken by this deadly disease. The death toll would be far worse were it not for the heroic work that we're seeing from our doctors, our nurses, our janitorial and support staff at our hospitals. We're doing everything to ensure that they have the resources they need and are not met by a crushing and dangerous surge in patients. Thank you for protecting them as they protect us. So good news again across our county and our general emergency hospitals. Yesterday we had 1,573 beds available, including 1,301 for acute care and 272 intensive care unit beds, an inventory of 1,040 available ventilators. We're looking to keep Angelenos healthy, though, to stay safe and out of those hospital beds. And testing helps us do just that. So let me update you on testing. Now in 33 testing locations across the county. 3 locations open today, including one at the Good Samaritan Hospital where I was born in Westlake. And today we have the capacity to test 12,000 people a day. It's a remarkable statistic and one of the leading ones in the country. And by the end of today, we will have tested through these centers approximately 80,000 people. Add private labs and our public labs as well. We have now tested more than 100,000 people in Los Angeles County. Each day, we're conducting more than a third of all tests that are done across the state, and each day we have the capacity to test twice as many people. We are offering same or next day appointments to remind everybody who has any symptoms. So get tested, coronavirus.lacity.org/testing. For families, remember, each family member, if you have symptoms, should fill out your own appointment, but get a test today and help us know who is out there, who is positive. As we saw from our serology test, many more people have that. So even if it's mild symptoms and you think you got this, please take a test. It helps us and it helps protect all of your loved ones as well. Each night at this briefing, I have shared that this crisis has been so hard, not just on the lost lives, but also on the lost livelihoods. And everybody in Los Angeles can feel that. COVID-19's devastating economic impact extends also to our city's budget, which I released today. Our budget year is kind of different than the calendar year. It starts July 1st and ends on June 30th. And this time of the year, by our city charter, I release a budget to plan for those 12 months that start on July 1st. I usually say that budgets are a statement of our values, but as I shared last night, this is also a document of our pain. Hard times are ahead, harder than what we saw in 2008. Revenues are down across the board. Transient occupancy tax, a fancy way to say hotel tax, sales tax, parking tax, utility users tax will all be hit especially hard. And there will be cuts. Los Angeles reacted swiftly to COVID-19, and that quick response also extended to our budget. I immediately implemented a hiring freeze, stopped any new programs in any of our departments, and now that hiring freeze will be extended into this next fiscal year. And I directed department heads to make some tough decisions about the hard but necessary cuts ahead. And over the course of the next fiscal year, most of our civilian employees, myself and my staff included, will incorporate a reduced work schedule resulting in a 10% reduction in pay. Even as I have declared, though, a state of fiscal emergency, we will not compromise on those things that you depend on government delivering. We will not compromise on our response to COVID-19, not one fewer test, not one fewer worker helping those who are unhoused get indoors, not one fewer paramedic getting you to the hospital when you need to be delivered. We will not compromise in our fights to make sure that this extends to everyone, whether it's folks that are living in Skid Row through emergency shelters and Bridge Home transitional housing, Project Room Key hotel and motel rooms, all while we expand health and hygiene on our streets. And we will not compromise our commitment to your public safety through our police officers and firefighters who are on the front line during this crisis. And we can keep doing what we can to ensure that we make it easier for those folks who are most hard hit by this, so that folks can make rent and businesses can stay afloat or reopen in the days ahead. Let me be clear, back to basic investments that keep our neighborhoods safe, that keep our streets clean, that keep our families housed, that keep our children and our seniors fed, these are not open for compromise or cut. Coming into this crisis, too, I want to thank our city council and my team for the work that we did for 7 years to build up a reserve fund. As I said last night, you win no awards for it, you get no headlines, but we built up a reserve fund that's twice as strong today as the city was before the 2008 Great Recession. That means that while we have to make cuts everywhere, no program will be completely cut, but all programs will receive some cuts. The proposed budget I put forward anticipates that the economic impacts of COVID-19 continue into not just this year, but future years. And it's imperative that we do not dip into existing reserves to avoid greater sacrifices in the future. And it also points out what I said last night, that our federal government needs to step up and help our states and help our cities, just as they've helped big corporations. Our city, like so many others across the country in worse positions, need that federal support, not just to cover costs, but shortfalls so cities don't default on debt, so workers can keep their jobs, so that infrastructure can continue to be built, so that our recovery comes back stronger and swifter than it otherwise would. And I'm grateful to our federal partners for agreeing to cover some of the costs that we are incurring in COVID-19. We can bill some of those back and get some of the money that we're fronting for things like testing and shelters. But now, Congress must pass what was put forward by Speaker Pelosi and Minority Leader Schumer to put $150 billion for states and local government. And this is not a partisan issue. In red and blue and purple states and cities, we are all suffering. And I've had very good, hopeful conversations with the Speaker and our congressional delegation as we work to loosen restrictions on emergency funds. I hope it can be part of this package that is being negotiated now, but no later than the next big package. We need to make sure those dollars flow. And members of Congress who are still holding out and taking our states and cities and holding them hostage, don't let America's states and cities die. Step up and bail out America as you're bailing out American corporations too. Working together, we can get through this crisis. That's the spirit that we have engaged since the beginning of this. And there's so many people behind me and beside me and in front of me. And so many of those people are you, watching tonight. You know your leadership within your own family, or maybe your school community. Maybe it's your neighborhood or your workplace. But you are stepping up as leaders, not passive and powerless, but strong, active, and powerful in this crisis. LA County needs your help. And one of the places that has guided our philanthropic work and other work is making sure we look at those who need help the most. LA County is home to more than 1 million individuals living with disabilities. And this crisis has shined a bright light on the significant needs of this community. 26% of folks living with disabilities in our county also live in poverty. And more than 40% live in households that are food insecure. It's a staggering number. So while this pandemic has strained all of us, our neighbors with disabilities are among the most vulnerable, and we need to meet their needs now. And help is on the way. And I'm very pleased to announce a new partnership with Fox to provide free meals to individuals with disabilities across our city. We all know the historic Fox lot and the history in building our city and Century City up. But thanks to what was then out-of-work folks that used to provide meals to hardworking, blue-collar workers in our film and television industry, we're putting them back to work, thanks to Fox, and delivering 2,000 meals 5 days a week for the next month to serve folks who are facing new barriers accessing food during this emergency period. The Fox Food Service team will prepare meals on the Fox lot on the west side and deliver them to a hub at one of our public library branches, where then drivers from our access services will pick them up and bring them directly to people who need them. And to ensure we're reaching the right individuals and families, our Department on Disability has partnered with the California Department of Rehabilitation and 20 community-based organizations that already serve individuals living with disabilities across LA to identify people who will benefit the most. And in the weeks and months to come, the city will continue to build on this with more meals, more grocery delivery services as part of our larger effort to make sure that we address food insecurity among people who are living with disabilities. And so thank you to the great team at Fox here in LA. I saw some awesome photos of everybody from the studio chefs and workers all the way to the CEO, Lachlan Murdoch, coming together to load those meals up and to get them to people in need. And we're so grateful to everyone in this city, and in this city family especially, who stepped up, including Stephen Simon and his team at the Department on Disability, and City Librarian John Szabo for opening up vital space to this effort. Thank you to you and your teams. When we talk about our budget, we're focused on the basics of city government that we depend on in a crisis like this and every other day. It's how we'll keep the lights on, the water flowing, the streets clean, and everyone safe. When we talk about delivering meals to folks with disabilities, we're focused on the basics service to the most vulnerable. And when we talk about what's happening in Los Angeles right now, we see how this crisis is bringing out the most basic features of our common humanity, our generosity, our compassion, our willingness to lend a hand, to not see the differences between us, but to find the common ground. We see this in Susan Sanders and Andrew Whitmer in Valley Glen, who've gone door to door to find out what people need and then organize volunteers to pick up medicine, food, and other necessities for seniors and those who can't leave their homes. Thank you, Andrew and Susan. We see it in efforts of Chicas Mom, Inc., a nonprofit in the Northeast San Fernando Valley that's been handing out meals to the vulnerable and started delivering meals to residents and doctors at the Olive View Hospital in Sylmar on Good Friday, and they promise to keep it going every week. Thank you. We see it in LAPD officer Esteban Cifuentes, who's collected box loads of apples and oranges and bananas, juice boxes and fruit cups for seniors living in the Imperial Courts public housing development. And we're seeing it in the coalition of the Peace Chapel Church, the Rebuild California Alliance, and the community health councils in South LA who set out to provide food for a few people in their neighborhood for 2 weeks, but thanks to donations and support from the communities, they're now providing 250 meals each night to fill the gap for families in deepest need. These aren't isolated incidents. They're a reflection of the city. These are the examples of extraordinary kindness that are sweeping across LA, reminders that every small act actually makes a big difference. These stories show what it means to lead with LA Love. And I want to thank you all for being a part of this recovery. So I'm going to keep tonight brief and answer questions, but as I always say, stay healthy, stay safe, and stay at home. Love and strength, Los Angeles. With that, I'm happy to answer your questions. Thank you.
Our first question comes from the line of Claudia Pesciuta with KNX News Radio. Please go ahead.
Hi, Claudia.
Hey, couple of questions.
Sure.
So, with the furloughs being faced by thousands of city workers, I'm wondering if those who are reassigned to certain essential positions, say like working at one of the emergency shelters at a rec center, if they would be exempted from that. The second question is, you know, given efforts to ramp up testing, if we'll start seeing testing of asymptomatic residents and staffers at nursing homes, given the high number of deaths that we're seeing in these facilities. Thank you.
Thank you, Claudia. As I said early on in these briefings, I was very concerned about nursing homes. I know that LA County Public Health had a team just on that at the beginning, And I talked with Dr. Barbara Ferrer, who was here this morning, and we talked about this because we want to help her in any way that we can. We stood up these strike teams that have gone already into nursing homes to help people when they've contacted us, and announced that website that folks can go to sign folks up. I know a lot of family members went there, but we need to have you need to have somebody at your loved one's senior home facility sign up for it because we need their permission to go in there. But already we've gone to over a dozen places, and we need to really go all of them because this is the place where the most vulnerable and the highest number of deaths nationally, we saw it from Seattle in the beginning, are. So I do want to see us get more tests in there. I talked with my team about it. I hope in the next couple of days we're going to develop a plan together with the county and see how we can get more tests into our nursing homes. But it also lays something out. The reason why it's spreading is not just that there's seniors and people living close together, is that we have a lot of folks in some senior homes that are not paid well. Folks who don't want to pay overtime, allow people to only have one shift. So it requires a lot of these workers are in 2 or 3 different places. And that can lead to spread when workers go between one and another place. So I hope coming out of this smarter and stronger, we can also look at making sure that those workers are well represented, that they are paid for their work, and that they are protected as well, so they don't become among the most vulnerable, as well, of course, as the loved ones of ours that they care for. So absolutely. In terms of ramping up testing to folks without symptoms, not yet. That's not yet the recommendation from County Public Health. If we have enough capacity, we may look at that, and we may look at it in a way that can take a sample. So we can see a sample of the blood test like I just announced the USC study did, and also compare that to a sample of the virology test. So we can see not only who has had it, but who does have it in a random sampling. Because you need to know not just who has had it and maybe is no longer infectious, but how many people are infectious at any given time. For me, doing that is as critical the decisions about opening up, even more critical than the blood tests. So when people are talking nationally, we can't open up until we have more tests. They're right, but many of them are saying it in the wrong way. It's not more blood tests, because right now it's not the recommendation for many public health officials I've talked to, take a blood test and show that you're immune and go to work. It's more to know what level of infection do you have right now today, and that will come from random sampling of virology tests. We may be getting close there, but again, we want everybody with symptoms to get tested first, and if we build that capacity, absolutely. In terms of the essential positions and whether they would be furloughed, that is something that we are open to making sure if they are critical positions that they would be able to work all 10 days of a pay period instead of 9. Yes, absolutely. Thanks, Claudia. Next question.
Next question comes from the line of Mary Beth McDade. Please go ahead with CTLA Channel 5.
Hi, Mary Beth.
Great, thanks. Hi, Mr. Mayor. Yes, a couple of things. Wondering, based on that USC County study that you were referencing with the antibodies, wondering what then is the mortality rate? I know you said it's much lower than the 4-point-something that was originally thought. So what is the mortality rate now? And with it being so low, how will this impact starting to ease restrictions and reopening the economy? Mm-hmm. And then just lastly, I know you said you didn't want to be using the reserve fund that you had built up. I guess I just don't understand why not use it. I mean, wouldn't a world pandemic be the perfect time to use that reserve fund?
Oh, let me be clear. I meant further. We have already taken it from what was about a 7 or 8% reserve fund down to what is right now about 3.45%. But you need to have a basic amount before suddenly your debt and everything that you have cost you even more. In other words, you could spend $50 million more and get downgraded, and that could cost you $100 million. So we're balancing those two things. I meant just no further. Absolutely, it is precisely because we have that reserve fund that we are dipping into it in the hundreds of millions, already $70 million that we put forward to get the testing done and other things. So we will use that, but we can't go down to zero on the reserve fund before you really risk the city kind of toppling into an area that would cost much more than even the money that you're spending. In terms of the county, I'm not going to calculate that rate. I'm going to wait for the USC folks who say they want some time, because you need to wait a couple more weeks to take the moment in time when we were calculating the number of people who were carrying COVID-19 related antibodies to seeing the number of deaths that can come in that 3 or 4 week period. So you can't take the snapshot of deaths today. So it will be higher than if you calculate it today, but lower than the 4 or 5%. But let me be clear, even with a lower death rate, so we'll see what happens. I don't think that New York or Los Angeles or other places are going to be radically different. In New York, there's been as many deaths, more deaths per capita, as we have cases. So if we relax too much and just say, oh, this disease doesn't kill, look at the evidence. In a city like New York, in other places where we've seen it skyrocket, we cannot be complacent. So I think all of us are looking at the ways we widen that aperture slowly. I talked with Dr. Ferrer about that. I think that's something in coming weeks you'll begin to see in very small ways moving forward. But if we relaxed everything, we would see 95% infection by August 1st, according to one projection. That would mean 950,000 people. And even if you had a low death rate, that is thousands and thousands of deaths. So we have to be very clear about making sure that we listen to our public health professionals about how and when we open that up. And I want to reassure everybody watching, this is what we are spending so much time on right now, talking to those experts, waiting for those moments, and that will be guided by county public health, not by kind of a political feeling, not by a protest, not by folks saying, hey, we have to stay in, or other people saying we should all go out. It really should be done looking at that evidence and that advice. And that is my promise to the people of LA, that medicine and facts will guide this. Thank you. Next question.
Our next question comes from the line of David Sennheiser with Los Angeles Times.
Hi, how you doing?
Good, how are you?
Good, Dave.
Hey, so we've been hearing a lot about the hit to the city budget from diminished tax revenues, but another big challenge in the coming budget year is a series of employee pay raises at City Hall. You know, police officers are on track to get about 2 raises, totaling about 4.75%. Firefighters are due to get the same in July. Civilian city unions are scheduled to receive 2% raises. So I'm wondering, have you gone to these unions and asked them to postpone those pay increases until a year when there's not a global health crisis? And if you aren't, are there things you are trying to renegotiate in these employee salary contracts?
No, right now we've had to balance the budget short of that. So furloughs, which are actually deeper and provide much more savings, once you take out of the general fund the amount that those raises are, it still wouldn't be enough, even if those raises didn't happen to balance our budget. So doing the furloughs is something that allows us to actually have even more savings this year. And so that's why we had to go to something more extreme. I do look forward to sitting down and continuing. As people know, those are things that have to be negotiated and mutually agreed upon, and I wouldn't take anything off the table. If our unions come to us and say, hey, we'd rather do this than that, we are absolutely open. But you know, the heroic work that's being done by our city workforce on the front lines, we want to be sensitive to what their rights are in those negotiations and ensure that we have enough to balance the budget. Even if we gave away those raises to our civilian workforce, it would not be enough. And the folks that are out there on the front lines who are not being furloughed are only those most essential people. So again, we'll sit down, talk to anybody, and as I said, my priority is to rebuild that reserve fund back up so that we don't lose even more money. And then right after that, after our COVID-19 expenses and the reserve fund, is to see if we can reduce those furloughs. But that will really depend on whether our federal government steps up and allows us to move forward. If they step up and help us, not just us, but every city in America and every state in America, then we can keep people employed. We can keep them spending on Main Street. We can keep them supporting their families. And you know, that to me is the most critical thing. If we have to see that and it gets worse and we see revenues go down further, there may be further cuts, and there may be even deeper things that we have to do with our city services and our workforce. But I'm hopeful that that won't happen. Thanks, Dave. Next question.
Next we go to the line of Lee Ross with Fox News. Please go ahead.
Hey, Lee.
Thank you, Mr. Mayor. Good evening. You just noted that you've had talks with your county counterparts about slowly loosening some restrictions. I'm curious, what do the results of today's serology survey mean towards that partial target reopening, which so many want? I mean, do the hundreds of thousands of people who've apparently been positive but didn't need to go to the hospital speak to an imminent move forward on loosening restrictions? Or perhaps just the opposite? Do the numbers or others in the survey suggest to you that this loosening isn't quite imminent?
Yeah, I think it suggests that 95% of us are still vulnerable, more than 95%. And so any moves that we make, we'll have to make very carefully. We're not going to have people back in their workplaces, sitting next to each other, people hanging out on the beach, playing basketball. This is not going to happen in the coming days or weeks. But I do believe that, as we've seen, there are ways that we can carefully design some small openings of that aperture. But I won't be dreaming that up. I don't have secret negotiations with the county. I just check in every single day with Barbara Ferrer, with my colleagues. I look at places around the world and the country, and we look at how we can best do that while protecting lives. We're entering a new phase of this that's going to be kind of tough. So I want to take a moment here for everybody listening to explain this. You know, we've done really well. Like, I was really proud to see that 5% or less in the serology test. It means what you have done has worked. And as I've said every single night, if it was working, it would save lives. And that literally means thousands of people are not dead who otherwise would be. I don't even know how to put a price on that. I don't even know how to quantify that. Thank you, like you have been lifesavers. But the irony is those cities that do well and adopt these things early on still have a more vulnerable population. Now, don't get me wrong. In New York, where we've seen more than 10 times as many deaths per capita, they're still very vulnerable, because probably nowhere close to a majority of their city has been exposed to this. So they could do this all over again, or 2- or 3-fold. So for every city everywhere, just because you've had more people exposed, it doesn't mean, Yahoo, let's all go to work now, because we know what that risk is. We've witnessed that. We've seen that in places that are getting refrigerator trucks to deal with the bodies, in emergency rooms where people are deciding who has to live and who has to die. These are excruciating things that we don't want to pat ourselves on the back only a month or two later to say, dang, we should have kept this still pretty tight. That said, we're not going to stay in this condition forever. What we need to do is manage the infections that will happen and make sure they're always lower than our hospital capacity, because that's what will sometimes double the number of deaths. If people can't get into hospital rooms, if there aren't enough ventilators, if we don't have the PPE, if our health workers are getting sick, our firefighters or police officers are getting infected or even dying, as we've seen tragically in New York, where first responders have died in numbers way above anything that we could imagine here. So I know it's a tough space to contain. People want clear answers. Say, Mayor, tell me what the date is. It's not about a date. It's about building our capacity and trying some steps forward. I'm committed to following that county advice, and I do think that, as Dr. Ferrer has talked about in her briefings, there will be some of those in coming weeks where maybe there's some more retail that opens up. Maybe there's some distancing. Maybe people can go back to the barber. Maybe people can do things, just a few of those things, and get some of our businesses moving. But it won't be an opening of the floodgates overnight. And people who are demanding that are playing with all of our lives. So folks who are saying, open up the country, open up the city, the worst thing we could do would be to lift those floodgates up only to watch all of our friends and neighbors die. So we will balance those two things, contain this, and we'll be committed to building up whatever it is. And I've said what those 5 principles are. Make sure there's enough testing, make sure there's the contact tracing so we can track and trace the folks and their contacts, make sure that we have that quarantining that goes on, protect our vulnerable populations who may need to stay indoors longer, keep doing research and development of the medicines and ultimately the vaccine, and make sure that we're caring for each other. Those things will determine all of those decisions. Thanks, Lee. Next question.
Next, we go to the line of Steve Gregory with KFI News. Please go ahead.
Hey, Steve.
Hey, Eric. Good evening. Listen, couple things.
Sure.
The effort to stop evictions for people in the city and the county, does that extend to storage facilities and storage sheds? And that's something that's been coming up with some of our listeners, because that sort of in part and parcel to an extension of someone's home. Also, with respect to saving money, has there been any more discussions about those higher paid people within the city taking a pay cut, voluntary or otherwise? And what about discretionary funds on the council side? Has there been any discussion that you're aware of about rerouting some of the discretionary funds from each of the council members? And finally, if you're going to start loosening restrictions, when do you think we can anticipate going back to in-person press conferences? Thanks, Eric.
Sure. I don't know yet. I'll have to take that advice on in-person press conferences, though I will very much look forward to the day that I can look you all in the eye. And I want to thank all the members of the press who have just done an incredible job reporting on this, who show up every night, who ask the great questions, the tough questions, and everybody who broadcasts this. It means the world to Los Angeles so that we can have this conversation between the people and their elected representatives. In terms of council discretionary dollars, those by definition are with the council, but I've been amazed to see them step up and use that to keep restaurants alive and to serve food in places like Marquise Harris Dawson's district and Joe Buscaino's district, to see folks like Councilmember Mitch O'Farrell and others look at taking their discretionary dollars to help with rent. Every council member is doing that work, and I want to thank them. So I don't think they're squirreling it away. They're actually putting it out there and spending it on the neediest that we have. In terms of folks who earn more or less in the city, everybody is represented, so you have to go through each one of those unions. I've tried to lead by example. I hope that others will too, but I know that everybody will get that haircut, and that means folks who earn more will be contributing more back, and folks who earn less will be contributing less, because that's the only fair way to do it. Lastly, eviction to storage facilities, I don't believe that is covered by the order. Is that correct? I'll look into that, but I do not believe it applies to storage facilities. It's to your primary residence right now. Yes, I got a nod saying yes, that's correct from my crack staff. All right, next question, please.
Our next question comes from the line of Ben Oreskes with LA Times. Please go ahead.
Hey, Ben.
Hi, Mayor. Thank you for doing this. Just quickly on the rec centers, we haven't talked about them in a couple of days.
Sure.
About 20 are open. Do you plan to open more? And if so, how many? We have seen in other cities outbreaks, large outbreaks, which have been very concerning. Do you think that we should be opening more of them?
So let's be clear about different outbreaks, because it's easy to throw them all together. We've seen outbreaks in hotels. We've seen outbreaks in existing shelters. Some of them don't have proper spacing. And this was always based on the advice from our county public health saying, yes, it's better to have folks indoors properly spaced, with nurses there, with temperature checks every day, with food, with trailers to isolate and rooms available, than it is to have them out on the streets. And it is working exactly how we hoped it would. And I've always said, too, that doesn't mean that we will never have cases, but we haven't yet had large-scale outbreaks in the city-run shelters. That said, too, we do plan on expanding more. We have another one, I think, opening tonight or tomorrow, and 3 more this week. So that will add 4 more and get us to about 1,000 beds. At the same time, we're moving with the hotel and motel rooms. I've never seen this as an either or. Talking to folks that are in these shelters, so many of them are grateful to have a nurse right there, to have temperature taken, to have PPE around them, to have a bed, to have the ability to, if they do get sick, immediately be able to have help and to have food. Other folks, that might not appeal to them, but I think the fact that they're 97% filled speaks to the need that was out there in the street long before COVID-19 and now. So I think we will continue, as long as it's the advice of LA County Public Health, to keep those going. As I mentioned last week, we started opening up the trailers, starting in Woodland Hills with the first 14 of the hundreds of trailers that are also available to folks who are experiencing homelessness. I'm proud of that. And then let me give you the latest statistics of the project room key. Tier 1 housing, which is for folks not yet infected, the 700 rooms with 748 guests are occupied in city and county. There's 1,914 rooms secured in the county, 912 of those already operational, and 990 of those rooms are in the city, with 472 operational. In our Tier 2, which is for folks who are already sick, 279 rooms are occupied in the city and county, and 900 units are secured, of which 512 are in the city. And I think that might be even a day old, because I saw some numbers just before coming in here that showed over 50% filled in both of those. We can't get those fast enough. I'm proud, like I said, on Friday that we're about to sign with a bunch of other ones, and those will go hand in hand with the shelters that we have available. After those 3 that will open at the Rec and Parks facilities, we have others that are on the list that we can. We'll look at what the pace of hotels and motels is. If those aren't moving fast enough, we may open more. Thanks, Ben. One other thing on homelessness. We did move out, as folks might have seen, in Skid Row with Skid Row testing. We stood up a testing facility there today. I think there was 166 tests, if I'm not mistaken. Obviously, we have to wait for those results to come back in the next day or two. That's on top of the hundreds of tests that we've given to homeless medical providers who already work with people experiencing homelessness. So that's really starting to crank. And I want to thank the Los Angeles Fire Department who stood that up in Skid Row. It was amazing. It was a steady stream of people, and that's going to protect people who are the most vulnerable on the streets. And I think the latest number was 48 people experiencing homelessness have tested positive in the county of Los Angeles. To put that in perspective, it's a similar number of people who are homeless, a little bit less in just LA City than we have the number of employees, and the number of employees that have tested positive for the city of Los Angeles is now 164. So shows that infection rate is even lower than among our city employees, many of whom are on the line, and we hope all of them get well soon. Next question. Thank you.
Next, we go to the line of Elizabeth Chow with LA Daily News. Please go ahead.
Hey, Liz.
Hi, Mayor. So I wanted to ask your opinion on this idea that all this doom and gloom about the budget is a bit overblown, not in the sense that taking some of these measures are not necessary, but in the sense that the reason that we have all this unemployment and have business closed is more of a intentional move rather than a long time developing or some real collapse in the economic situation. I was wondering how you feel about that view.
I've heard some good theories over the years, but nothing could be further than the truth. This is about saving lives. None of us invented COVID-19. Nobody looked at the deaths around the world or the cases that are here or the deaths that are in our backyard. Nobody told county public health to recommend to us that we should do these moves to make sure that our lives were saved. This is only in reaction to what we have seen. It is real. Those numbers don't lie. If people think it's different, I certainly didn't tell people single-handedly that 95% of them should stop flying, that 95% of our hotel rooms shouldn't be booked. That's people protecting their lives, and that is the reality of our receipts. People understand this. People feel this in their own household. We didn't create this to hurt people's households, and we certainly didn't do this to hurt our own city budget. There's nothing I care more about than the services that we provide. I've dedicated my life to that. And every single dollar I could ever find, I know what the impact is on the streets of LA. We will safeguard them, protect them, but we also will never BS the public. If we say that this money isn't there, it's because it's not there, and you deserve that truth. We will manage those cuts and at the same time say, we're proud that we have a reserve fund that we are drawing from to make those cuts less severe, to make sure we're not laying off employees. I think I spoke to the mayor of Vancouver, they've already laid off city employees. Think about what that would mean to the economy here locally, let alone to the city services that we depend on. So I'm hoping that we will come back. And I guess the one hopeful thing I'd say to people who are worried about that, or to you with a question, is this is a snapshot today. A budget isn't a fixed number for an entire year. I said that earlier. I say we're proposing furloughs, and we're going to need to implement them. That doesn't mean that if the federal government steps up and or the economy comes back, that we wouldn't immediately restore those services and those people, because the people of Los Angeles depend on them, let alone those city employees need to feed their families. So this is a snapshot today, and this will be the most dynamic budget year in our history. It could get better. It also could, Liz, get worse. And we're going to have to then look at that and make those cuts. But we will look at it every week, and we'll think about that again. We have a 2-month plan of our expenditures for COVID-19 costs, and we have a year-long plan for the expenses around things like homelessness and COVID-19. But those numbers are absolutely real. It is the brutal reality, but it is also one that I'm confident we will march through together. Next question, please.
Next, we go to the line of Dakota Smith with the LA Times. Please go ahead.
Hey, Dakota.
Hi, good evening, Mayor. In terms of the furloughs, could you explain, and I want to make sure I have this correct, are you imposing furloughs as opposed to negotiating them? Correct. And if so, what powers do you have to do that, to impose furloughs? Secondly, on the budget that you released today, does your budget assume a complete reopening in a specific month in the next year, in the next fiscal year?
No, I think this budget will be open all the time. There's not a formal reopening, but we're going to be, as I said, looking at it week by week. It will be that dynamic based on what state and federal assistance there is, whether people are traveling, what receipts we get in. We won't even need to think about a formal reopening. We're going to be looking at this much more dynamically and every day, every week, every month throughout the year. Furloughs are in our power. We imposed them in 2009 after the 2008 crash. That was something we need to do. We do need to sit down and speak with our labor partners about them, but that's one area where we don't need the approval. But like I said, I'm open to anything on the table, but we need to save those dollars now. We can't have less money in our budget than we need to spend on protecting people, on ensuring that they're fed, on making sure that we continue forward with critical services. So that's something we had to do then. It is in the city charter power, and it's something that we are not asking for, we are imposing. But I don't want to be, by the way, cavalier about that. I know what that sacrifice is like for city employees. It's shared by us, and it's shared by everybody in the city, and I remain hopeful that throughout this year, if it gets better, it doesn't have to be the entire year, but if it doesn't get better, that will be how we partially balance this budget. Next question, please. Thanks.
Next, we go to the line of Michael Blood with Associated Press. Please go ahead.
Hey, Michael.
Hello, Mayor. You've described a very grim economic outlook for the coming year, but your budget projects that city revenues will increase by about 2%. I'm wondering if you could discuss why such severe budget steps are needed, including thousands of furloughs and virtually across-the-board budget cuts, when you'll have more money next year than this year.
So remember, the money that comes in is mostly been collected during this year for us to spend in this coming year. So most of that came before COVID-19. We don't know for sure. That's a projection, and it could obviously get worse. But we're budgeting with what we think is a semi-optimistic look at our revenues, but a realistic one as well. That comes from all sorts of things. Our commitment to fight homelessness means that we put more and more money into that, and that's a commitment that we have. When we look at just the cost of living increases that come, that is something that happens every single year. So in other words, the expenses that we have brought on by COVID-19, brought on by normal inflation, and brought on by the areas where we're expanding and making sure that our core services around the things that people need are there. That's what drives that we have more than 2% costs, and we have only an increase of 2%. So that's where our cuts come from. And I know that's tough for folks to kind of wrap their head around, but it's like a household. You can have 2% more come into your household, but that doesn't mean that it keeps up with your costs. And for all of us, we've, I think, done a very good job of not only keeping up with costs, but putting money into the reserves. But part of the way we're balancing that is by taking from those reserves that have built up over time. So I know there was a more in-depth phone conversation with our CAO and my Deputy Chief of Staff, Matt Sabo, earlier today, and we're happy to follow on some of the nitty-gritty as to why, but that's not unique to Los Angeles. That's every single city that we see out there. And we are expecting, by the way, there's some revenues that actually go up, at the same time other ones go down. Los Angeles is always better insulated than some places that are looking at 20 and 40% cuts to the revenue because they depend on one source like income tax or sales tax. And when the stock market's down, that hits income taxes. When something like this hits, that hits sales tax. But we have a balancing of a lot of different resources that helps us be healthier than most. Thanks, Michael. Next question, please.
Our last two questions will be in Spanish. We go to the line of Denora Perez with Telemundo. Please go ahead.
Hi, Denora.
Hi, Mayor. I'm interested in asking you in regards to the furlough, and the furlough cuts will be saving money for the city, but how much money are you estimating that is needed from the federal government to help Los Angeles? And then also, if we do have more than one shelter-in-place order in the future, you had mentioned the possibility of 2 or even 3, can there be more furlough cuts in the future until we actually see a vaccine?
So the furlough order that we have in place, it saves us, how much is it about? 140 million from our general fund. Because remember, not everybody is furloughed. There's some people who are critical city services who we can't afford to furlough. We need them to answer 911 calls, to pick up the trash, but they're fewer than you'd think, fewer departments than you'd think. Police, fire, sanitation, and some critical employees and others. So it's 140 million. We aren't bouncing the budget today on the expectation of more furloughs. And I think as you begin to do that, that begins to take away so many city services that we have to ask whether the city can function. A lot of that will also depend on what is open. If County Public Health says, go ahead and open libraries, that's going to be a lot of librarians back at work doing things and making sure that they can serve the public. Are our rec and parks facilities going to be open? Is our zoo going to reopen? All of those different city employees in different departments, it'll depend on that, but we are not planning as of today, and like I said, each one of these is a snapshot on any further furloughs. And the first half was, I think, on shelter in place. What?
How much? We lost $230 million over the last month due to COVID.
Sorry, we lost $230 million in revenues over the last month due to COVID-19. So that's what we put as the projections of how much money we have lost during this period of time. So también en español, yo quiero decir, estos cortes son una pintura del presupuesto ahora, pero espero con la ayuda del gobierno federal. Necesitamos ahora cerca de $300 millones del gobierno federal para prevenir más cortes, para ayudar a nuestros trabajadores en la ciudad de Los Ángeles. Y yo estoy luchando muy duro obtener estos fondos. La proposición del presupuesto de Speaker Pelosi y Senador Schumer es 50 mil millones de dólares para nuestros estados y nuestras ciudades. Y nuestras ciudades son el corazón de la comunidad, del país, y necesitamos tener esta ayuda, no solamente por los bancos grandes, las corporaciones, pero también por la gente en nuestras ciudades, especialmente porque nuestros trabajadores están luchando en las líneas frentes de esta lucha. Los bomberos, los médicos, las personas en nuestros hospitales, merecemos estos fondos porque estamos el grupo de trabajadores que están salvando las vidas de americanos. In English, I forgot to add that too. We probably need at least that much money, $270 million from the federal government, just to replenish what was lost this past month. But what was put on the table was $150 billion for all the states and cities combined. If that came in, I'm not sure what LA City's portion would be, but it would go a large way to restoring critical services that people depend on, to making sure that people weren't furloughed, that people don't lose their jobs, to make sure that we actually can keep our economy going, and that the services that people deserve with their tax dollars come back to the cities where they live. Thank you. Next question.
Our last question for tonight will be from Victor Cordero with Estrella Channel 62. Please go ahead.
Hola, Victor.
Alcalde, ¿qué tal? Muy buenas tardes. I'm going to
Buenas
ask you in English, and then I'll try to do it really quick in Spanish. Okay. I'm sorry to be persistent. I'm going to ask you something, and I want to see if you can help me a little bit with a little more specific question. I know it's kind of hard, but it's my job. Every time I go out on the streets, I see more and more people trying to take advantage of the no-rent situation, not paying rent. And now, with a Friday, Congresswoman Ilhan Omar proposed the idea of not paying rent or the mortgages on the houses, and for 1 or 2 or 3 months, for as long as this lasts, and then at the end, just forget about it and just keep on going. My question to you, what kind of protection there are for the small people, the small individual who has 1 or 2 houses, right, or veterans in this case, who happen to have a house or 2 and they rent it, and that is the only income that they have? I'm going to ask it in Spanish really quick. Alcalde, gracias, y perdone que sea tan persistente, pero es mi trabajo. Le he preguntado un par de veces y me gustaría ver si hay una respuesta un poco más concisa en cuanto al hecho de que mucha gente tal vez no puede pagar la renta por la situación, se entiende. Sin embargo, ¿qué hacemos con estas personas que tienen 1 o 2 casas, o los veteranos, por ejemplo, que tienen 1 o 2 casas y su único ingreso son las rentas? ¿Qué servicios se puede ofrecer? ¿Qué protección hay para ellos? Sobre todo cuando la página de internet que usted ha dado, the web page that you have supplied, sometimes people tell me that it's not working, it's not helping. A veces no les ayuda.
So thank you, Victor, for the question. I'll answer it in English and then Spanish, and then I'll give my remarks for this evening in Spanish. So it's a really, really good point you bring up. If we don't have relief for both renters and for those kind of small landlords out there simultaneously, will add to poverty in multiple ways, and the system will collapse. I always say if you can pay rent, pay your rent. If you can pay some of your rent, pay some of your rent. But anybody who can't pay any of their rent, they will not be evicted. But it's one of the reasons that and they will have 12 months to pay that back. But it's one of the reasons I called on and I support, whether it's Representative Omar's legislation or anything out there. I said in my State of the City address, the federal government should give direct cash assistance to help both renters and mortgage holders to have assistance in having a couple months or however long this lasts, assistance. If we're giving money to banks, we should give, that one of the conditions is that they let mortgage holders have a month or two of relief, that has to be passed on to renters as well. Because people don't have jobs, they can't pay the rent, they don't have the savings. So it is, I think, something that hopefully will be a movement that continues to grow. I 100% support it. We have the strongest, rent protections in the country, but do I think they're strong enough? Of course not. But would it be fair to just say everybody don't pay your rent, and as you said, mom and pops lose their house, lose their mortgage, the banks claim that from them when these are veterans, working class folks, immigrants, and that's all they have? I'm absolutely sympathetic to both of those classes of folks who are working class who don't have much money. Este es muy importante y gracias por esta pregunta, porque necesitamos ayuda por los inquilinos y los dueños. Es importante tener asistencia fiscal del gobierno federal y yo apoyo la legislación del congresista Omar y otras que quieren traer recursos directamente, no solamente a las corporaciones grandes, a los bancos, pero una condición de esta asistencia, por ejemplo, a los bancos, debe ser asistencia a los dueños y una condición de la asistencia de estos dueños es asistencia por nuestros inquilinos. Estamos juntos y la relación entre un inquilino y un dueño es crítico. Y muchas veces hay veteranos, hay inmigrantes, personas que dependen en esta renta. Viceversa, hay mucha gente que no tienen trabajos y necesitamos un hogar. Tenemos la ley más generosa en los Estados Unidos, 10 meses para pagar su renta, un desalojo en evicciones, pero hay una... sí, desalojo, no hay desalojos en la ciudad, pero también necesitamos tener ayuda por los dos lados, porque sin esto, este sistema no trabaja. Gracias por esta pregunta. Thank you to everybody who has tuned in tonight, who will be tuning out maybe as I speak Spanish. Thank you for your strength. I'll see you tomorrow. Keep with it. We will get through this. Muy buenas tardes, Los Ángeles. Gracias por venir a la alcaldía. Anoche les presenté mi discurso sobre el estado de nuestra ciudad. Hoy estamos cansados.
All right, and as he wraps things up here, saying good night to people in Espanol, we are going to continue to move things along here for you, and we're going to go back to Connecticut. We didn't get to finish out their press briefing, so we're going to go head on to that here on News Now. Just one more quick look, though. Here is that look at the totals here in the United States of America. More than 780,000 cases of COVID-19. Now, this is with more than 4 million Americans being tested. And we do unfortunately have 42,138 deaths across our U.S. So like I mentioned, going to go back out to Connecticut to listen to their update on COVID-19.
Broken down by zip code, not by individual. And how we feel is being coordinated closely with our Department of Public Health under Commissioner Renee Coleman-Mitchell, but here in particular is Dr. Lynn Sosa. And Lynn has been working collaboratively with How We Feel. And how's this going to work for Connecticut, Lynn?
Hi, thanks, Governor. So we're really excited about this app. And the reason for that is because we know that the data that we get about testing is really just the tip of the iceberg. And so we want to have data about how many people are sick as well as how many people are not sick at a given point in time. And that's why we're really excited about this app and the data that it can provide to us. It's going to give us another piece of information about how many people are sick at a given point in time and allow us to follow that through the course of this pandemic.
So both these resources are here to answer any questions that you may have. And with that, Max, any questions?
We'll start with the Hartford Current.
Hey, Governor. I wanted to ask about the protest that's going to be starting in about a half an hour. Some of the rally organizers have said that they feel that the executive orders have overstepped a bit. Can you respond to that?
I can respond by saying you've seen evidence that our executive orders and the social distancing, thanks to the amazing people of the state of Connecticut, are working, that we are beginning to bend the curve, at least in the southern part of the state, and this is no time to take our eye off the ball. I loved it when Dr. Koh, who's co-leading our Reopen Connecticut effort, was asked that question. He said, I'd like each of those demonstrators to walk through one of my ICU units and see what pain and hurt and fatalities can result from this pandemic. So it's really important we do this on a safe basis, and how we feel is one of the ways we're going to be able to do it even more effectively.
There was also another press briefing this morning about the workers' compensation presumption. Do you have any plans of writing that into an executive order?
We're definitely going to take a look at that and see what that involves. Look, our essential workers are vital, and they are going in at some risk to themselves. And how we can work that into workmen's compensation is something I will figure out. But I can tell you, as you know, there's absolutely no cost for the testing for anybody, including them. There's no cost for treatment. You get at least your 14 days sick leave paid, and we're going to do better than that.
We'll move on to Channel 3 Eyewitness News. Channel 3 Eyewitness News.
Governor, yes, hi, sorry for the technical difficulty. I had a quick question about unemployment and claims that are labeled as processed. Does that mean the claim has been approved, still in the process? What does that exactly mean?
I believe process means they've been approved, and if the money has not yet been deposited, it's about to. Do you know more than that,
That's
Paul?
correct, sir.
That's about right.
Thank you.
Move on to the day.
Hi, Governor. Julia Bergman with the day. As your office and also the advisory committee debates reopening the state, is there thought given to reopening different portions of the state at different times? For example, might there be a different process for Eastern Connecticut versus Fairfield County, which is obviously closer to New York City?
Well, that's why I have this committee to help advise me on this, and I'm going to reserve judgment. As you know, my instinct is if I open Willie Brew in Willimantic, but there's no bars open in Stamford, you're going to have a lot of people traveling back and forth, and the virus could travel. That's probably not a good thing. That's why I've tended to work, on a regional basis, not just within the state of Connecticut, but perhaps some things can open on a local basis. So let's give our folks a couple weeks. We'll hear back from them.
And one other question. You mentioned at the start that the CDC had changed the definition for positive cases and complications that resulted in death. Can you explain what those changes were?
Want to speak to that?
Yeah, actually, Lynn's the expert on this. Lynn, do you want to take that one?
Yeah, Lynn, thank you.
Sure. Hi. So the goal of a case definition is to make sure that when Connecticut says that we have a case of COVID-19, that we're speaking the same language as somebody in New York or someone in California. And so that's actually a joint effort between the state epidemiologists and CDC. And so that was something that came out actually probably about 10 days ago. And so we've made changes to make sure that we are reporting our data that is consistent and classifying cases according to that definition. And then we realized today that in our daily reporting that we had not pulled all of that information into our daily report. So as soon as we realized that, we made that update today. So this just affected data that we reported since Thursday.
We'll move on to News 8. News 8. Connecticut Mirror.
Professor, could you give us a sense of
how broad a database would you need to have on this app for it to be useful? And do you have any idea as to how long it might take to build that database so, again, that you do have a useful database?
Yeah, thank you for the question. So we launched the app about 2 weeks ago, and as of today, we'll have about 300,000 users around the country. And in the state of Connecticut, there are about 3,500 plus users. And so we're hoping that we'll get more Connecticut users. From the data that we have been able to collect so far, we're already able to get useful information. So for instance, we find through our data that the loss of smell and loss of taste seem to be most strongly correlated with COVID-19 patients. We're also finding that testing is lagged behind, and also being able to receive testing result from when you first get tested. It can take up to 7 days for that result to arrive to the person. And so these are just some of the information that we're starting to find. In order to get more detailed location information, we need to have more users, and we're working on that. And hopefully in the next week or so, we'll have enough users so that we can provide useful location information for the state of Connecticut.
In a state the size of Connecticut, can you give us a sense of how many users that would be to be useful?
So for the state of Connecticut, I think what we can find is that there are going to be many different geographical areas. For example, the New Haven or Hartford, there are going to be different regions. And so what is critical is to get enough people within each one of the regions. And we may not get enough people for all the regions all at once, but starting in more concentrated areas, we hope that we can get sufficient data. For a place like Hartford or Connecticut, if we can get 50,000 users, or maybe even lower, 10,000 users, that should already be enough for us to get quite a bit of information.
And Governor, just one quick follow-up on the workers' comp question. You said you're going to be looking at it, but Labor has indicated they have asked the administration a while ago to look at it. So are you saying that this has not been examined at all yet?
No, I think our team has examined it. I haven't gotten any recommendations from them as yet, Paz.
Okay, thank you.
Move on to NBC Connecticut.
Hi, what is the cost of this collaboration with howwefeel.org? Is there any cost to the state?
No cost to the state that I know of.
Nope, zero.
Okay, that's great. And my second question is actually a follow-up to something I asked last Friday regarding the state's decision to continue to collect a bottle deposit. Paul, you had said that the state would continue collecting that deposit because you never ordered redemption centers to close. You just gave them guidelines for staying open. However, I did a survey of both the redemption centers listed on the state's website, big box stores, major grocery chains across the state, and none of them seemed to be open. And when I asked why, they said it's because the state ordered them closed. So while they may be misinformed, they do all seem to be closed. So would you consider revisiting that decision to keep collecting the bottle deposit?
Be happy to get back to you if we have further discussions with the Department of Energy and Environmental Protection.
Thank you.
Good catch.
Move on to Fox 61.
Zinnia Maldonado, Fox 61. Governor, will there be any type of enforcement for wearing face masks? We know you can't easily enforce something like this, but for example, if a resident needs to take mass transit to get to work but doesn't have a face mask on, the bus driver wants to be safe, but they can't deny a person entry on the bus. What should be done in a situation like this?
I think a lot of enforcement can be done at the local level. You know, my philosophy on that is at this point in time, we'll go up and we'll tell you this is what the rules are, and I want you to follow the rules. There won't be a fine or a penalty at this point, and we'll see what transpires from there. But so far, in all of our different, executive orders, safe stores, safe manufacturing, the enforcement hasn't been a big issue because everybody's tended to follow the lead in a serious way, for which I'm most appreciative.
And then you mentioned new thermometers that will check temperatures, especially important for essential workers at manufacturing jobs. But what about those who don't show symptoms but are positive and are still coming into work? Is there any way you guys are working on how we might be able to pinpoint those residents?
Well, obviously, testing is the best way to do that. The antibody testing would say if you had built up some sort of an immunity. Otherwise, the PCR testing. But that's a big deal to ramp that up to such a degree. You'd have to test that on every week or so because people can get infected. So in the meantime, the fever test is a way that we can see at least a very early symptom, obviously followed by the How We Feel app, which gives us a broad base of what we're trying to do, and masks. It's going to be really important that all those folks, if they can't maintain that 6-foot distance, have to wear a mask in a manufacturing facility.
Move along next to WTIC 1080 News.
Good afternoon, Governor. Something
afternoon.
different today. Oil prices plummeted to negative $38 per barrel. Are you hearing anything about the pressure being put on gas stations and small business in Connecticut due to something that's unprecedented and unheard of?
Well, it's a shocking number considering where we were just a year ago, not to mention 10 years ago. I want to make sure that drop in oil prices is reflected at the gas pump, first of all. I think that's, incredibly important. I know what it means in terms of our transportation fund because we rely upon the gas tax to rebuild our roads and bridges, and that's taken a real hit. So I think about the plunge in gas prices in a different way than many people do. It's also going to have amazing international security issues. Russia is going to lose their base of funding pretty fast. And what's that going to mean in terms of transforming that country? We'll see.
And if I can, earlier on the teleconference with the White House, a few of the governors asked Vice President Pence to ask the president to, ask protesters not to come out like they are going to shortly in Hartford. Did you join in that call at all?
I definitely joined in the call. I don't remember that particular question, but I'd echo what my fellow governors on both sides of the aisle said. I mean, the president was pretty clear a couple of days ago. I'm going to leave it up to the governors. I'm going to give you the best guidance I can, but you're the place where the rubber meets the road. So we don't need him going out and, inciting people to, create some disturbances. We're going to work through this in a very collaborative way, and I look forward to making sure the protesters keep a good, safe social distance and make sure they don't get infected.
Thank you.
We'll move on to the Waterbury Republican American.
Thanks. Sorry about that. I wanted to get a little better handle on the level of testing and how soon that testing would be available for Connecticut to be able to get back to the new normal, I guess. How many, I thought I saw a statistic about 85 tests per million right now. What would it have to be? What are the testing needs here?
I'll start off, and then maybe Josh would pick up on it. We've ramped up our testing big time. As you remember, originally you had to send everything down to Atlanta, then they let us do it within our own public lab. Now we have testing going on at 20 different hospitals, and not to mention Jackson Labs and a number of other private. Jackson has told us they could get up to 10,000 tests a day. Abbott Lab is going to get up to 1,000 tests a day. So we're going to be able to ramp up in a significant way, and that's just the PCR testing, the testing that determines whether or not you've been infected or not. Josh?
Yeah, that's right. And one of the main work streams that the Reopen CT Advisory Board is studying is this testing ramp-up strategy, both what we want to aim for in terms of testing volumes and then also how we operationalize that, looking at all the different testing technologies, the different sites and delivery methodologies. One of the really great things about having Dr. Koh on this task force is that Yale has a tremendous research organization where they're looking at all these emerging technologies and helping us get good headlights into what could become part of our testing portfolio so we can get out in front of that. So we'll have more to share on that in the coming weeks.
Yeah, but when will this fever testing start? When will you because obviously with this protest today, there are people who want to get back to work, and that's a legitimate concern. So when will you guys be in a position to be able to say, yes, we'll be able to do fever testing, we'll be able to do antibody testing, we'll be and not just first responders or people who have a note from the doctor.
Well, remember, the Abbott lab test right now, all you do is fill out cvs.com, put in your symptoms, and you line up for a test. I got to say, they're very popular and they're filled up. You're going to see a dramatic increase in testing such that we'll be able to make a determination before May 20th about what is the best staging for getting this state opened again. That's a key date for me.
Okay, thank you.
We'll move on next to the Associated Press.
Good afternoon, Governor. It's Sue Haig. Regarding the contact tracing, how do you see that fitting in Connecticut's plan to reopen? And how much of it is happening now? And do you plan on having it more of a technology-based endeavor, or you sort of mentioned earlier that you had a little concern about people going out to residents' homes. So how do you foresee it happening?
Well, Sue, we've got probably 50 experts on the reopened Connecticut, including those that specialize in testing, specialize in a lot of the databases that we're looking at right now. I know Charlie Baker in Massachusetts. I know the CDC down in Washington, D.C. They're thinking about this in terms of a manual operation. Charlie's got probably 1,000 monitors already hired who are there finding out who's been infected and seeing who else they worked with. As I said before, that seems fairly labor intensive. I'm not sure you could scale it up fast enough. So I'm also curious about the technology platforms out there, like the Google Apple one, with due deference to absolute privacy, because that's sort of a hallmark of our country.
And you mentioned that the federal government is getting out of the way of states being entrepreneurial when it comes to finding alternatives for the swabs and the reagents. Can you talk a little bit about, more specifically, what Connecticut, the state, plans to do to try to make those supplies available?
Yeah, working with our labs, see what we can do now that we have the cotton ingredient, allowed to use that for the swabs. Before it was a special material, half of it came from Italy. Italy was in the middle of a pandemic. There was an enormous shortage. So that opens up a lot of possibilities for us. We'll be working with the entrepreneurs at some of our life sciences companies to see what they can develop there. What are the best media to transport the swabs? I mentioned the saline solution. That would be transformative. Anything that lets us get control of this process ourselves, so I don't have to wait for China, I don't have to wait for Italy, I don't have to wait for the stockpile in Washington, is a big plus. So I appreciate the federal government getting out of the way and giving us some of these options. Also, there's a couple of amazing Connecticut companies that are working on the saliva test. And you'd be able to self-test on almost a daily basis. And if we find out that we're able to do this in an FDA-approved way, accelerate that process. You want to get a big testing, as Paul was alluding to, imagine if you could do a self-test, a saliva test on a regular basis at your own home and get that transported and analyzed in real time.
Thank you.
We'll move along to Connecticut Public Media.
Thank you. I have two data-related questions, and the first is for probably Josh on death numbers. And it's, does the state have any specific number on how many healthcare workers in Connecticut have died from COVID-19 related complications? And if so, is there any breakout between workers at hospitals and workers at nursing homes?
We don't have that data, the data split out that way now.
Okay. And the next question is a general question for the governor on data collection. Governor, if howwefeel.org is aggregated to zip codes, are you talking about possibly taking targeted public health actions in certain zip code future? And if so, could you maybe just talk a bit about how that might?
Yeah, I might ask Dr. Jung to help me with that answer, but zip codes is an anonymized way that we can able to see where there might be potential flare-ups. Look, this is not going to go away on May 20th. It is not going to go away on July 1. And we've got to be able to track this in sort of a real-time basis. So, Doctor, maybe explain a little more how the zip code gives us actionable intelligence.
Sure. So through the data that we collect, it may be possible that we can identify certain zip codes to have more people who are infected. And that information may allow us to distribute more personal protective equipments, for example, making more masks available, or providing more information and more advisory for social distancing. And those are the things that may be possible if we have more nuanced information about if one specific area is more severely affected.
But would we be seeing closures coming back in certain areas that had already reopened? I'm just trying to get some clarity on that.
That's to be determined. You know, and I've said before, I'm terrified of the fact that, like some of those other countries I referenced, you could have a second surge, maybe not as severe, but a second surge. And some of those other countries are beginning to close down some of their, socializing places, any bars and restaurants and the such. So I want to be very careful that we don't have to go back. I just think that would be a body blow to our economy. I want to make sure we stay open, and we go forward from there.
Thanks.
We'll move on to Hearst, Connecticut Media.
Hi, can you hear me?
Yes, sir.
Hi. I'm kind of interested for you to go into a little bit more about the peak, Governor. It's going down in Fairfield County then, and when do you anticipate it having peaked in New Haven?
Again, as you could see, based upon just a very short sample, 3-day sample, it is leveling off anyway in New Haven, and that's amazing good news. That's not New Haven City, that's New Haven County. And that shows in a place that we have a fairly dense population. You got Waterbury, New Haven, they are beginning to make a difference. They're following the social distancing. Obviously, it's ramping up in Hartford. I worry a little bit about Eastern Connecticut just because of Boston and the fact that that's on fire right now.
And Governor, I don't know when you found out you were talking about the 35% African Americans. What can you do in the shorter term at this point?
Well, the first thing we wanted to do is make sure we get the testing in an urban environment like New Haven, where we have the broadest options for people to get tested, and B, provide transport for people who can't get transport there, so we can find people who are infected earlier and be able to provide treatment for them on an earlier basis. I think that's number one. And as Paul mentioned a few days ago, I think, this is just one of the long-term reminders of what we learn out of this damn pandemic, which is the health disparities in our country. And we got to do a better job of making sure that asthma and diabetes and a lot of those comorbidities that can impact you not just with COVID, but otherwise we treat on a more comprehensive way. I'm really proud of the fact that we were able to expand coverage of healthcare in a dramatic way over the last couple of months to make sure everybody knows they're going to be able to get the testing, get the treatment they need at no cost. And we have many more people insured than we did before. So those are important criteria going forward.
And I'll just add this. I'll add this, Ken. Remember, this is our first site, one of our first sites in Connecticut, in which you don't have to go to a primary care physician to get appointment for a test. And so that's going to give us the ability to expand upon the opportunity that the CVS Minute Clinic site in New Haven has created for the state. So we're going to be looking for additional expansion opportunities with various other partners to expand testing in our urban communities.
Thank you.
Move on to Boceto Media.
Hi, good afternoon.
Good afternoon.
Good afternoon.
Can you hear me?
Yes.
Yes, we can.
Good afternoon. Today, Governor Cuomo said that he will use the situation to improve many services in New York. Governor Lamont, how will you use the situation to reimagine, improve, and build back better in Connecticut? And my second question is, as protests are racing throughout different states in the United States, including Connecticut, can you talk about your plans for the multi-state council members that will be working with the regional council to reopen the economy?
Yeah, the second question first. Indra and Alfred Coe will be representing Connecticut along with Paul Mounds. They're already having informal conversations, really right now about testing, about antibodies, about PCR, what we can learn from each other going forward. And that will result, I think, in some of our first formal meetings in terms of what we're learning in terms of best practices and thinking about in terms of schedule. Your other question is really important. And Governor Cuomo is right. I mean, out of this crisis, what have we learned? What can we reimagine? How can we be better? We just mentioned the health disparities and what that means in terms of communities, what that means in terms of pandemic, not just for the community, say the African-American community, but for our broader community. And we're going to learn from that and expand on that. It reminds us of the incredible importance of universal health care so that everybody has a level of coverage so that they don't feel like they have to stay home if they're very sick, because we know what that can mean. I can tell you, I'm thinking a lot right now about the state of Connecticut and how we're positioned on the backside of this pandemic. I can tell you that there were an awful lot of businesses and homeowners who are thinking about Connecticut in a whole new light. If in the last 15 years, oh man, I want to be in the big city, that's where the action is. If your office isn't in the big city, you can't get the millennials, and that disadvantaged Connecticut over the last 15 or so years. I think now you're seeing some real advantages with the idea that social distancing may come up again, the idea that you can work from home and telecommute. You don't have to be in, say, the Big Apple or Boston 5 days a week. I think people are going to take a whole new look at a state like Connecticut, and we're going to figure out how we position ourselves going forward. Those are two very different answers to your question.
Thank you, Governor.
We'll move on to CT News Junkie.
Hi, Governor. I wanted to know, you cite hospitalizations as something that you're watching when it comes to reopening the state. So how many days in a row will they have to drop if Connecticut's going to reopen by May 20th?
I think that the Pence Council in Washington said, 28 days, 14 days for Tier 1, which is sort of almost where we're going to be pretty soon. And then 14 days for Tier 2, and Tier 2 gives you permission to think about schools, opening up retail with all the necessary practical precautions. So, Christine, that's why I think May 20th is a date where we really can make some much more informed decisions. And as we tried to talk about in this press conference today, hospitalizations is now just one metric. We're going to have a much better sense of infections, immunizations, fevers, precursors to what may be happening out there, so we'll be much better informed over the next few weeks.
Governor, the Connecticut Legal Rights Project is asking you to release people, if possible, from state-operated psychiatric facilities. Is that something that you are considering?
It's something I got to look into, Christine. It's release to what? You got to make sure that there's a safe place where somebody in that state can be protected and has the necessary support and counseling they may need. That said, absolutely, just like we're doing in other compressed environments where the pandemic can spread. I'll just leave you one thought.
All right, guys, it is that time to have our coronavirus crisis special report with our Fox 11 station.
Advisors and Dr. Narij Sood with the USC Price School of Public Policy. We'll be talking to both of them momentarily. But first, a look at our top stories. The latest numbers, a big uptick in cases in LA, with the county now close to 14,000 cases. But this increase is due to a backlog of testing results. Riverside County now with more than 2,800 cases. Orange County more than 1,600 cases and 33 deaths. Governor Newsom Newsom today hinting at a timeline for reopening the state's economy. Newsom says he will give an update on Wednesday. The governor also announced an initiative to help California students by distributing tens of thousands of laptops and tablets to students in need. Also, the results of a new LA County antibody test have been released. They show the actual number of LA County residents infected with coronavirus could be somewhere between 221,000 to 442,000. That is 28 to 55 times higher than the reported positive cases. Dr. Sood, he's going to weigh in on this soon enough. But first, initial thoughts from Dr. Drew.
Well, this is very much mirroring what they found in Santa Clara County up north. And from my perspective, it could be very good news in terms of returning people back to work if they are proven to have some resistance to infection.
Well, and also the mortality rate, it impacts that greatly.
Indeed. The mortality rate may drop dramatically. It's still a fierce virus. It is still an infectious virus. But based on the circumstance we now have, where we have done the lockdown and looking at these previously infected folks, we may be in very good shape.
Okay, well, we'll talk to Dr. Sood in just a minute. On to this now. Mayor Garcetti is offering some grim news in his proposed city budget. The mayor released a proposed 2020-21 budget today that calls for reducing services.
Hard times are ahead, harder than what we saw in 2008. Revenues are down across the board. Transient occupancy tax, a fancy way to say hotel tax, sales tax, parking tax, utility users tax will all be hit especially hard. And there will be cuts.
The budget cuts include a 26-day furlough for 16,000 city workers. Sworn members, though, of the LAFD and LAPD are excluded. A reduction of 20% for street services and also a 10% reduction on infrastructure spending. Dr. Drew, this doesn't come as any surprise. He did make it a point to say that the priorities are in line to keep the neighborhoods clean and also to make sure that the residents are fed and as healthy as possible.
I like all those priorities, but we've been falling short on many of those priorities for quite some time. So it'll be interesting to see how this plays out. It has to be. There's no money coming in. There's no alternative other than trying to hasten our way back to where some income is produced for the city.
And all while trying to ramp up testing.
Oh, the testing is the only way we get back. We'll talk to Dr. Sood about that. We have to have viral testing, which we've done an amazing job of. We're going to talk to Catherine Barker in a few minutes. LA County has just nailed it on the viral testing, but then we have to come up with a plan for the antibody testings also.
Okay, more on that to come. Governor Newsom giving an update today on how the state is doing in flattening the curve.
Again, hospitalizations are beginning to flatten, but still growing. And we're seeing ICUs bouncing back and forth, modest decreases, modest increases. So again, progress is being made. You are bending the curve. You're beginning to flatten the curve, but it is still nonetheless rising.
So the governor laying out last week that we have to not just flatten, but have the hospitalization numbers and ICU numbers decline. I've been covering his press conferences every day, and only maybe 3 to 4 times have we seen a slight decline, and today there was another uptick.
Well, right, and I wonder what he was talking about. I watched the University of Washington healthdata.org, and I thought, well, we're supposed to be on the downslope here. Look, the bottom line is, though, we dropped the curve. We flattened it and moved it to the left. Now it's staying somewhat consistent. He's absolutely right. It is not taking that downturn we'd like to see it take, but it's from a much lower level, way lower than we predicted. So again, congratulations for having flattened the curve by engaging in our distancing and our quarantine. Governor Newsom, he needs to be given credit for having called it. He called it right. But let's not get worried about what's happening here. This should get better very soon.
Okay, more on that. In the meantime, we're going to get to Dr. Sood right now. We told you earlier the results of an antibody test here in LA. They've been released. One of the main people behind the study is Dr. Niraj Sood from USC. Dr. Sood, thank you so much for being with us.
Thank you for having me on the show.
So, Doctor, your study shows coronavirus infections are far more widespread than the almost 14,000 cases we know about. What's the takeaway? What are the numbers here?
So the key takeaway is that the number of infections are roughly 40 times the number of confirmed cases. And this means 2 things. The first thing it means is this virus is probably less deadly than we thought it was. the mortality rate is going to be much lower. But the second takeaway is that the prevalence is at 4%. And so we're still very far away from herd immunity. There could still be a lot of people who are susceptible to this virus and can get infected. And then the death toll might rise from that. So there's kind of both good news and bad news here.
But by the same token, this is literally hundreds of thousands of people that may now be immune. I just have a question. Was this a rapid antibody test, like one of these rapid tests we hear about, or was this a blood draw where you actually measured IgM and IgG?
This was a rapid antibody test, which had two lines, one for IgG and one for IgM.
Is it possible that it's even, I know there's been a lot of concern about false negatives with that test, so it's possible it's even higher than what you measured?
That is certainly possible, that if the test has high false negatives, the number would go up. On the other hand, if the test has high false positives, the number would go down.
I just keep hearing concern about false negative with that rapid test. But these are, again, we're splitting hairs. And so are you hopeful that these people will be immune, or do we have to get them tested in such a way to prove that their antibodies actually neutralize virus?
So it's the latter, that we have to test them in a way such that we know that their antibodies neutralize the virus. What we're doing here is counting the number of infections and not really checking whether an individual is immune or not. And there's some controversy around, even if you detect neutralizing antibodies, the extent of the immunity as well as the duration of the immunity. So I think there's going to be some immunity, but how long it lasts, we don't know.
So, Doctor, on the low end, it's 221,000 cases. On the high end, 442,000 people infected due to the results of your test. My question is, the 4.1% people infected who you tested, can they now donate their plasma?
Yes, they are potential donors for the plasma. And in fact, I was just on a phone call with a group at Cedars who are running clinical trials and they're looking for donors. So the next round we do the study, we're going to have brochures for that so that people who test positive can go right into these clinical trials and help figure out new treatments for COVID.
And how often are you going to be doing, when's the next antibody test?
We're trying to do it as soon as possible, but it takes some effort to get the test up and running and set up the testing sites and recruit people into the study. So I'm hoping to do it in the next 2 to 3 weeks.
As part of that study, will you check for neutralizing antibodies so we can see what maybe the percentage amongst the ones you find have neutralizing antibodies?
We right now don't plan to test for it because the ELISA tests, which could potentially test for neutralizing antibodies, are scarce. And it's easier to get people to recruit in a study where they're doing a pinprick versus getting blood draw.
Got it.
Well, we
Great
appreciate
study. Well done.
Yes, thank you so much, and we look forward to the next one and getting us back to work and back to normal as we can be. Dr. Sood, thank you so much.
Thank you for having me on the show.
Up next, instead of stressing out next time you go shopping, how about working out instead? We'll have more on what sparked this squat-a-thon in a Costco parking lot. And Supervisor Catherine Barger, she is standing by. She is, of course, the chair of the LA Board of Supervisors. We'll talk to her about LA's fiscal crisis and more when we come back. needs a gym, right? If you have to wait in line, then you might as well get something useful from it. This scene here in Calgary, Canada. A line of customers waiting to enter a Costco took part in an impromptu workout Friday. It was led by a local doctor. The shoppers, who are social distancing, kept up with each other doing squats until they dropped or until they could shop. I know you're not against this, Dr. Doom.
Oh, I dig it. I think it's a great idea. Good for him.
Drop and give me 20 right now. All right, Mayor Eric Garcetti laid out a grim financial future for L.A., worse than the 2008 recession. Supervisor Catherine Barger, she joins us now with the latest on how the coronavirus is affecting L.A. County. I know you're a regular on this special report on the show. So, Dr. Barger, or pardon me, Supervisor Barger, thank you for your time as always.
It's my pleasure. It's my pleasure to be with you.
So we heard Mayor Garcetti saying from a fiscal perspective, this is the worst it has ever been. What about for L.A. County workers?
Well, we're projecting a $1 billion loss in revenue, and that's going to translate into services. But what we've done in the county is we've put aside reserves. So I'm confident that we've got a bridge funding to get us through until the CARE Act goes into play in Washington, and we're hoping they give us the flexibility as it relates to the revenue loss, which really does translate into services because all that money is used for the frontline workers that we have in our hospitals, first responders. So it's going to be a definite hit, but we're not talking furloughs at this point.
That's good. By the way, I want to thank you. L.A. County nailed the testing last week. Overnight, you changed everything with that website and the drive-through testing. I'm hoping other counties are following in your footsteps. Have you become a model for other counties?
I don't know if we've become a model, but I have to take my hat off to Dr. Clayton Kazan, who really did put it together, and now he's going back to his job as L.A. County Fire Medical Director. We've got another doctor that's coming in and is going to ramp it up because all roads, quite frankly, are leading back to testing and tracing. Yeah. And we need to do a better job of increasing that capacity, working with the hospitals who are doing it on their own, but we need to have better coordination, and so we're going to take it to the next level. I mean, we're doing between 10 and 11,000 tests a week, which coming from zero to that, I'm really proud of.
And you've broadened out the pool. You've anybody even with suspicious symptoms now, they just sign up and go. It's very simple. Are you also going to be testing for the antibody? We just did a whole segment on the antibody testing. Is that part of the plan going forward?
So, I mean, we're talking about it. I think Dr. Ferrer is bringing together a team with Dr. Galley, with DHS, and we're going to clearly look at what we need to do to open up businesses again. And again, you know, everything I'm reading over the weekend, the study that was done through Dr. Allen out of Harvard with that bipartisan group, it goes back to testing and the tracing. And we need to do that.
And the timing of when we do that, right? Do you guys have any target timing?
And we've done it. We can do it quickly.
Yeah.
No, we're going to do it quickly. On Wednesday, I'm getting a report that's being put together because I asked actually that we do this immediately. And so I was on a phone call this morning, and by Wednesday I will have a document that we'll present to the board to expand on that.
I do want to bring up the fact that Dr. Ferrer, she announced an additional 1,400 additional cases today, with the caveat that about 1,200 of those were from a backlog. So they're not necessarily new cases. And this is all from one particular lab. So can we expect to see this again?
I hope not. And I know that Dr. Ferrer was not happy about that. I hope we plugged that hole and that we, in fact, now moving forward have the accurate numbers. I know she was a little frustrated, but at the end of the day, you know, I mean, some of the labs were not giving the reporting the way they were supposed to, and so she's corrected that. I mean, we've got better communication going, but we've also got to coordinate with our hospitals who are doing their own testing, and you know, private physicians are doing their own testing. It's not a perfect science, and we need to have better coordination.
Today, Vice President Mike Pence, during the coronavirus White House briefing, he said that we have enough testing capacity for every state to get to phase 1, which would allow us to start to get back to normal life as we know it. Is that true or false for you?
Well, I don't know what he's talking about in terms of capacity. I have to believe that one thing that's been great is when we first put up our testing, the federal government pushed with the FDA to get approval, which was necessary for some of these kits, and had worked very closely with us. So I'm going to take them at their word. But for us, again, all roads in terms of whatever the new normal is going to be, are leading to ramping up testing and doing it quickly. We've got a May 15th date that Dr. Ferrer has put as it relates to Safer at Home. My goal is to have something in place long before that so that we can aggressively move forward with this.
Well, I hope you I hope people are thanking you, because LA County and California at large has done a marvelous job, and we're in great shape because of what you're doing. So it's not time to let up, but it's okay to say we're doing pretty well, and you certainly are.
Yes, we thank you so much.
And thank you. Thank you. I just want to say it's not even about us. It's about the people who have been patient. And I know many are very, very full of anxiety. So I want to thank all of our constituents who have done this with us.
All right, Supervisor Barger, thank you again. We'll be right back with your questions.
Awesome.
Personal trainer and professional dancer in LA. And today I'm giving you 3 bodyweight booty exercises to get core-toned this season. So here we go. Half and full. Half and lift, drop, cross, drop. Lift, drop, hydrant, and cross. To complete my core-tone challenge, make sure you do each exercise on each leg 20 times. And follow me on Instagram for more workouts like this.
Oh, I'm going to follow her. Quarantoned. I like it. Thanks to Kaylee for that quarantine workout she recorded just for us. She's a dancer and a personal trainer right here in LA. Her Instagram is Kaylee_Hatfield. Thank you, Kaylee. Now for our segment, Ask Dr. Drew, joining us on the line is Saul. Saul, what's your question for the doctor tonight?
Oh, hi, Marla, Dr. Drew. Thanks for having me on your show.
You bet.
Thanks for all your work, Dr. Drew.
Thanks,
really
Saul.
appreciate it.
My pleasure.
Real quick, the hospitalization counts on the websites show like 3257 today of COVID-19 patients, and then 1417 suspected COVID-19 patients. That's like a 30% drop. What's the difference there? What's going on there?
What is the difference between
influenza cases?
Or influenza-like or COVID-like that don't turn out to be positive for COVID. But again, we had an uptick in viral influenza-like illnesses this year alongside of the COVID, so it got very confusing. We're generally finding that people that are hospitalized for COVID, there's a higher percentage that if it's suspicious, they're ending up being positive for COVID now. But the reality is that we are getting people into the hospital a little bit earlier. We're keeping them out of the ICU a little bit better. We are getting them into the ICU when necessary in such a way that they can be monitored more aggressively, and some of these novel treatments can be applied before they get on a ventilator. Should they get on a ventilator, more are getting off. So everything is generally going in the right direction as it comes to the more sick patients.
We want to get that curve flattened and declining. All right, Saul, thank you for your question. If you have a question for Dr. Drew, email it to askdrdrew@foxtv.com and be sure to include your phone number. Okay, up next, you know who he is, Billy Bush. He's standing by to talk more about this weekend's One World concert and the moments viewers didn't see. John, just one of 100 artists this weekend at the One World Together at Home event. The 8-hour show raised, get this, almost $128 million, with proceeds going towards vaccine development. And don't we need one of those? Joining us now is Billy Bush, host of Extra, right here on Fox 11, airing in just a few minutes. Billy, did you watch the One World event?
Oh, yeah, it was 8 hours long. I mean, 6 hours on YouTube and 2 hours in prime time on all the, well, not all of them, but most of the networks. And it was pretty awesome. I mean, I got to tell you, Elton John in his driveway right there, you just heard, with the basketball rim in the back. Who knew Elton played basketball? And then you got the Rolling Stones in 4 boxes, how they put this together. The final part, what moved my heart, I came to tears, is Andrea Bocelli, Celine Dion, Lady Gaga, and John Legend together on the prayer. I mean, just sensational. Yeah, there's Elton going nuts in his driveway. I mean, it was just really good. $130 million for Global Citizen and World Health.
Nice.
But
all right. Well, yeah, what a great cause.
Amazing.
Okay, so
really good.
You're also talking about on the show tonight, Florida beaches. What's going on there?
Oh, yeah. So here's the conversation I had with Dr. Dorian, who's the Chief Medical Officer of USC Verdugo Hills, about this weekend's events.
And they came out, threw their masks into a dumpster, and walked right out there and started sun tanning in droves. That's got to drive you crazy.
It drives me crazy because, again, nobody's protected. Everybody's still susceptible. So just because you have this arbitrary day where, okay, we're free to go, no. Every single person that walks onto that beach has a potential for getting infected.
I get it. I mean, I get the feeling, but I mean, I think the docs are exactly right. Wouldn't it be terrible if we got this kickback again?
Oh, yeah.
We got to do it slowly, but I totally get the urge, the feeling.
And I think Georgia's opened their beaches right now, too, so we will see in real time how that works out.
Yeah, as of Friday, in fact, Georgia will reopen gyms, restaurants, all of those major businesses can start to reopen as of Friday. So, yes, we will wait and see what's coming there. And, you know, people are itching to get out. It's going to be warm this weekend, and got to stay away from the beaches here.
I got a lot of good friends who own restaurants and things, and I want to get in there as quickly as anyone does. And when it's finally safe, I'm going to eat out, every night for 2 months. I mean, just to support.
All right. Well,
I get it.
Thank you, too, for having me along as I fill the big shoes of Alex Michelson tonight. Well, so thank you so much. That does it for us, our show tonight. Oh, I got the thumbs up from Billy Bush. That's all I need. Dr. Drew and Alex will return tomorrow at 7. Extra with Billy Bush is next.
They're letting Alex back in the building?
Yep.
All right, guys, that was once again our sister station over at Fox 11 Los Angeles. That's KTTV giving us the coronavirus crisis special report. Have that map up there for you just to give you a live look at those numbers here across the United States of America. Over in the blue, those numbers are how many people here in the U.S. have been tested for COVID-19. Now this number, 117,000, that's how many are in the hospital. Going to switch this over to the green number, which is the total recovered of COVID-19 here in the United States, 72,687. So that's some good news that we have for you here this evening. I'm going to continue things along with more stories from across our country. And I think one of the next interviews actually I'm going to play for us is with the Seattle mayor, Jenny Durkin. So that is with our Q13 Fox News station. And we're playing it for you right here on News Now.
The city is going to allow 2 farmers markets, one in Ballard and one in the U District, to open this weekend. We're hearing from a lot of people who don't think that's a good idea. So try to convince me with all the other restrictions we have in place that we ought to be opening up a farmers market.
We told them very clearly that this is going to be a test run. They look to open up a whole number of farmers markets, and they have changed their policies and procedures on how they're going to conduct the markets. But they understand very clearly that if it's not successful, we won't be able to continue. We want to make sure that they actually can do social distancing. They can have curb pickup. They can make sure that it isn't a place where crowds gather. We're going to have a whole ways of monitoring that. So this is a trial. We hope it works because farmer markets are really important part of our city. They're a way that a lot of people can get access to fresh produce. A lot of our families, that's one way that our families that have less economic resilience have the ability to actually use Fresh Bucks and EBT to get healthy foods. So we'd like to be able to continue it, but it really is going to depend on, again, if the people who are running it and the people who show up can show that they're going to be socially responsible and help the community. So we're hoping that, like a grocery store, people can find a way to do it safely. But if they can't, then we won't be able to continue it.
And is that your call? Are you the one who's going to make that call on whether it is successful or not?
We'll be doing it together with those partners, and we obviously have to talk to the neighborhood communities. You know, we have a very vibrant business communities, both in Ballard and the University District. They're going to help monitor this. So we're going to work and really look at this. I'd like it to be successful. I'd like to show that Seattle can do things differently and safely. But if we can't, people have come too far and sacrificed too much to go backwards at this point in time.
All right, the mayor of Los Angeles had said that it's possible that large gatherings there, including sporting events and concerts, might not happen for all of 2020, for the rest of the year. Do you think that that's possible here as well, that you might ban them through the end of the year?
I think we're really going to have to look at the science and the data. It is possible. We don't know yet what's going to happen as we start to open the economy. We have seen in other parts of the world that when they do that, there's a rise in virus again. Unfortunately, the virus itself is going to dictate a lot about how we have to respond. So I think it's too soon to say it absolutely won't happen, but I think we have to be prepared that the new normal is going to be very different for a long period of time than what we were like before the pandemic.
Is the city getting calls from people who have events in the months ahead? Are you in contact with the Seahawks? What are those conversations like happening? Like, are you saying cancel everything that's, 2 months out or whatever it is? Is there any insight you can give us to what's happening behind the scenes?
Yeah, on the professional sports, they're making that decision nationally. Obviously, all of those sports are in every, state almost. And so they're making those states and having those conversations nationally. It's not just a local decision. For other events, we've told people very clearly that permitted events are not occurring. I think it's likely that continuing that through May, there won't be gatherings in the city of Seattle that are permitted events. But again, I really want to make the decision based on the science and what we're seeing. Again, we are not out of the woods here. Even though we've bent the curve and we're on the right trajectory on the way down, it doesn't take much for this virus to gain a foothold again. If you remember, most of the transmissions that we've seen here in Seattle came from a single transmission in January, which is hard for us to wrap our minds around. So too early to say, but we're going to do what we need to do not to see a rise in the virus again.
So the governor laid out kind of this transitional approach from what we're dealing with now to, he didn't give a timeline, but when we might be able to start lifting restrictions. And he said really a couple things have to exist. First, the social distancing has to really be successful in flattening and bringing the curve down. And then he talked about we need rapid testing and the ability to also rapidly trace contact tracing where individuals have been. There are some companies that are in the process of making some apps that basically would kind of track people and help them and the government understand who they might have come into contact with. The ACLU has expressed a lot of concern with that yes, it's a health emergency, but that would be a slippery slope. Do you have an opinion, Mayor, on those types of apps or electronic tracing and whether it goes too far?
So I think we've got to be very careful about the privacy issues. As you know, Brandy, I have led on consumer privacy and electronic privacy for literally decades. And I think that where we will end up in Seattle is a combination and a hybrid. We will both have an electronic means of people to opt in and get monitored, as well as having to have a huge number of people who can do the contact tracing, because it is very labor intensive. And I would say that the biggest obstacle we have right now to reopening our economy and our businesses is not just the virus itself, but we do not have testing capability in Seattle or Washington State that is sufficient for us to think about how do we do what we need to do?
And you have a legal background, which is why I want to kind of follow up to that, with the idea behind that question. You know, we saw in Michigan a quasi-protest at the state capitol because they feel like they're under martial law and that the restrictions there are go too far. There's going to be a protest in Olympia on Sunday in the same vein. What do you think? And I asked the governor this yesterday. Where is the appropriate balance between protecting lives and preserving liberties? Where do you see that balance where it tips too far, where we've taken too much away?
I think that that's a really important thing as we move forward. The only reason that Seattle has been as successful as we've been in flattening this curve is because of people saying, yep, that's important enough for me to do what I am doing. And so I think that you have to both educate people why you're doing what you're doing, and they have to feel ownership of that. And I would say that we have seen that to a very great extent in Seattle, King County, and Washington State, that the social contract that we have with one another is that we understand the public health and the public good sometimes require each of us to do things that are a sacrifice. You know, we have had hundreds of thousands of people lose their jobs because they did what they needed to do to make all of us safe. We'd have healthcare workers showing up in unsafe conditions to keep us safe. So it's a balance between that social contract and government really leading.
Yeah, well, those people, a lot of them lost their jobs, not because they did it by choice, but because their business closed because the government mandated it. So you do have some people who had no choice but to make the sacrifices necessary.
It's absolutely right. I mean, if you see the first wave, we saw the first loss of businesses when we had our largest corporations starting to telecommute in the city of Seattle telecommute. And the small businesses in and around downtown Seattle and South Lake Union were some of the first to close because there just wasn't the business to sustain them. But this is different. I've said this over and over again. This is not the result of a natural economic cycle. Government made a decision to protect communities in the nation that we had to quit coming face to face. And so government has an obligation to help those people through this time.
All right, one more question for me and we'll fit in two quick viewer questions. You guys gave out some small business stabilization grants. There was a lot of businesses that applied. 250 got them. Many, of course, did not because there just wasn't enough money for everyone. There was one business in particular, I'm sure you know what I'm going to ask you, St. Andrew's Bar and Grill. This is a place that posted a sign early on saying they tested negative for coronavirus. They totally ignored restrictions. They kicked out a local reporter, Lily Fowler. Should they have gotten one of these grants?
So I wasn't involved in the selection. I'll say this. Number one is we tried to do this as neutrally as possible in terms of how people applied, whether they qualified. What they did was stupid and it was wrong. I don't think that masks the fact that as a small business, they may need assistance. So we will have some additional conversations with all the businesses that we're helping on what they need to do to contribute back to our city.
All right, quick viewer questions. One, is City Hall going to lead by example and either cut staff or furlough staff, as so many other businesses have had to do?
So first thing is, I think what's invisible to a lot of people is that city government workers are still working. Your power comes on, your garbage gets picked up, our parks are open, SPD, you know, the services that everyone's counting on during this pandemic is because the workers are still working. And I can be more proud of all the work they're doing, standing up grocery voucher programs, getting help to small businesses. So first, you know, our employees are working hard. Second, though, is we're entering a new financial reality. We will get our new forecast next week. Everyone expects that our revenues will be down. And then together with City Council, and we're going to have to make some really hard calls about how we move forward. We're going to have to submit a new budget this year. And so as we get those new numbers, we're going to be looking at all options that we have to move forward as a city.
So it's possible you might furlough or cut staff as a result of this?
I think it's the last option. I think that for a number of reasons. One is the people are actually delivering services that the people of the city need. Second, I think, as I've said to every business owner that has basically shut down, if they can keep their people on the books, we don't want to add to unemployment and poverty. So we want to lead by example, but we want to make sure that we take other options first. But we have to look at that. In the recession of 2008, they had to do some furloughs. And so we're going to have to, we're going to have conversations with city council, unions, employees, and try to navigate this forward.
Yeah, and we don't want anybody to lose their job, even if they are paid by taxpayers. It doesn't mean they should lose their job. I got this question like 11 times. So have you gotten a haircut since the stay-home order started? And if so, who gave it to you?
My God, can't you tell the answer is no? it's ironically, my last haircut was on February 28th. I went from the Girl Scout lemon cookie parade, and at the end of work, went and got my haircut, went home and got a phone call about the first outbreak in Kirkland, the next day, the first death. And it has been pandemic around the clock since then. So no, I'm not going to try cutting my own hair because
I'll cut it for you.
I'm not sure I trust you with scissors.
I don't know what that means, but okay. I don't know what that means.
I should post some of those pictures from my youth where, I did cut my own hair and the bangs are like this.
Yeah, I'm letting mine grow out. Really quick, we'll keep this one in. This is especially important. It combines the two issues we talked about today, the West Seattle Bridge, Magnolia Bridge, and the situation we're in. Traffic has obviously gone down significantly. In a lot of ways, that's pretty good, because that was one of our paramount challenges before this crisis began. Are there any incentives that you would be able, or the city even financially would be able to give businesses to continue to keep the employees who can be at home, even long after this crisis is over?
I'm not sure there's incentives, but I do think we can look at our mobility patterns and see if there's a way that people telecommute sometimes, or we increase the amount of transit and carpooling, we increase walking and biking. So I think that, if you look at some of the pictures from cities across the world, the before and after, like Los Angeles, their air quality night and day differently. So if we can use this to advance better activities, I think we should try to do that.
The city is going to allow 2 farmers markets, one in Ballard and one in the U District, to open this weekend. We're hearing.
All right, got a little bit of a repeat question there because she went so quickly there at the end, but we do want to continue things along. Let's go out to Good Day New York with their coronavirus crisis special.
From Fox 5 News, this is Good Day New York.
The state of New York will begin what's being called the most aggressive antibody testing campaign in the country. The governor says that it is the first step in reopening the state, but there are questions about the accuracy of those tests. Fox 5's Reagan Medji is live in Corona, Queens with that story for us. Reagan.
Yeah, Laurie, so this testing is basically supposed to provide a snapshot of the state to see who, in fact, has been infected with the coronavirus. And in a state of 19.5 million people, about 3,000 people will be tested. Governor Andrew Cuomo says this is basically to make sure we know where we stand as a state.
How many people were infected? How many people had coronavirus but self-resolved? We don't really know.
But the hope is with this new antibody testing, the state may soon get those answers. On Sunday, Governor Andrew Cuomo explained the state has reached a high point in a plateau. And if this trend holds, we're past the high point and maybe starting the descent. He believes testing is a critical next step in reopening the state, especially in cases where the virus has gone undetected.
Now that we have the approved test, we're going to be rolling it out to do the largest survey of any state population that has been done.
According to the World Health Organization, antibody tests are designed to find out whether or not a person's immune system has successfully fought off the coronavirus. But a panel is warning the results don't imply a person has developed immunity to the disease.
Right now, we have no evidence that the use of a serologic test can show that an individual is immune or is protected from reinfection.
Plus, some of the tests have issues of sensitivity. They may give a false negative result.
Nevertheless, Governor Cuomo has a positive outlook regarding the testing. He's also joining other governors asking the federal government for $500 billion in state aid. For New York, that would help prevent cuts in schools and hospitals. But here in the city, Mayor Bill de Blasio has announced slashing more than $2 billion in municipal services over the next year and called out President Trump yesterday for not taking action.
How on earth do you think that New York City, which has been the epicenter of this crisis, can get back on our feet without federal support? My question is, Mr. Trump, Mr. President, are you going to save New York City, or are you telling New York City to drop dead? Which one is it?
And now let's talk about recreation. The governors of New York, New Jersey, Connecticut announced this weekend that marinas like here at the World's Fair Marina in Corona, Queens will start reopening for personal use. So vessels like the ones here behind me, okay, not okay. Take a look over there. Skyline Princess, still suspended, chartered and rented vessels. And another thing, the golf courses. A lot of golfers out there, the weather's starting to turn. Those golf courses, some of them in the state of New York, will start reopening. But of course, those strict coronavirus restrictions will be in place. We're live in Corona, Queens. Reagan Medji, Good Day New York. Laurie, back to you.
All right, Reagan, thank you. Well, dozens of people defiantly ignoring social distancing orders and packed into a party at a barbershop in Canarsie, Brooklyn. It's an area that has seen hundreds of COVID-19 cases. The mayor asking all New Yorkers, if you see someone defying social distancing orders, to call it in. Our Lisa Evers has that story.
You wouldn't even see 50 people in the barbershop in normal circumstances. So to see 50 people in there now is a little ridiculous.
The MV Barbershop at East 87th Street and Avenue L was jam-packed with people Saturday night. Some called it a video shoot, but police called it a direct violation of the ban on social gatherings. 60 people were issued summonses, and a 30-year-old man and a 28-year-old woman were arrested on multiple gun possession and other charges.
There was a gun inside of there. You could have got killed.
I understand.
You could have got killed
but to
tonight.
Be doing your
Do you understand?
Unjustly,
Do you understand?
unright,
You were in there with 100 people and there was a gun in there. They could have shot it up. I'm telling you the truth.
Some at the scene complained of selective enforcement in the predominantly African-American and Caribbean-American Canarsie community. But NYPD Chief of Patrol Terrence Monahan tweeted that police responded to similar crowd complaints at the synagogue at 770 Eastern Parkway in Crown Heights. Mayor de Blasio says initially there will be warnings, and if they're ignored, fines of up to $1,000. He wants New Yorkers to call it in when they see it.
This is not snitching. This is saving lives.
That was the point this sergeant was trying to make at the scene.
In a world epidemic right now. Do you understand what's going on with the world? All right, this is not a funny matter. When there's 100 people, listen, when there's 100 people crowded inside, you putting your family, you putting your mother, you putting your daughter, you putting everybody. I don't know if you even have kids. You putting everybody at risk.
Definitely understood.
Yeah, but this is not a game, okay?
Mayor de Blasio says police and parks enforcement will be stepping up patrols and enforcing social distancing, and that the purpose of all of this is to save lives. Lisa Evers, Fox 5 News.
Mayor de Blasio tweeted a plea for survivors to come in and donate their blood. But it turns out that some who are eligible, even prime candidates, are being turned away. Our Chris Welsh has the first TV interview with a local survivor who was denied a chance to save lives.
I was denied. This is a man who thought he would be donating plasma to perhaps save someone with severe coronavirus. Lucas Estock suffered through COVID-19 for the past month. He recently went back for a new test to be certain he was negative. He was. He got checked to see if he had the antibodies. He did. Not only that.
They said that I seemed like a prime candidate.
So he went to the New York Blood Center.
They asked if I'd ever donated blood before, and I let them know. Not since I was in high school. I haven't really been able to.
That's because Estock identifies as a gay man, and gay men have been prohibited from donating blood ever since the AIDS crisis of the 1980s. The policy was revised slightly in 2015. Gay men could now donate as long as they hadn't had same-sex relations in a year. But this month, in the wake of COVID-19, the FDA made another change. Due to the urgent and immediate need for blood and plasma, if gay men abstained from sex for 3 months, they could donate. Estock was now legally eligible for the first time since high school.
And without really thinking about it, I just said, I'm a gay man. And the immediate response to me was, well, you will not be donating today.
What was going through your head at that time?
A lot. Confusion, anger. I, at that moment, kind of remembered and realized that there were 5 or 6 staff members within easy earshot working in that small waiting room space, and 1 or 2 other donors, and this had happened in front of them. And so I was also embarrassed.
Despite the FDA saying their new guidance was effective immediately, not for Estock and not for other men nationwide, judging from the response to his Facebook post, now shared over 20,000 times. What is the hang-up, though? Why can't more gay men donate now?
Blood centers are heavily regulated by the Food and Drug Administration.
Kate Fry is CEO of the nonprofit America's Blood Centers.
What's happening right now is blood centers are working to update all of their processes, forms, education, training of their staff in order to welcome these new individuals as donors. And so that is expected to take on average about 2 to 3 months.
The FDA, in a statement to Fox 5, says blood banks would need to update their donor history questionnaires to screen donors consistent with the new recommendations. How does that make you feel to be told that essentially the only reason you can't is because their computer's not updated or their questionnaire doesn't have the right questions on it?
It's unacceptable. We're in a global health crisis right now.
The New York Blood Center tells us they hope to begin accepting gay and bisexual men by mid-May. Chris Welch, Good Day New York.
New York City Sanitation Commissioner and COVID-19 food czar, Catherine Garcia, joining us this morning. You've worn a lot of hats, Commissioner, haven't you?
Yes, I've worn a lot of hats. This one is particularly challenging, but so important.
Talk to us about this new role. When I was watching last week in the press conference where you're sitting by the mayor's side, talking about this dire situation that now so many New Yorkers are facing. We have 1.2 million New Yorkers on a regular basis that are food insecure, and now this is certain to strain the system.
No, certainly we're seeing very, very high demand at all those portals that you can get food through, whether or not that's a food pantry or where we opened up the schools so that you can go and get meals at schools across the city, or for those who are very, very vulnerable, doing home delivery for them.
So when the city's investing $170 million, what specifically will that do?
So really, we'll make sure that we are distributing the food that is coming into the city to our most vulnerable people and ensuring that people get fed. For example, in the last few weeks, we had done, when we announced the plan, over 4 million meals had been delivered or given out. As of yesterday, we were already up to 6.2. So the demand for food is just skyrocketing, but we want to make sure that we can meet it.
One positive to this also I've seen, when so many of our livery drivers and our taxi cab drivers are not able to work that much because people aren't going outside or people don't have their jobs anymore. But you found a way to secure their employment, some 11,000, is that correct, that are helping with food delivery?
Yes, no, so this I think has been one of the more creative ideas that came from the team, was to really pair that resource with a need that we had to get food, particularly to the elderly across the city. And so we have distribution sites where they come, their cars are filled up by the National Guard, they're given a route, and they go do the delivery. It's a win-win for them and for that senior or that ill person who's receiving food.
Are you working alongside all the other different entities? I think of like City Harvest, who recently, they just had a special last week raising money, and some of the other organizations. Are you working in tandem with them, or is this solely the city?
Oh, no, absolutely. Part of that $170 million is going to go directly to those food banks. We think that they're critical. They're on the front lines. And we want to make sure that they know their clients and people who come to them, and they are able to expand to meet the new need. So portion of this funding is going to be directly to them. So we are working hand in hand to make sure there are no food deserts in the city.
In your role as a food czar, are you also overseeing these guidelines that the mayor talked about the other day of making sure that customers are wearing a face mask when they go into a grocery store, and that a grocery store owner has the right to refuse entry to that individual and can call 311? Will you also be over that?
Right. So we've been talking to the grocery stores. They're a critical part of the supply chain about what their needs were. And some of that was helping them connect to vendors for personal protective equipment for their employees, but also telling them what they were allowed to do in terms of not serving people who don't come in with some sort of face covering. So making sure that we had those guidelines out there for them so that they knew the rules of the road and really were able to protect their employees. You know, their employees get sick just like anybody else if they're not protected.
Oh, I'll tell you, each time I go into a grocery store, and what I'm noticing now is that I see NYPD parked right outside. I was at Gristedes the other day, I went to Food Town, or I was running by it, and you see our law enforcement parked strategically in front of these supermarkets.
Yes, I think that there have been some cases where those locations had crowding and not social distancing. And so when they call, the police will come to make sure that customers are standing 6 feet apart, because we need to take care of each other through all of this and follow the guidelines.
So, Commissioner, where can people get some information if they should have the need for one of the food pantries or to get some of the food delivered? Is there somewhere where they can go?
Absolutely. So at nyc.gov/getfood, there is a map of every single location of a school that could provide food. There's also a map of all of the pantries that are open and other resources that you may need to get food.
Do you know how long this is going to last, this service from the city? Are you looking at the end of the year?
We are planning for the worst and hoping for the best. And hopefully the federal government also will come through with some additional food stamp benefits so that people have money in their pocket to be able to buy their own food.
All right, Catherine Garcia, NYC Sanitation Commissioner and now COVID-19 food czar. Stay safe. Thank you for being with us.
You too.
Okay.
Thank you so much for having me.
A complicated issue with no clear-cut solutions. Faced with coronavirus outbreaks in area prisons, and many prisoners are applying for what's called compassionate release, but not all of them should be let out of prison. Joining us this morning to discuss complicated decisions her office is having to make and the decisions that she's having to make all the other districts in the area, Queens District Attorney Melinda Katz. DA Katz, thanks for being with us this morning.
Good morning, Lori. Thank you for having me.
Last time we spoke, you were in the throes of trying to survive through COVID-19 yourself. What's your progress report?
I was in the throes of trying to survive it, like many New Yorkers today, and we are a tough city, the city of New York. We're New York tough, as they say. I was very thankful. I had a mild case. I had a fever that was quite high. I had a little nausea, a little coughing. But, I'm one of the lucky New Yorkers. I was able to self-quarantine with my family, with my children. We were all together. We weren't isolated and alone, as so many New Yorkers are. And we were able to get through it together. And, I consider myself very lucky for that. And because of that, I'm able to get back into the office where there's a lot of social distancing going on, as there should be all over the state of New York and all over the United States. But, we have 700 employees, 320 lawyers working mostly from home. We're video conferencing. The Supreme Court is video conferencing, criminal court. We actually did an appeals argument, quite a few of them, by Skype. So the office is running, and we are making sure that we make it happen through this crisis.
And as we deal with our overcrowding prisons and the prisoners there that now are facing the complication of perhaps catching COVID-19, and many of them are asking for this compassionate release.
Yeah.
So ultimately, a judge makes a decision, but in part they make it based upon either your support or arguing against it, correct?
Well, most of it depends on what they're at Rikers for. And I think it's important for your watchers and for you to know, as of yesterday, there were 3,923 people at Rikers. And 5 years ago, there was 9,718 people. And the city's making a real concerted effort to lower the population at Rikers. As you know, Rikers holds those that are city sentenced, holds those waiting for bail or on bail, holds those that are waiting to be sent up to state prison. And so it was a very complicated process to figure out how many to release pursuant to this pandemic we're going through.
Right.
We released almost 100 people, just going with the Defense Council, making sure that we didn't have any objections and that we consented to it. There's about 170 parolees or so that we, that are not objected to. Many of them are violators, parole
what
violators.
type of violations? What makes the difference between you saying no?
Well, you look at every case individually. The first thing you want to look at is the health conditions, and we discuss it with the Department of Corrections and also the correctional health facilities of the individual defendant. Next is the underlying crime that they're in for, whether they're a violent offender, whether it was a misdemeanor, whether it was just a violation. And you want to make sure that, especially if they're in for something like that and they've done already a lot of the time, so someone did 6 months out of the 7 months or 8 months out of the 9 months, we were releasing them.
I was going to say, one of those individuals that you decided not to offer the compassionate release, although they had applied for it, was Christopher Ransom, who was accused of killing NYPD Detective Brian Simonson. Was that because of the magnitude and the gravity of why he was imprisoned?
It was because of many reasons. Number one, we looked at the underlying crime. I myself personally watched every single video of him robbing the phone stores, and there were 5 of them, and they were quite a sight to see. And the last one in the video of him during the shooting of Brian Simonson was a very, very large part of it. But also the underlying health conditions weren't exactly proven, and I think it has to be a balance. It also needs to be decided as to whether or not the person is a flight risk, whether they're going to show back up in court to face the charges that they are being charged with. And when someone is about to face life in prison or 25 years to life, it is difficult to say that they might show back up. But I think you had to look at the violence of the crime. I think you had to look at the repetitiveness of a crime. And I think you had to look at all of the circumstances surrounding his incarceration.
All right. Well, thank you for the update on the compassionate release program. Good to know that you are healthy and back to work. And I assume your staff members are too, and that the judicial system is still working even through all of this.
We are working towards compassionate releases. We understand the difficulties inside at Rikers, and we want to make sure that we do all we can to keep all New Yorkers safe.
All right, Queens District Attorney Melinda Katz, thank you so much for being with us this morning.
Thank you.
Well, social distancing problems, racial inequities, lack of testing, just some of the problems that we're facing daily as the coronavirus pandemic continues. But there are many things that we can control. Here to help us this morning is the president of the American Medical Association, Dr. Patrice Harris from Atlanta, Georgia. Dr. Harris, thanks for being with us.
Thank you so much for having me.
I had to ask you, I know that you have been a real champion when it comes to the healthcare professionals who have been lacking their PPE and some equipment at the various hospitals. We know the president is now talking about that he and Congress are very close to approving another relief bill that would specifically target getting money, some $75 billion to hospitals in need. That must give you some comfort.
Well, certainly any news is encouraging, because what I continue to hear from my colleagues on the front line is that while it has gotten better over the last several weeks, there still is not enough PPE in certain hospitals. And as we are even planning, certainly we are not ready to loosen our restrictions immediately, but as we are planning to loosen those restrictions, we are going to need even more PPE as physician practices are opening up. So that is good news. However, we will wait for the results.
I know you were part of a very small virtual meeting with the president in which you were able to express some of your concerns. Were these the type of issues that you brought to the president's attention as regards to the healthcare workers, or were there other things that you thought needed his attention?
Certainly, we raised the issue of PPE. We raised the issue of testing. We raised the issue of the viability of physician practices throughout this. You know, some physician practices stopped doing elective surgery. Certainly, many physician practices are appropriately seeing less patients because we certainly don't want to spread the virus. Fortunately, though, we are seeing our patients through telemedicine, through the use of the telephone and the computer and Skype. However, we do want to keep our eye on the ball and make sure that physician practices remain viable throughout this period.
We've been also looking at the disproportionate amount of people of color, African Americans, Latinos, that are suffering at unbelievable numbers now as the pandemic expands, and trying to get to the root of why. And also having some accountability from the CDC. I know the Congressional Black Caucus has asked for them to be able to provide real numbers to be able to study this more.
You know, those numbers were and still continue to be quite troubling. Unfortunately, we don't have those numbers nationwide, and we don't have those numbers in a way that we can really analyze the data. We want the data to be standardized. And so, yes, the Congressional Black Caucus did. The AMA, the NMA, the National Hispanic Medical Association, and others also sent a letter to HHS asking that they begin to not only collect that data, analyze that data, but make sure we get the data so that we can target interventions to communities that need it most.
And you've also have not been a supporter of hydroxychloroquine, which is typically used with people who have Lyme disease, with malaria, with lupus. You have said, unlike the president, and even Dr. Fauci has raised that we need to be cautious moving forward. There's not enough testing about this particular drug and its use for COVID-19.
You know, the point I was making, actually, and let's make sure we all hold to this point, is we have to let the science and the evidence and the data really lead us to decisions about treatments. And we are early on in any studies, any of those controlled studies that we need before we decide whether or not a treatment works or not. And so at this point, we do not have any rigorous clinical trials that support any medicine, and we also have to be very cautious because any medicine, any treatment alternative can cause negative side effects. And so we know that we've heard that hydroxychloroquine actually can have a negative side effect of a heart arrhythmia. So it's really not about being pro or con one medicine. It's really about pro science and the evidence, and let's not recommend any treatment alternative until we have the evidence.
You've also, as we try to understand this through this time that now is going on 3 months here in the U.S. I think it was the first case was 3 months ago. But the wear and tear on your mental being, of being isolated from loved ones, of having your favorite restaurant closed down, of the social distancing and the wear and tear that it's taking. And you do offer some tips, some advice on how to not allow the anxiety to get the better of us.
I do. And, you know, this particular pandemic is really elevating a couple of issues that we knew were already in existence. And so it was the health inequities regarding these numbers that we just spoke about. But also what is elevated is our mental health. And of course, we knew that pre-COVID-19, we were seeing increasing numbers of suicide and increasing numbers of children with anxiety. And so now we are in the midst of a pandemic where we see anxiety and worry and fear and grief and loss. And so the first thing I recommend everyone do is identify those feelings and allow yourself to feel those feelings. You shouldn't beat yourself up about anything that you're feeling, because we don't have, we can't control everything. But we need to take those feelings and channel them into actions. We can do certain things, and that we can physical distance. We can develop new routines in our homes. We can call for help when we need it. Hopefully we are connecting more. I use the term physical distancing because I want us to maintain our social connections, and now is the time to do that. And so first of all, we have to take a moment every day to breathe and get centered. And finally, there's so many other things to do, but I also recommend sometimes stepping away from the TV and social media. You have to take a break. We certainly want to be informed, but sometimes you have to take a break and get out and move. Get out and exercise if you have the open space and a space where you can physical distance maybe around your home. And I'll make one more point.
Sure.
Not everyone has the privilege of doing some of these things, so we have to always keep that in mind. I saw something on social media that I really like. It says, we are all in the same storm, but not in the same boat. But many of the tips that I've offered, everyone can do. But if you need help, ask for it. Most of the states have toll-free lines.
I like that. We are all in the same storm, but not the same boat. All right.
Yes.
Dr. Patrice Harris, president of the American Medical Association, thank you for being with us this morning. Thank you for the tips on how we can try to be a little less stress-free. Thanks so much.
So good to be with you, Lori. Appreciate it.
Not rising to the challenge. That is how New Jersey Senator Cory Booker describes President Trump's response to the coronavirus right here in our area. Shutdown will continue until at least mid-May, and the economic impact continues to grow. Congress has been trying to ease those economic problems, but is enough being done? Joining us this morning, live from his home in Newark, New Jersey, Senator Cory Booker. Senator, thanks for being with us this morning.
Thank you for having me. So grateful to be on.
Well, we hear news this morning that Washington might be actually working, that President Trump and Congress are close to brokering a deal of $250 billion. Can you tell us, don't know what that sound is, but my understanding is, so 75 will go to hospitals, and then is the rest for small businesses? Can you break it down for us?
Sure. Well, nothing is settled yet, but I spent a lot of my day sort of around the clock yesterday trying to get into the weeds of fighting not just for hospital money, but we also need, especially if New Jersey is going to be able to emerge out of this, to make sure we have more testing resources to set up a system to test and track. So we were able to dedicate more money so states have those resources. And then for me, it wasn't enough to just re-up that small business account that so many of our New Jersey businesses, New York businesses have been getting a lot of resources. Billions of dollars have already gone into our two states. But I wanted to make sure that there was money being set aside for smaller businesses that couldn't get to the table to get that money, and nonprofits as well, because they didn't have banking relationships, because they couldn't get in line quick enough with better positioned businesses that were able to had a bank that was willing to work with them and got in line quickly.
Minority businesses in particular?
A lot of minority businesses, yes. Unfortunately, over 80% of black businesses, for example, are sole proprietorships. And then you have a lot of them don't have those bigger banks that they're working with. So what I think is going to happen, and what I've been working hard for, and Chuck Schumer and Gillibrand and Menendez, we've been working really hard to get dedicated money for those small community development financial institutions, minority-owned banks, and more that can really help us get those loans out to those smaller businesses right now that have not been able to get to the table, and nonprofits.
You know, the other thing that we're seeing and been talking about within the last week or so is this disparity, the disproportionate amount of African Americans and other minorities that are getting COVID-19, and trying to make sure that they also are getting the health care that they need, and why it's getting to be at this proportion.
Well, this is something that right now it doesn't look like we were able to be successful on, and Republicans were really holding the line. But you know, look, as a guy who used to run a fire department when I was mayor, if you're going down a street and there's particular buildings that are engulfed in flames, massive flames, you allocate your water resources where these big problems are. But we have these hot zones right now that are not getting the resources they need to do the things to stem the tides of this massive death rate. And so we are in an unfortunate, distraught reality, from Native Americans to blacks and Latinos, who are dying at proportions so much higher than the general population. And we've got to be committed to a philosophy that we're going to leave nobody behind in this coronavirus crisis. And so this is work that we have to do. And I'm going to tell you, there's got to be another COVID package, not only to deal with that problem, but there's a big problem in the tri-state area, which is going to be unfortunately, that state and local governments are running out of money. And we are going to face a crisis that I don't think people realize, that if we don't get support from the federal government, you're going to see layoffs and critical services cut in the coming year because states and towns are exhausting their resources fighting this crisis.
You know, speaking about fighting this crisis, we look at an Andover with the nursing home where 17 bodies were found. We know now that many of these nursing homes across the country are like a ground zero and a breeding ground. I told you earlier, my mother is in one. They have 6 cases where she is, 1 death. You have to start to rethink how we address this problem. It's almost as if they're trapped with nowhere to go and very vulnerable.
And again, you know, in Hurricane Sandy, I had a lot of seniors in facilities that were trapped in buildings. Elevators weren't working because we had those power outages, and we went to rescue those folks. This is a different circumstance, but the same philosophy is that we, again, have to take our nursing homes, and this is where Governor Murphy and his team are acting in a pretty strong, aggressive, and committed way to start to begin to see them as they are. These are circumstances where people are in these hot zones, and we have to take steps to get those nursing homes more resources as well to deal with this, because your mom, my mom's in a senior community. These folks are so vulnerable to COVID, and we've got to, again, leave nobody behind in this crisis.
All right. Well, Senator Booker, certainly wish we had some more time because I want to, you know, I know there were protests going on in Trenton where people want to reopen New Jersey. So that you'll have to come back so we can talk about realistically when the state can reopen, because I know it's state-by-state basis.
Yeah, I would very much like to do that.
All right, Senator Cory Booker, thanks for joining us this morning. We appreciate the time. And today's hero of the day, the Bergen Restaurant in Crown Heights, Brooklyn. The Bergen has teamed up with the Brooklyn United Music and Arts Program to help feed hungry residents in their community. It all began 3 weeks ago or several weeks ago with free brown bag lunches, but it's now expanded to lunch and dinner. Check out how delicious this food looks. Lunch is given away every day from 11:30 a.m. until 1:30 p.m. And dinner is from 4:30 to 6:30 p.m. Everything is being paid for by private donations. The restaurant is located at 1299 Bergen Street. And as you can imagine, lines form pretty early, so you want to get your spot. Ooh, that does look good. The Bergen Restaurant. Well, we have a resource available for extended information regarding the outbreak. It's called coronavirusnow.com, and it was created by Fox. It offers daily content from health officials and breaking news from both our area and across the country. Black Americans have been disproportionately affected, though, by the COVID-19 pandemic. The BET Network is gathering leaders in the creative, civil, and business communities to provide resources to those hit the hardest. Grammy winner Fantasia is lending her voice and her spirit to their Saving Ourselves, a BET COVID-19 relief effort special coming this Wednesday. And Fantasia is joining us now from her home in North Carolina. Fantasia, gorgeous lady, thank you for being with us.
Thank you for having me.
How is life in North Carolina for you right now, quarantined?
I mean, I think it's just like it is for everybody else, making the best of it. I think the most important part for me is waking up every morning and still trying to keep a regular routine for my children, and try to remind them that we're blessed. We're blessed to be waking up to see another day. Every now and again, I allow them to watch what's going on in the news, and then outside of that, I stay in tune. And a lot of people didn't wake up this morning, and a lot of people are battling and suffering from the COVID-19. So what I'm doing is making sure I keep my kids prayed up, making sure that we pray for everybody that's around us. And if I can lend or help somebody who needs it, that's what I'm going to do, because we're all feeling this. Whether you are a celebrity, whether you are young, old, it has no age, it has no color, and we all got to come together in this time. You know what I mean?
I do know what you mean, and I would imagine why this is so dear to your heart to be able to help out with this special that's on Wednesday. Tell us the significance of it for you.
You know, of course, when they call, anytime BT or Jesse or Kurt Franklin, any of them call me, I try to be there. But this was very important to me because music is a healer. And for me, just walking around the house singing or hitting that stage, it's a healer for me because we all go through things. This came, but before all came, people struggle with a lot of different situations. So music is something that people turn to as a healer. And I felt like this is an important time for all artists to come together and just put out some music that people can listen to, feel encouraged, feel inspired. And I believe everybody that you're going to hear is singing their butts off because we haven't hit the stage in a while, and we've been waiting to do that, and we also want our gifts to bless people. So I came in my bathroom. I've never done this before. I've never recorded like this before, but I believe I got so lost and caught up in the song and the words and the lyrics that Kurt came up with, and I had a good time. So I think people are going to enjoy themselves by what all the artists have come together and we put together for them.
And you mentioned some of the artists. So it's hosted by Anthony Anderson, Kelly Rowland, Terrence J, and Regina Hall, with appearance by DJ Khaled, Charlie Wilson, Chance the Rapper, as you mentioned, Kirk Franklin, and then a partnership that they have with United Way and the NAACP as well, right?
Yeah, yes. Which is very important because we are raising money. I know me and my husband are giving, and we just want to raise money for the families who do not have what we have, who wonder what are they going to eat, how are they going to eat, how are they going to keep a roof over their head. And I'm talking, and I'm not to cry now because I'm a mother.
How old are your kids, Fantasia?
My daughter's 18 now, and my son is 8 years old. And so, it's a lot of people out here hurting and struggling. So my prayer is that people, even outside of the music, because I know the entertainment is going to be good, but I pray people will just pick up their phones and just donate. I don't care if it's just $1. It goes far, and it's going to help somebody. So I had to be a part of this. I wouldn't have missed it for nothing.
Well, you came on the scene back with American Idol season 3. It seems as the winner. Seems so long ago. You were a kid.
I'm not a kid anymore, though. I've grown, and I've seen some things. I'm wiser. I'm stronger. And again, like I said, I'm blessed to just be sitting here speaking with you. We're blessed. We're blessed to be. Our bodies are healed. We're not, dealing with the COVID, and we're being safe. So we're blessed.
All right. Well, the special is going to air 8 p.m. on BET. It's called Saving Ourselves, a BET COVID-19 relief effort. God bless you for what you're doing and the other entertainers and celebrities that are a part of it. And you look good. I told you our paths crossed years and years ago. You were the entertainment, and you were on fire for the Jackie Robinson Foundation. So it's great to see you again.
Good to hear your voice and good to see you. Stay blessed, and I'll be praying for you guys.
All right. Thank you. Same here.
Thank you.
COVID-19. The question remains, can you get the coronavirus twice? Dr. Mehmet Oz is joining us with some answers. Dr. Oz, good to have you. Happy Monday.
Hey, Laura, it's the big question in everyone's mind as the governor says we're going to do the most antibody testing in the country. And I know my institution, New York Presbyterian, is starting that today. Many of us now thinking, okay, well, does that mean I'm going to be safe for good? And the reality is we don't know the answer to that. As startling as it may sound to some, having had this illness once may not guarantee you can't get it again, but we don't know. So here's what I did. I asked Dr. Ian Lipkin, the famous virus hunter, to come join me and talk through what's going on in South Korea. They've got over 100 people who tested negative. So they had the virus, they tested negative, so they were over it. And then later on, they developed symptoms again and had the virus again in their body. Now, is it because the tests that said they were okay really were inaccurate? And they just maybe had less of the virus, but it was still hiding there? Or is it because they truly got reinfected in some way with this virus? Now, our past experience with SARS, it would indicate you'd be protected. Coronaviruses generally give you protection for a while. I'm still hopeful that's the case for the vast majority of folks, but this does matter because even if a lot of people prove to have had the infection in New York, and I'm positive we have many more people who are infected than actually we have tests on, because none of us would get tested. We couldn't get tested, just like in California, they were able to show it over the weekend. Many of us still may need to be careful.
In fact, we do have a clip, Dr. Oz. Let's take a look.
If you have good testing systems, as they have, for example, in Germany, which is where they really held down their morbidity and mortality, you can, while it's still small, you can actually identify all the people who are infected. You can cluster them together, and you can protect the rest of the population. So asymptomatic carriage of the virus is worrisome, but it's not a problem that we can't address if we have sufficient testing capabilities.
You know, Dr. Oz, I also have to ask you, we've, of course, flushed out hydroxychloroquine, but I keep hearing about this new drug also, and maybe it's not that new, called remdesivir, which has been used with Ebola, and I know was tested on monkeys. Is that a possible drug that can be used for COVID?
It could be used. It's going to be in a different setting than hydroxychloroquine. Hydroxychloroquine, if it works, and the clinical trials that are ongoing, I just had the principal investigator of the biggest trial of the show this week. But that would show us that it works either to prevent you from getting it in the first place, or that if you take it early after your symptoms start, it might be beneficial. Remdesivir is an antiviral. So it's not going to influence whether the virus gets into you. It's going to slow it from growing once it's already in you. So in an ICU setting, for example, when you were struggling, it might be beneficial. And there was data that was, I think, inadvertently released last week showing that, at least following a bunch of patients in ICUs, they seem to do better than we would expect. It's not randomized control data. We can't rely on it as much as we'd like to. This is a critical addition, though, if it's effective.
And I also heard that some of the after effects, side effects of getting the coronavirus can be kidney damage. I also heard about blood clots. There was a Broadway actor here who had his leg amputated after surviving it, that it can affect your platelets, all of these things. So we're still learning the ramifications of it.
Well, Lori, there's three basic things we have to deal with. There's how does the virus get into your body? That's determined to a large extent by your age. That's why young people seem to be preferentially spared, thankfully, certainly from getting bad side effects. Then there's what happens when the virus is growing in you. How do we stop that? And then, this is really important, there's the body's immune response or over-response to the virus. So in a lot of more sick cases, the real problem is not the virus, is that your body's waging a civil war, and it starts to take out collateral damage, right? It starts to hit parts of your body that were innocent, like your kidneys. It'll start to block off blood vessels, like happened in that terrible case where that Broadway actor lost his leg because his body was reacting to the virus, inadvertently attacked his arteries and closed off his blood vessels. You also have blood that starts to clot too much. So all these are different reasons why people can get injuries of their kidneys, their hearts, their heads, and their legs. And so I think part of our battle here is going to be slow down the immune response so it's not quite so aggressive.
And speaking of slow down, so just when we thought that heat was supposed to slow this virus down, we're hearing that heat really does some, you know, there was a study that was done that heat doesn't have an effect unless it's at 200 degrees Fahrenheit. That's the only thing that can kill this virus.
Right. I mean, I spent most of my life trying to be a field guide, so I want to focus upon what really matters. I don't think that trial is important to us, and here's why. Okay. It was done primarily to figure out, can you actually examine and work with this virus safely? And it turns out it's more difficult than we think. However, that's not why it would slow down in the summer. It's never going to get hot enough, obviously, to burn the virus to death. It might slow down because with humidity, the virus might plump up a little bit, wouldn't travel as far. So instead of 6 feet being the social distancing target, maybe we'd be safer even at 2 or 3 feet. Not that we should move personally, but it might let us get away with intermittent errors when someone gets too close to us. In addition, when it's warmer outside, we all go out to Central Park and spread out, right? We're not crowded in buildings and elevators, and that additionally will separate us. So social distancing is the goal. The temperature affects that, which is why it's beneficial, we think.
All right, so that study is just noise, and we're not going to pay attention to it right now.
We have enough things to really focus on.
All right. Thank you, Dr. Oz. 1 p.m. right here on Fox 5. Have a good day. And you can keep up to date with the very latest on the coronavirus outbreak by downloading the Fox 5 NY News app. You can also stream the show. You can never miss a moment. Search Fox 5 NY in your app store. Lewis Howes is the New York Times best-selling author of The School of Greatness. Also, the name of his top-rated podcast with more than 200 million downloads. He's also wrote The Mask of Masculinity. And during these unprecedented times, this high-performance business coach has some tips to help us stay calm and zen-like during the crisis. Lewis Howes joining us now from Los Angeles. Hi, Lewis.
How's it going? I don't know if we can be zen-like all the time, but the goal is to be there sometimes.
Yeah, in part because we feel so vulnerable, so helpless, so not in control that it has us, it's the unknown.
This is where I think athletes learn how to handle pressure. They learn how to handle big moments and stress on their body. And I think athletes tend to have that skill set of being calmer under pressure. And that's what I want people to be aware of, kind of have that athlete mindset that you can't really control anything that's happening around you. When you're in a big game or a big moment, you can't control what's happening around you, but you can always control your emotions and your response to any situation, and that's what I want people to be focused on.
Well, I told you I watch your podcast all the time, and I was watching, you had a recent guest on who said the anxiety of not knowing is greater than if we knew there was a bad outcome, that we could at least handle the certainty of that.
Exactly. The uncertainty, we have no clue. Is this going to end in a week, in a month, in a year? We have no clue, and I think that unknowing is unsettling. And the more we can just focus on, okay, it's okay if we don't know when this is going to end or when we'll be able to go outside and go back to normal life. And how do we get comfortable with the uncomfortable? And that's really the key.
So looking at some of your tips on how to stay calm during this crisis, number one is keep life simple and clean.
You gotta clean out your life. You gotta clean out your mental space, your physical space.
Does that mean like sanitizing clean, or does it mean like ditching old clothes? Like, what does it mean?
I think, literally the first weekend this all went down, I started feeling cluttered in my life. I was like, I don't know where my finances are at. I don't know where my clothes are at. I don't know where anything is at in my life because I've just been on autopilot, going and being productive, taking action, going out, working out, doing all these things. And this is a time for us to reflect. So literally, I cleaned out my closet. I felt, a sense of relief. I have control over my space. Let me take control of that. I can check my bank account and see which payments that I don't need to be paying anymore, what I do need to invest in more. And I can optimize and clean that out. I can take a look at my physical body. I can do all these things and say, what are the actions I can control and clean things out in my life?
What about have compassion for people? That's another tip of yours.
I think a lot of husbands have probably heard this saying over and over again, don't try to fix me, just listen to their partners and spouses, right? And I think this is the time where we listen and have compassion more than ever. And as someone who wants to coach and wants to try to help people, the best thing that you can try to do right now is really just listen to people, because when we have emotions, they need to get out. They need to be expressed. And by stopping someone or trying to push them somewhere they're not comfortable with yet, it's going to do more damage. So just listen to people, have compassion. Don't try to fix them. Listen, but don't allow them to stay in the fear also. So start to push them a little bit after you listen, and do your best to really support people in your life, your friends, your family, and your local business.
Because there's a lot of people, Lewis, that are having to live with each other in hours that they never thought were imaginable, and they are at the end of their rope.
I have learned more patience in my life right now, being in a relationship and living with someone without having as much space as I'm used to. You've got to really learn new skills, and patience is one thing for all of us.
All right. Your third tip, business as usual. How can it be business as usual when nothing is as it once was?
You got to find a way to make your life feel normal by being productive in some ways. And listen, I'm okay with, if you need rest, if you need to recover, if you just got to watch Disney Plus or Netflix all day.
I got to interrupt you. I'm so sorry. We got to go. We have a resource available for extended information regarding the outbreak. It's called coronavirusnow.com. It was created by Fox. It offers daily content from health officials and breaking news from both our area and across the country.
And that is the place you can go to if you want to continue to watch more news stories and updates from across our country. Going to be getting things ready to shut it down on the YouTube side. So if you're with us on YouTube, thanks so much for being here with us each and every single day. If you haven't yet, you can subscribe to our YouTube channel with Fox 10 Phoenix. That way you can stay up to date all the time. But again, we are going to be shutting things down here for the night. if you want to continue to listen to more stories. I'll just give you a little preview. Not only do we have another weekly financial facts and questions, this one on the stimulus checks, but we also do have a interview about what restaurants are probably going to have to do, not only once we do start seeing restrictions being lifted, but also in the next year or more to come. Also, there's a new cool item called Medical Staff Now, which you'll be learning about, plus healthcare heroes. So there's lots of stories going to be coming up here on the coronavirusnow.com stream. So once again, thanks so much for being here with us on News Now.